Okay, are we ready?
Yes, we are. Bismillah.
Bismillah. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, brothers and sisters in Islam and respected ulama. This is Dr. Hamar Jafri. I'm from Houston, Texas, and it's my privilege and honor to start the meeting with Tilawat al-Quran by Brother Kazim Sayed from Seattle, Washington. Bismillah, Kazim.
Can you guys hear me?
Yes.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. من المؤمنين رجال صدقوا ما عاهدوا الله عليه فمنهم من قضى نحبه ومنهم من ينتظر وما بدلوا تبديلا. من المؤمنين رجال صدقوا ما عاهدوا الله عليه فمنهم من قضى نحبه ومنهم من ينتظر وما بدلوا تبديلا. ليجزي الله الصادقين بصدقهم ويعذب المنافقين إن شاء أو يتوب عليهم. إن الله كان غفورا رحيما. ورد الله الذين كفروا بغيظهم لم ينالوا خيرا وكفى الله المؤمنين القتال وكان الله قويا عزيزا. صدق الله العلي العظيم. Now I will read the translation for this. This Surah Ahzab, ayat number 23 to 25. Among the faithful are men who fulfill what they have pledged to Allah. Of them are some who have fulfilled their pledge, and of them are some who still wait, and they have not changed in the least. That Allah may reward the true for their truthfulness, and punish the hypocrites, if He wishes, or accept their repentance. Indeed, Allah is all forgiving, all merciful. Allah sent back the faithless in their rage, without their attaining any advantage. And Allah spared the faithful of fighting, and Allah is all strong, almighty. Thank you.
Keeps us among the faithful and helps us keep our pledge. And I request the chairman of the Board of Trustees, Wazir Islam Maulana Sartaj Zaidi, and he's a founding member of Muslim Congress and founding resident alim and current resident alim of the Ahlul Bayt Association of Michigan in War Lake. I request him to give the opening welcoming remarks for the virtual conference, Living and Shaping the New Norm, from Social Distancing to Social Justice, Muslim Congress 2020. Bismillah.
Thank you very much. أعوذ بالله السميع العليم من الشيطان اللعين الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين والصلاة والسلام على سيد الأنبياء والمرسلين أبي القاسم محمد اللهم صل وعلى أهل بيته الطيبين الطاهرين المعصومين المظلومين. Dear brothers and sisters in Islam, Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you for attending the first ever virtual Muslim Congress conference. I would like to thank the conference directors and all my team members for their efforts in making this conference possible. And I am grateful to Ayatollah al-Uzma, Jawad Amali Hafizullah, for his message. He always grants our requests, and I thank him for taking time out of his busy schedule for us. His message is a guiding light for believers in North America. For the past 15 years, Muslim Congress has been holding successful conferences in the United States by the grace of Allah and with your help. Meeting once a year is no less than a blessing of Allah. Confidence is created by meeting with religious people. The youth meet each other and forge lasting friendship or find life partners. There is a meeting of scholars and spiritual training for the youth. They learn what their human and religious duties are, which is the guarantee of success in this world and in the hereafter. We were not able to have an in-person conference due to the pandemic. But this virtual conference will help us find a way to educate our families. We have introduced a couple of online educational programs and are considering other alternatives to engage our communities. Also, we are focusing our efforts in helping those who are suffering due to financial difficulties and mental anguish as a result of the COVID-19 lockdown. We need your support for our projects. Today, I welcome you at a time when we are confined to our homes because of this coronavirus. Just one virus has changed the world. This virus does not discriminate between rich or poor, or between developed or developing countries. This outbreak has become one of the biggest threats to the global economy. As you know, travel has been restricted, many businesses temporarily shut down, our social gatherings have been disturbed, school and offices closed, and religious gatherings shut down. It is changing how we live our daily lives. We were taking every blessing for granted. Seeing how the global pandemic has affected various aspects of life everywhere reveals the unique nature of the crisis. The secret to success in this difficult time is to adapt according to the needs of the time. During this pandemic, we have a responsibility as a human being and as a believers to help humanity. Helping others is in reality helping ourselves. We cannot survive without the help of others at this time. It is a test for mankind. Even though this pandemic has trapped people in their homes, the warmongers and enemies of humanity are continuously busy in promoting their hateful agenda. In the 21st century, race is still an issue. Islam originally addressed this issue when the Prophet, peace be upon him, made Bilal the symbol of Islam. The Quran declared, indeed, the most honorable among you in the sight of Allah. Inna akramakum indallahi atqakum. There are many arrogant people and leaders who consider themselves untouchable. They think nothing can stop them from murdering people and looting nations to get what they want. Kashmir has been under curfew for almost a year. Muslim and other minorities living in India are being denied the right to live. Despite all this, India became a member of the Security Council. The Modi regime is following the footsteps of Israel. The illegitimate Zionist occupiers of the Holy Land want to take all the land from the people of Palestine. Meanwhile, the world is either helping the occupiers or watching on. The world is ruled by might and law of the jungle is enforced. Dear brothers and sisters in Islam, although there is currently no medicine for the virus, a believer has conviction in supplications. He believes that the Creator is the one who has influence over medicine, and medicine only works under the influence of Allah. So we don't have medicine, but we have the one on our side who has authority over all things. Ya man ismuhu dawa wa zikruhu shifa. O he whose name is a remedy and whose remembrance is a cure. These days will eventually end because of the mercy of Allah subhanahu wa ta'ala. The important thing is our role in this difficult time and how we fulfill our responsibilities. Rather than looking towards others, everyone should look at themselves. God will not ask you about others, but about your individual responsibilities. During this difficult time, connect yourself with the Imam of our time through dua for his appearance. May Allah hasten the reappearance of awaited Imam Ajjallahu Ta'ala Farajahu Sharif. God willing, there will be an in-person conference next year. Astaghfirullah li wa lakum. I seek Allah's forgiveness for myself and for you. May Allah bless you and your families. Thank you very much. Wassalamu alaikum wa rahmatullahi wa barakatuh. Over to you, Brother Jaffrey.
Thank you very much, Maulana Sultan Zaidi. As Maulana mentioned, we will be getting an address like every year from the Grand Ayatollah Jawadi Amuli, a preeminent philosopher, jurist, writer of the Tafsir of Quran, a student of Imam Khomeini, Lama Tabatabai and Ayatollah Burjadi, and has been a teacher at the Hausa for more than 60 years. And he will give us his advice as to how to handle us in this turmoil period in our responsibilities. Please play his recording, please. Thank you.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين وصلى الله على جميع الأنبياء والمرسلين والأئمة الهداة المهديين سيما خاتم الأنبياء وخاتم الأوصياء عليهما آلاف التحية والثناء بهم نتولى ومن أعدائهم نتبرأ إلى الله. مقدم شما نخبگان فرهیختگان علاقمندان به قرآن و اطرت را گرامی می‌داریم. از سعی و کوشش مسئولان محترم این نشست حق شناسی می‌کنیم و از عزیزانی که به راه افتادند و از ره توشه بزرگان طرفی بستند و در صدد اصلاح و اصلاح خود به جامعه هستند سپاسگزاریم و از خدای سبحان مسئلت میکنیم به همگان توفیق صلاح و اصلاح مرحمت کند. محور اصلی بحث این نشست بصیرت دینی است. بصیرت را قرآن و اطرت به خوبی معنا کردن. در قرآن کریم انبیا و مرسلان و اولیاء الهی را بصیر می‌دانند. ابراهیم خلیل را، اسحاق را، یعقوب را، اسماعیل ذبیح علیهم السلام را قرآن کریم اولوالایدی و الابصار می‌دانند و بصیرت را قرآن کریم سرمایه طی طریق و رسیدن به مقصود و شهود مقصود در مقصد می‌داند. دو خطبه از خطبه های نورانی امیر بیان و بیان علی بن ابی طالب علیه السلام در نهج البلاغه اختصاصی دارد به تبیین معنای بصیرت. بصیرت در فرهنگ قرآن کریم به معنای بینایی در برابر نابینایی نیست. بصیرت معنای دوربینی و تیزبینی در برابر کمبینی و نازکبینی و نزدیکبینی است. اون که نزدیک را می‌بیند به دور را نمی‌بیند کور است. اون که ظاهر را می‌بیند به باطن را نمی‌نگرد کور است. در فرهنگ نهج البلاغه یعنی سخنان علی بن ابی طالب سلام الله علیه که عد قرآن کریم است، تعبیر و تفسیری برای بصیرت شده است. فرمود دنیا منتها دید افرادی است که نابینایند. نابینا در فرهنگ قرآن و نهج البلاغه به معنای نابین نیست، به معنای نزدیکبین است. انسان مسافری است که دنیا اول به برزخ و آخرت وسط و پایان راه اوست تا از دارالفرار به دارالقرار برسد. حرکت دائمی نخواهد بود. حرکت دائم یعنی بی هدف و بی مقصد. دنیا دار حرکت است، حتما به دارالقرار می رسد. اون که محور حرکت را می بیند و مدار قرار را نمی نگرد، او در فرهنگ دین کور است. دنیا منتها دید اعماست. کسی که فقط دنیا را می‌بیند، زرق و برق دنیا را، لوازم دنیا را، آسایش و آرامش دنیا را، رفاه دنیا را می‌نگرد و مرگ را پوسیدن میپندارد، نه از پوست به در آمدن و نابودی میداند، نه به بود مطلق پناهنده شدن، اون را فرهنگ نهج البلاغه کور میداند که این دنیا منتها بصر الاعمی، چون دور را نمی بیند یک و باطن را نمی بیند دو. و اما بصیر کسی است که گذشته از دنیا دارالحرکه، دارالقرار را هم می بیند، نتیجه را می بیند، پایان کار را هم می نگرد. فرق این دو دید این است: اون که اهل دنیاست رخدادهای تلخ و شیرین را تماشا می کند، اون که اهل آخرت و بصیرت است رخدادهای تلخ و شیرین را مکتب و مدرس می داند و از اونا عبرت می گیرد. فرق عبرت و تماشا این است که انسان نابینا این حوادث را می بیند و لحظه لذت می برد یا لحظه می نالد، ولی بصیر از این حوادث عبور می کند. عبرت را عبرت گفتن چون سالک از جهل به علم، از جهالت علمی به عقل عملی، از ظلم به عدل و از باطل به حق و از دروغ به کذب به صدق و از شر به خیر و از قبیح به حسن عبور می کند. فرق کور و فرق بینا این است که کور تماشا می کند و بینا عبور می کند. این بیان نورانی امیرالمؤمنین است در خطبه 133 و در خطبه 153. این بیان را ذکر میکند که بصیر عبرت میگیرد و چیزی را که میشنود فکر میکند و عبور میکند، و کور تنها چیزی را که میبیند وسیله سرگرمی اوست. این یک فرق فارق. دوم آن است که اعما و کور لها متزود و بصیر منها متزود. هر دو تلاش و کوشش میکنند، هر دو در صدد تهیه ره توشه و زادند، لکن بصیر برای بعد از مرگ ره توشه تهیه میکند و کور برای دنیا ره توشه تهیه میکند. او چون راهش محدود است توشش هم محدود است. فالاعمال لها متزودون و البصیر منها متزود. نابینا برای دنیا تلاش می کند، بینا برای دنیا و آخرت تلاش می کند. دنیا را صالح و اصلاح می کند برای اینکه به آخرت بهتر برسد. نه تنها دنیای خود را، دنیای دیگران را در تلاش و کوشش است که خار راه نباشد یک، خار راه را بردارد دو، نه بیراهه برود نه راه کسی را ببندد. فالاعمال لها متزودون و البصیر منها متزود. یک انسان بینا ره توشی از دنیا تهیه می کند برای آخرت، از دنیا مایه می گذارد برای آخرت، ولی کور فقط برای دنیا تلاش و کوشش می کند. پس فرق محوری یکی در مسئله تماشا و عبرت است، یکی در مسئله ره توشه و ذات تهیه کردن. هر دو در تلاش و کوششند، یکی برای دنیا، یکی برای دنیا و آخرت. هر دو نگاه میکنن، یکی تماشا میکند، یکی عبرت میگیرد. اون که عبرت میگیرد اهل حرکت در مسیر مستقیم است تا به دارالقرار بار یابد، و اون که حرکت نمی کند در دنیا میماند تا بپوسد. بنابراین اون چه که شما بزرگواران در دیار غربت دارید به سر میبرید یا در دیار خودتون همونجا زندگی میکنید، باید پیام بصیرت را که پیام رسمی قرآن و اطرت است هم برای خود ملکه کنید، هم به دیگران ابلاغ کنید و سفیر الهی باشید با قولتون، با فعلتون، با علمتون، با عملتون. این را هم مستحضرید که هرگز نمی شود دنیا را با دنیا شناخت، هرگز نمی شود معارف بلند را با علم و با ابزار دنیایی شناخت. اگر کسی خواست محبت را بشناسد با علم ممکن نیست. محبت از سنخ انگیزه است، بصیرت از سنخ انگیزه است، عشق از سنخ انگیزه است، ایمان از سنخ انگیزه است. انگیزه را با انگیزه باید شناخت، عشق را با عشق باید شناخت، ایمان را با ایمان باید شناخت، محبت را با محبت باید شناخت. همونطوری که علم یک بیان دارد یک مبین، یک بدیهی دارد یک نظری، مطالب علمی نظری را با مطالب علمی بدیهی میشون فهمید، چه در بخش تجربی، چه در بخش ریاضی، چه در بخش کلام، چه در بخش فلسفه، چه در بخش علوم دیگر. در بخشای ایمان، بصیرت، عقل عملی، عشق، دوستی و محبت، هیچ کدام از اینها را نمی شود با علم شناخت. مزه بصیرت را، بصیرت‌های برین و بالا را با بصیرت‌های پایین می شود شناخت. عشق بالا را با عشق پایین می شود شناخت. ایمان بالا را با ایمان پایین می شود شناخت. شهود بالا را با شهود پایین باید شناخت. ما باید حواسمون جمع باشد که اگر خواستیم مطلب علمی را بفهمیم، از علوم ساده به علوم پیچیده بار میابیم. اگر خواستیم مطلب عملی را بفهمیم، از اعمال ساده به اعمال پیچیده بار میابیم. هرگز عشق را با علم نمی شود فهمید، هرگز ایمان را با علم نمی شود فهمید، هرگز محبت را با علم نمی شود فهمید. خلاصه هرگز انگیزه را با اندیشه نمی شود فهمید. اندیشه را با اندیشه می شود شناخت، انگیزه را با اندیشه نمی شود شناخت. این است که فرمودن مقداری این راه را طی کنید تا این مبادی اولیه برای شما حاصل بشود و از مبادی اولیه علم، ایمان و انگیزه به مراحل برتر برسید. مجددا مقدم شما را گرامی می‌داریم. از ذات اقدس اله مسئلت میکنم به فرد شما، به جمع شما، به بنیانگذاران محفل، اونچه خیر و صلاح و فلاح دنیا و آخرت است مرحمت کند. همه شما فارغ التحصیل بشید، علوم عالیه را فراهم کنید، به دیار خودتون برگردید. اگر قرآن کریم در سوره توبه مسئله نفر حوزه ها را مشخص کرد که اینها بروند فقیه بشوند، به دیار خودشون برگردن، اینها تمثیل است و نه تعیین، اختصاصی به حوزه ندارد. دانشگاه ها هم همینطور است. دانشجویان عزیز دانشگاه ها به دیار دیگر کشورها مسافرت میکنند، مهاجرت میکنند، خردمند میشوند، کارآمد میشوند، عالم میشوند، محقق میشوند، پروفسور میشوند تا برگردند به سرزمین خود، به مردم خود، به دیار خود، به وطن خود خدمت کنند. امیدواریم اون چه خیر و صلاح همگان است خدا به همه ما عطا کند. غفر الله لنا و لکم و السلام علیکم و رحمت الله و برکاته.
What a beautiful message that Ayatollah Jawad Amuli has given us, and he talked about the real optometrist, that is Allah subhanahu wa ta'ala, and what vision he had. When we talk about 2020 vision, it's ironic that this year happens to be 2020 when we are having this in our lives, which has changed in the current climate we are living and adjusting to. How will our society start to look as we return to normal life? What is the fallout from the protests for social justice and reforms? This virtual conference will try to focus on these objectives to inform, inspire, and more importantly, act. And our virtual conference, as you can see, starting right now, there'll be breakout sessions, youth workshops, setting priorities by Sayyid Ali Zaidi. And then in the same Zoom that you're watching right now will be disease control and mental health, a combination of Muslim Congress collaborating with Imam Medics, family matters, breaking at 5 o'clock, appearance of the 12th Imam, myth or reality at the same time, getting out of our comfort zone at 6:45, and a current affairs at the same time in a town hall meeting, and then closing with Maulana Abbas Elia. So that's the gist of the schedule. Muslim Congress participants here don't need to know because they are quite active with it, but they have a pre-Hausa events, Heavenly Match, Hayat 360, rallies, Islamic syllabus, Justice 360, annual scholarship program, Muslim Congress media, as well as, of course, their annual conference. I'd like to really appreciate the volunteers who made this effort possible so that we can join in a virtual form and are able to do. I would say that if you're a participant, go on either this chat, but more importantly, if you could do on the website that they have given us 4 questions. And I take this opportunity to thank all the speakers, from Maulana Sartaj to Maulana Basilia to Maulana Sayyid Ali Zaidi, Maulana Sayyid Hadi Yassin, Maulana Hujjat al-Islam Haidar Shirazi, Maulana Sayyid Ali Tawfiq, and of course our medical panel with Dr. Shujat and Ali, as well as Shujat Naqvi, Dr. Nasir Hussain, Dr. Sayyid Ali Raza Muswi, and on the current affairs, Colonel Larry Wilkerson, Media Benjamin, and Manar Muhavish. So those who will like to continue with the disease control and mental health, please stay in this Zoom session. And housekeeping wise, try to mute your phones so that we don't get any disturbances from the outside matters. And if you're going for the youth workshop, then you will have to get onto the other Zoom link. So basically there are 2 Zoom links, this current one as well as the other one. So I think if the breakout sessions are ready, we could potentially start there, unless the technical team tells me there are any other things to set the priorities for this conference. Are you guys ready? So breakout session is on Zoom ID 585-342-5863. This is where you are, so stay here. And for breakout session 2, setting priorities with Hujjat al-Islam Maulana Ali Zaidi, please connect with Zoom ID 656-374-0873. No password is needed. Just put the Zoom ID. And if you're watching this, you can probably take a photo of this if you don't want to, can't remember those numbers. but those who are for the disease control and mental health by Imam Medics International, please stay here. And once the doctors are in, I will be starting the other session. And if you have any question, go to slido.com, SLIDO.com. For the medical conference, the event code is MCIMI, that is Muslim Congress and Imamia Medics International. So I hope all the doctors are here. If they are here, I will start. I need, everybody's here? Oh, they're getting in. Please ask my questions. Dr.
Yes.
Nasser Hussain, are you here? Okay, those are the questions, but yes, everybody's here. Good. So those who are joining us for the Imamia Medics and Muslim Congress medical workshop, again, we don't need to introduce, but let me tell you about Imamia Medics. It's a Shia medical professional body. It's a non-profit organization providing services in the fields of education, medical care, advocacy, and disaster relief in 17 countries across the globe. It was incorporated in the United States in 1994 and has been serving the community for the last 25 years. In 2006, Imamia Medics International got accredited with the United Nations in a special consultative status on its economic social platform, and now plays an active part on the advocacy front on all relevant issues. It has multiple chapters in 17 different countries, which have their own elected boards and work under the guidance of the Global Board of Regions. Our panel today is an illustrious group of 4 doctors, Dr. Nasser Hussain, infectious disease specialist, Dr. Syed Shujaat Ali Naqvi, psychiatrist, Dr. Ali Raza Musavi, cardiologist, and Dr. Shujaat Ali, pediatrics. And since it's been raining COVID everywhere, of course, the opening batsman will be Dr. Nasser Hussain. He's an infectious disease specialist. He's the director of the Infection Prevention and Antibiotic Stewardship Program at the Henry Ford Macomb Hospital in Michigan, United States. For more than 25 years, he has been treating infections and now COVID-19, active in policymaking and oversight of several departments for the reduction of hospital infections, and currently treating COVID patients. And his topic is COVID-19 2021 and 22.
Assalamu alaikum, everybody.
Walaikum salam. How are you?
Loud and clear. My name is Nasser Hussain, and thank you, Kandar, for that kind introduction. I will get on with my talk right away. I have a few slides just to guide me and sort of focus on the topic. And I'm going to request Arif to change the slides for me as we move along. So being an infectious disease physician, I will try to stick to the infectious part of this vast problem. It's so broad that I think what we are doing here is probably the best way to approach this issue, bringing in other speakers who can talk about other aspects. As you can see, the topic of my talk is COVID-19 20, 21, 22. It sort of gives away what we anticipate might happen. Next slide, Raza. So I formatted this talk in sort of a question answer session by in itself. I think that will orientate us more with what's going on at different levels and phases of this infection as it affects not just each individual, but the whole community and as a nation globally. The question that's probably the most popular question I run into is, how did we get it? Where does this virus come from? Corona family is a large family of viruses, and most of these viruses are zoonotic in that their origin is from animals, as is this virus. This virus basically has its normal habitat in bats, and it sort of adapted itself to be able to infect human cells. Initially, it wasn't able to transmit from humans to humans, but it adapted to that. Obviously, this doesn't happen overnight. It takes decades, years, and sometimes centuries for these viruses to be able to do that. A big factor is how close are humans to these viruses and the animals that carry them. Obviously, most of us have heard all these theories about how these were engineered and released, but I think let's stick to science. And there have been many other examples of similar pandemics. The last pandemic was the Spanish flu, which is an erroneous name for Spanish flu because it really had nothing to do with with Spain. It was during the First World War, and none of the countries were allowing the media to talk about it. Spain, which wasn't in the war, started to publish warnings about the infection and hence got named Spanish flu. We need to stay with the last slide, Arif. What are the symptoms of this infection? The symptoms that we mostly hear about this infection are mostly upper respiratory tract symptoms. However, in my example, we've seen that this infection can present with just a cough, a fever, and it can also present with loss of smell and taste, shortness of breath, the GI symptoms, palpitations, headaches. In other words, the symptoms are so vast that I tell my patients that if you have any symptoms, call me and tell me what symptoms you're having, and we'll go from there. So I think it's very important to remember that this can present with any type of symptom, and it doesn't have to be necessarily just upper or lower respiratory tract. Are there any treatments? There are no definite treatments for this. FDA has not approved any drug so far. There are many drugs that are being considered as treatment. Most of them are in the setting of a clinical trial. And I think every week or so, I hear some small trial being published that says there might be some benefit. So I'm not going to get into the details of what treatments are available and what has been tried and what needs to be tried. Next slide. What can we do to stop the virus? This I think is very practical. This is a practical question. We have an individual and collective responsibility. The individual responsibility is mainly to be able to protect oneself and assume that you might be infectious, and therefore you need to do everything so you can protect others. The collective responsibility is if there is an order from administration to stay indoors, please stay indoors. Do not go out to indoor gatherings. Do not go to religious gatherings. That would be the collective responsibility. How do we prevent this infection? Primarily because this infection is spread through air. So it's a droplet transmission. It's not airborne. I think the distinction between airborne and droplet is based on the size of the particle of the viruses and how it's spread through the air. Obviously, when a person is talking, sneezing, coughing for a certain period of time, the particles might be airborne. Being heavier than air, they do settle down. What is effective in dealing with the virus? I think prevention by wearing a mask when you're in public and keeping a 6 feet social distancing is probably the most effective way to do it. Obviously, because a small portion of these infections are also transmitted by contact, frequent hand washing is also advised. Some myths and some answers. The biggest myth I've heard about this virus is that if you wear a mask, you'll be protected. Now, this sort of contradicts what I just said, but wearing a mask is in itself not protective. Wearing a mask when you are in a situation where there might be other people around is protective because it protects you from other people who might be infected. And the reason I say this is because I've seen so many people who are alone in the car driving and wearing an N95 mask. Obviously, I think the folks who are listening, if they've ever worn an N95 mask that fits properly, it's not pleasant and it should be only reserved for certain circumstances. Next slide. What are the strategies to live with the virus? And I deliberately made this slide because I keep getting the question is, okay, Dr. Hussain, when is this virus going to go away? So I don't think that the virus is going to go away. So we need to be able to come up with ideas that we can live with the virus. Precautions that are sustainable. What are the precautions that are truly sustainable? We cannot stay at home forever. We cannot stop going to meet other people forever. So the things, the strategies that are practical and work very well are making sure you maintain a distance between other people. That will automatically prevent you from going into crowds. Getting into a crowded, closed space is probably the highest risk and therefore should be absolutely avoided, especially when the prevalence of this infection is high in the community. Let's stay with the last slide, Arif. Thank you. Frequent hand sanitization. If you happen to go into a public space where people are holding on to surfaces or they're touching surfaces, keep a small bottle of effective hand sanitizer in your pocket. Use it frequently. Avoid touching the areas on your face because that's where this virus, if you do contact it from a surface, can end up in the mucous membrane. Wear a mask. Well, obviously you can't wear a mask when you're having food. So be understanding of the fact that when you are 6 to 10 feet apart from a person who is infected, even if he is not wearing a mask would protect you. If he's also wearing a mask, that's the best way to avoid getting infected. So if both people wear a mask, then patient and the person who is close by, both of them are wearing a mask, it's very difficult to get infected. When we say social distancing, we mean that if you are unable to wear a mask, make sure you're 6 to 10 feet apart. If you're going to get within that space, within 6 to 10 feet, please make sure you wear a mask. The situation that I can think where this really becomes a consideration is when a physician is examining a patient, when you're having a meal with the family, and so on and so forth. Next slide. Remember, 80% of the people who get infected from this disease recover without needing special treatment. They take some analgesics at home, they make sure they are hydrated, they rest, and they can do breathing exercises if they're at that level of the infection. And most of the people that I get calls from, they get better at home. The ones who get sick, they need to go to the emergency room so they can be evaluated if they need any other supportive measures. Next slide. Methods to eradicate the virus. Well, the virus can be eradicated if it stops from being transmitted from person to person. Since the virus is not a living creature, it's all a bunch of chemicals. The chemicals will finally disintegrate in the environment. And unless the virus reaches another person, it will not be able to replicate. So if people can avoid each other, especially during high infectivity in the community, that will stop the virus by itself. If the community develops herd immunity, which is about 70%, it's a little different for different viruses, but about 70%. And most of the people who've gotten infected, again, the same thing, the virus will not be able to continue to get into human cells and therefore will disintegrate. Treatments and vaccine. Treatments are still being studied. Every week, like I mentioned, I hear about different types of medications that are being used. Vaccine is going to be the final answer to controlling this virus in the countries where this is very prevalent. So what to do in the interim? In the interim, we need to make sure that we don't get infected, stay away from crowds, wear a mask. If you're having meals with your colleagues, stay 6 to 10 feet away from them. If you're a physician or a healthcare provider, obviously you should be using PPE appropriately. If you're at home, try to maintain the social distancing. Next slide. We will bring this slide up, and this is just a reminder of these, a summary of what I've said. In Arif, you could project this slide during the question and answer session. And that is it from my end.
Thank you very much. Am I there or?
Yeah, we can hear you.
Okay, good. Thank you very much, Nasser. As usual, very good and explained it well. One thing that has happened in this pandemic is the issue that has happened on your mental health. Forget about the physical health. And that's why we thought it was important to get into issues related to mental health. For that, we have Dr. Shujat Ali Naqvi. He is a board certified in adult and child and adolescent psychiatrist. He's a recipient of multiple awards, published peer-reviewed scholarly articles, author of a book, and has served as examiner for the American Board of Psychiatry, and has presented many workshops, including in national, international meetings, including right here in Muslim Congress. And he will explore the issues related to mental health and disease control and pandemic in particular. Dr. Naqvi.
Thank you. Assalamu alaikum. I'm not sure people can see me. You can see me? Wonderful. All right. So I really appreciate the invitation. Aristotle said the art is long, time is short, and moment is fleeting. So I will be pithy and precise. I do not have slides. I will be touching base on 6 or 7 issues related to mental health and COVID-19 in a broad-based fashion. I will be covering today the personal stages of a society's response to a catastrophe, the psychosocial mental health response, number 1. Number 2, COVID-19 and the brain. I know there are many physicians online. In simple English, the neuropsychiatric manifestation of COVID-19, which has not been talked about, but is being picked up. There are a few case examples, which I'll give. Number 3, the psychological and psychiatric health in COVID-19. As I know there are physicians on the forum, I will be spending a few minutes to talk about physician mental health as they are on the front lines in many shape and form, and COVID-19. And last but not the least, this is a faith-based organization. Majority of us are part of a faith. There are some who are not, but I'm very comfortable to at least touch base on the metaphysical, epistemological, and spiritual issues related to COVID-19. So let the journey begin. When you talk about, number 1, the personal stages of society's response to a catastrophe, there are pretty much large, defined stages. Number 1, which is usually seeing a combination of mistrust and denial. Number 2, fear, and number 3, coping and mending. Number 4, maturity and balance. And number 5, resolution. Now, I'm sure audiences at the moment looking around in our country, and perhaps to certain parts of the world, we appear to be still locked in that mistrust and fear and panic stage. What is mistrust and denial? It is news is seen as fake, too much to believe in and not worthy. News is not applicable to one's own reality or perception of a reality. Pity towards people who ruminate on the news, mild compassion towards potential victims of current events, and perhaps a sense of one's own security. Now, that is usually followed by fear and panic, which can be broadly explained as insatiable consumption of bad news and drive to share it. Must confess, early pandemic, I too was a victim of that. Unstoppable of I survive. You have all seen that in this beginning of the pandemic, and even now in some parts of the country. Sense of impending doom, an exaggerated fear of the unknown, sense of profound insecurity, sense of stage reality and not belonging to reality, and anger. And people who do not understand the gravity of events. California and western and southern part, it should resonate. Some of the audience coming from those places. Coping and production of news, excessive use of humor, including sometimes inappropriate, learning new skills, protection, survival, appreciation of contribution to solutions, efforts to assist others in current struggles, practical efforts to build better future for self and others, and paying attention to one's own emotions and taking active steps to have some joy in life in constrained times. And then comes the stage of maturity and balance, belonging to a group of like-minded people, focusing on future while remembering the past, supporting individuals in terms of emotional and physical scars, constructive planning, and avoiding streams in life, and staying balanced and knowing one's own worth and being critical to one's own mistakes. And lastly, resolution, moving on to establish new life patterns, recognizing that prevention of problems should never stop, returning to normal relationships and building new ones, understanding that all problems can be solved or may be solved in the future. I was delighted to hear Dr. Nasser Hussain talking about 2021, 22, 23. This can be treated, but perhaps cannot be cured, is what I got from this talk in simple English. Also seeing future of what it is without over or underemphasizing it, taking care of self and others, and belonging to a community, and having a full appreciation of life. I will be happy to go into that in detail if there are any questions. COVID-19 and the brain. Now, when you talk about the neuropsychiatric manifestation, let me give you an example of my own personal case in my practice. Early April, 28-year-old white Caucasian woman presented with certain onset of severe headache, which not present to me, but my colleague in neurology, with a sudden loss of taste and smell. In those days, even in Los Angeles, where I practice, it was quite difficult to quickly get a COVID-19 test, along with fevers, headaches, but no respiratory symptoms. She kept on complaining of dizziness and a mental fog. And the key statement she made is, I keep telling the same stories repeatedly. I forget words, I know. Fingers and toes were a little bit paresthesia over there, and et cetera, et cetera. I was sent by my neurology colleague, never had the classical respiratory symptoms. As I talk to you today, based on the data which has come from Wuhan, mainly, but also from France, there is a growing feeling that the COVID-19, independently of the infectious disease catastrophe, perhaps infects the brain cells directly. I'm going to be simplified in this. Can also, with the inflammation in response to the infection, which has been called the cytokine storm, can also affect the functioning of the brain in a variety of shape and form. And I think partly that is being presented in the clinical practice by many of us in our practice, which we are seeing. Those cases are rare, but they are there in terms of this tiredness, mental fog, cognitive decline, and repetition, just to remember important things in life. And a lot of these consults in psychiatric practice are coming from our colleagues, where even after 2 negative tests of COVID-19, in the evolution of the disease itself, there are persistent problems which seem to be taking a longer time to get away. And I can get into it in detail if there are any pertinent questions on that. Psychological health and COVID-19, and that is where I think I want to spend a few minutes in detail. Now, we all know that times of crisis, many people will experience distress reactions and engage in behaviors that put their health at risk. Insomnia, lack of sleep, increased alcohol abuse has gone up by 77% nationwide, increased use of substances, even in documented marijuana dispensaries, the sale has gone up by 55%. And many social choices being made, they are a result of a response to a crisis where one feels quarantined. And as the wise man said, an idle mind is a devil's playground. In addition, pandemic results in protracted fear, uncertainty of elements of isolation, anger, misinformation, faltering confidence in government institutions. And I think the important point to make is that in psychosocial health, it is the perception of risk, not the actual risk, which will ultimately, give a sense of response in our presentation in the various mental health challenges, and will determine how the people will behave. And I think in the United States, you are seeing a manifestation of that globally. We're locked in that first couple of stages, which I talked about, the fear and panic, mistrust and denial. We are not at the stage of coping and mending, maturity and balance and resolution. You do see that in Taiwan. You do see that in Vietnam. You do see that in South Korea, not here, point to be noted. So I think there one will have to briefly talk about psychological first aid, which has been talked about by many of my colleagues and myself in the mental health field. And what is psychological first aid? It can be simply described as safety, calming self and community efficacy, social connectedness, and hope and optimism. So in our dialogue with the patient, we are doing a dance in a variety of shape and form in all this to build up a framework of support, to build up resiliency in individuals, communities, and organizations, et cetera, et cetera. And it's important to note that if there is no food, clothing, and shelter, or rent, or mortgage payment, or financial relief, or child care, providing emotional support, empathy, validation, self-actualization, encouragement, insight will take a secondary issue. And I think as a society, we are moving and taking care of the basic needs and complementing it with mental health, support, which I have just mentioned as well. And I think that's the point which you see in the psychiatric practice as well. Now, much to our surprise, we are not seeing massive escalation of anxiety, our massive escalation of, we are seeing some escalation in pain, perception of pain, our massive escalation of depression. It may come because it's the beginning of a new beginning, not the end of a beginning or a beginning of an end, as Dr. Nasser Hussain so kindly put it in perspective. So I think as the time evolves, I think those fallouts will definitely come. Like any other specialty, patients who require hospitalization for psychiatric needs are very reluctant to do so, because in the Northeast, it was pretty clear that our mental health institutions in New York and New Jersey, the tri-state, there was a massive level of conversion in many of the patients, and we can talk about it if somebody has any questions. COVID-19 and the physicians. That's a topic very close and near dear to my heart. And I do want to talk a little bit about that. Just to give you a background, in the United States, as of last year, there are more than 400 plus physicians who commit suicide. Physicians are not absolved on mental health challenges. Being in the front line, the most famous incident I'm sure you all know is the DLER physician in New York who did commit suicide for a variety of reasons which remain unknown. And so I think offering support to these physicians, offering group for them to go through catharsis, the fear of the unknown, those are very important to keep in mind as well. Lastly, I want to touch base on metaphysical and spiritual issues. Look, Hafiz said, embrace the dance of uncertainty and have faith in the universe. And by universe, he did mean God Almighty. He also said, control your mind and let your mind not control you. Now, how does one do that is the essence of the discussion which one can have. I'm just going to simply recite a poem by a verse from Allama Iqbal, who, and I'll recite it in Urdu language. which is spoken by many on the audience over here, and do the translation, which is a verse from his famous poem, The Last Will of Tipu Sultan ki aakhir wasiyat. And he said, Subah azal ye mujhse kaha Jibreel ne, jo akal ka ghulam ho wo dil na kar kabul. Translated as, Jibreel on creation's early morning a piece of useful counsel gave. He bade me not to accept a heart and change by the mind of a man like slave. I say to you with humility, diabetes can be treated, it cannot be cured. Hypertension can be treated, it cannot be cured. Depression can be treated, it cannot be cured. Fear can be treated, it cannot be cured. In the words of Jami, life can be treated, it cannot be cured. I'll let you dwell on that to a certain extent. Spiritual. Surah Anfal, verse 30. They plan and Allah plans, and Allah is the best of planners. I do not know what the plan is of the Almighty. This too is a creation from the Grand Creator. And I'm being very specific and not too much metaphysical. It's a point of reflection. Highly infectious disease. Dr. Nasir was so clear, 80% will recover without much intervention. This is not Ebola. Less than 2% by all studies of mortality has brought the whole planet on its knees. The arrogance of the arrogance, and it has humbled the mighty. I shall say no more. You can reflect on that, and I'll be happy to answer any questions and elaborate on that if so asked. So I would like to end over here the issue of faith, which is so near to dear to us in this Muslim Congress, is by ending in another verse of Iqbal, called as Iqbal Lahori by my Persian-speaking colleagues. ये एक सिजदा जिसे तू गरां समझता है, हजार सिजदे से देता है आदमी को निजात.
MashaAllah.
And burden great, but mind this homage sets you free from bonds of men of might who prayed. I think that has to be said. That has to be said. That in times of great despair, there is a role of that unconditional submission to the grand planner and have faith in his judgment in some shape and form. I thank you for your kind patience.
Thank you. Thank you very much, Dr. Naqvi. Wonderful presentation, and it's so diverse that we could go another 2 hours just exploring what all you said. But from the mind, we have to head to the heart, because it is known that most of the bad outcomes are happening in people who have comorbid conditions, particularly if they have issues related to the heart or diabetes or high blood pressure and stuff. So we have Dr. Ali Raza Mousvi, is the chief of cardiology and head of cath lab at the Ocean Medical Center, New Jersey. And his hospital was at the forefront of the CV crisis as it hit the tri-state area. And he has many hats, including a hat of being a moderator for one of the sessions here for the current events. And he's a lifetime member of Imam Emeritus International and has been on various missions, including to Iraq and Iran. I should mention that Imam Emeritus International has an urgent appeal for people who are suffering in Iraq. I would request you to get on their website and he's also the founder and activist of the Muslims United for Justice, a group of more than 100 activists in the United States. And as you can see on the screen, his wife texted me to say that he's also very handsome. So Ali Raza, go for it.
I don't know if you guys see it.
I hope it's not the corona at the back.
Dr.
That's going in the wind.
You have to probably share your own screen. So
yeah, and I think all the speakers, there's been some common complaint about volume. So I don't know whether it's related to Zoom itself or is it related to the volumes, but if you could adjust the volumes, that will be appreciated. Thank you.
well, just make sure that the speakers do not put their hand on their mouth, because that is basically stopping the voice coming into the mic. So
Okay,
just
so there's a little
FYI.
stress and there's a little virus and then you have the heart. So that's the topic.
You all can hear me?
Yes, perfect.
Yes.
Bismillahirrahmanirrahim. Just wanted to tie up the previous two speakers and talk about about stress, virus, and its effects upon the heart. So psychological stress can be a significant factor for coronary artery disease. It's very common and it can hide other symptoms, and it can be linked to various other risk factors. It can serve as a barrier to medical intervention because people don't want to accept what they have, and they may also trigger other acute events such as a heart attack itself. So what are the psychological factors that contribute to coronary heart disease? Type A behavior, or what we call as hyper people, anger, hostility, psychological stress, job strain, exhaustion, social isolation, and lack of social support, anxiety, depression is a major factor in that. The way acute stress acts on the heart is through the sympathetic nervous system, and it gets stimulated, and that is a protective mechanism which are going kind of off this screen. The heart rate increases, the blood pressure increases, and there's vasoconstriction in which the arteries of the heart and other blood vessels become narrow. So when that happens, there is decreased blood supply to the heart muscle, which is called myocardial ischemia. Or it may increase the chance of a person having heart rhythm disturbance or arrhythmia. It may make the endothelial function, endothelial is the lining around the arteries of the heart and other blood vessels, and may cause injury to that and make the plaque, or we may have a plaque that is present in the arteries of our heart or in the brain or the kidney, etc. And that plaque will rupture, exposing the insides to the blood, and a clot forms. A clot results in a heart attack in the heart, a stroke in the brain, and an infarct in the kidney, resulting in kidney failure later. Platelet activation and hemostatic changes are really changes taking place in the blood system that increase the risk of a clot formation or thrombosis. So management of stress has been discussed and will be discussed probably more, but just to touch on it, stress management program means a removal of the stress itself, which is easier said than done. So you try to reduce the impact of the stress by changing the perception of the person or reducing the sequelae. The techniques involved may include muscle relaxation, deep breathing, or you may end up using drugs. And for that, you use anxiolytics, or you may use drugs like beta blockers. Heart disease has always been the most common condition in the States, and cancer has always been the second one for a long time. COVID-19 has changed all that. And very soon, COVID-19 may overtake heart disease also. So how does this infection take place? The SARS-CoV-19 virus has these spikes on them. And this spike protein, the S protein, comes and goes into this lock with the ACE inhibitor, the ACE receptor. This receptor, the combination of these two, creates an unlocking mechanism that opens the gate, allowing the virus into the cell. Now, the cell, in this case, if it came in through the lungs, it first infects the lungs for that reason. And from there, it goes into the blood vessels. From the blood vessels, it's off to the races. It can go to the brain, the heart, the kidney, anywhere as such. In the heart itself, it can affect it directly by causing direct cardiotoxicity. But it can also affect through the lungs, because it's affecting the lungs. There's no oxygen supply, and there is less oxygen supply to the heart itself. So that's called hypoxia, or decreased oxygenation. The supply-demand mismatch. Supply is a certain amount of blood is needed by the heart every time. But and even if that supply is correct and enough, that if the demand of the heart increases because of the stress of the COVID situation, then there's a mismatch. That mismatch can lead to a small heart attack. Cytokine storm, DIC, all add to the whole picture to produce a shock. So this results in acute coronary syndromes like angina, heart attack, heart rhythm disturbance or arrhythmia. Myocarditis is the inflammation of the heart muscle. Venous thromboembolism and thromboembolism in general is clot formation and going to the brain and other places in the legs and lung. Heart failure is weakness of the heart muscle, and the worst thing that you can have in this situation is a shock condition called a cardiogenic shock. This is the typical ground glass appearance you see in the lungs, and you see this, the infection, the pneumonia. What are the concomitant conditions with the SARS-CoV virus? High blood pressure was very commonly seen in most of these patients as such. Heart failure, coronary artery disease, or the blockages in the arteries of the heart disease that you're born with, a congenital heart disease, and the typical manifestations you have all heard of, that is old age, immune compromised state that includes includes cancers and the management of cancers, diabetes, lung problem, kidney problems, severe obesity, sickle cell, and other factors. High blood pressure management, only one point I wanted to make over here is, because what I showed earlier, there was these ACE receptors with which the coronavirus integrates and enters the cell. We initially, in the very early stages of our exposure to this, we thought that we should not be using those ACE inhibitors. Those are used many times in patients with high blood pressure, heart failure, etc. But we found out with further studies that was not the case. So we do not stop those medications in patients with COVID-19. What were some unique things? I just want to touch the unique things that we're seeing with COVID-19 and acute coronary syndrome or conditions of heart attack, etc. Fewer number were presenting. We were sort of out of a job in those early days. We had nothing to do. What was happening is that the patients who normally present to us with a heart attack were not coming. We would have a few patients every week with a heart attack, which we had to rush to the cath lab to open them up, but we're not seeing them. We couldn't understand what was going on. So what was really happening was either these patients were dying at home, or when they wanted to come with chest pain, etc., they came very late. And so we were very concerned about taking them into the lab. So now when we take them to the catheterization lab, etc., we presume that everybody is COVID positive. We try to avoid testing unless it's absolutely necessary, because the exposure to the other people, not the patient's already infected, but the chances of exposure to the other patients, other people who are doing the testing, the technicians, doctors, nurses, etc. We have to clarify the code status, and patients just have to be asked many times, and they will tell you that they are old and they do not want to be intubated, and therefore we don't expose everybody else to this process of intubation as such. This medical therapy that is used in the typical patient with a heart attack or angina is continued in these type of individuals, even though we have to be careful about their bleeding risk. And some people, we initially started giving blood thinners to everybody because they were in increased risk of clotting in these people. You could see that. But then we realized that it was causing an increased risk of bleeding. So we had to use it in a case-by-case basis. STEMI patients, the patients who come with a heart attack in the very early days, I'm just telling you my experience as it went along because we saw these patients very early. So in the early days, we tried to avoid taking them to the cath lab. Our recommendations from our society initially was, especially in a certain type of heart attack, to use clot dissolving drugs called thrombolytic therapy. Then we realized that within a day after giving the thrombolytic therapy, we still have to do an angioplasty or a heart catheterization leading to a potential angioplasty. So there was no sense in waiting for that. So we started treating them the COVID patient is also exactly the same way with a heart attack as we did with a non-COVID patient. The exception being that people who were very critically ill with multi-organ failure, we sometimes used to take them in shocky conditions to do an angioplasty and all. We found that the mortality in these individuals was terribly high. And so we were not doing that in this. I'm going to skip this slide. So troponin is an enzyme that is released from the muscle of the heart. And remember, I told you earlier about the supply-demand mismatch that occurs in the COVID patient, even though they may not have any blockage, and yet there may be a rise in this enzyme, which is typically seen in a heart attack situation. And that's because of that supply-demand situation, and it's called a minor heart attack. But if the numbers of the troponin is very high and it rises very early, that's a typical heart attack, and can also be seen in myocarditis, which is inflammation of the heart muscle, or the Takotsubo shock condition, which I'll talk to you about in a moment. The same thing, this is the levels of troponin going up. I just want to mention one interaction that you have all heard about all the time, which is hydroxychloroquine and chloroquine usage with these drugs. So basically, an EKG, if it is done, will show that a person has a certain interval called the QT interval. That QT interval may be prolonged in some people from birth, or as a result of certain conditions, or because they are on certain medications. So on the chloroquine or hydroxychloroquine, this condition it becomes worse, and the chances of heart rhythm disturbance becomes worse, and that increases the risk of a person dying. That was the problem. When we kept on hearing from certain interested individuals that chloroquine has no risk, it was untrue. Chloroquine has significant risk, predominantly because of this condition. And in COVID patients, we found that a certain number of people were benefited. However, if we had significant benefit, we would recommend that. When you weigh the risk and benefits, multiple studies came out and showed that there was no benefit of chloroquine, and that's why it was not being used. This is a typical heart situation where the person came with a chest pain, had some suggestive changes of a heart attack on the EKG, showing ST elevations, and he was taken to the catheterization lab, and these are typically normal-looking arteries of the heart. So this is one of those masquerading things in which one would think that this person is having a heart attack, but they are not. On the other hand, you cannot just ignore all those patients, because you may see this. That is the same kind of situation, but this time when you take the cath lab, this artery should be smooth like that. Instead, there's an ulcer, it's a tear in the vessel. This person is having a typical heart attack. So in that case, what we do is put in a balloon, put in a stent, open it up, and it looks beautiful at the end. Takotsubo, or stress cardiomyopathy. Takotsubo, stress cardiomyopathy, it may be also, you may have heard of the term broken heart syndrome. Under acute emotional or physical stress, which is sudden and acute, a person may have a condition, ACS, acute coronary syndrome, is like a heart attack kind of presentation, with having chest pain, EKG changes, etc. And they present, and when you do check their heart muscle, it has a typical ballooning effect, and I'll show you a picture of that soon. And that shape of the heart looks like Takotsubo. Takotsubo is an oyster trap that Japanese use, and this was fun in those days, and I'll show you a picture of that too later. And the unique thing about this is, even though they look like a heart attack, it is not a heart attack. There's no blockages in the arteries of the heart, and they may have a hypercoagulable state, increased risk of clotting, etc. The differential diagnosis, you always have to think in terms of a heart attack, which is a STEMI, or the heart attack, or the use of cocaine, or inflammation of the heart muscle called myocarditis. Interestingly, on June 30th, just 4 or 5 days ago, the Journal of Cardiac Failure, this is not a joke, the Journal of Cardiac Failure published a case study of which the author called it as Trump cardiomyopathy. This elderly person was watching the impeachment of Donald Trump, and he had a heart attack, came to the hospital. In fact, he had Takotsubo syndrome. So that is why you should leave your leave your octopus in your Takotsubo. So the Takotsubo, this is the Takotsubo, is that trap in which the octopus is trapped, and that's why the name comes, Takotsubo. And this is situation in which this person had the heart attack type picture, the arteries are normal. And if you look at the heart has this ballooning appearance. This ballooning appearance is very similar to that Takasubo, the oyster trap that we were talking about. I'm not going to go into details of the multisystem in inflammatory syndrome in children, because I think that Dr. Ali will talk about it later, but this was the condition that was seen, Kawasaki type syndrome that was seen, toxic shock syndrome in New York, in London first, and then reported in the rest of the world in ages of 2 to 15 years. And basically, I'm going to skip that for that. Let me end my talk by stating that the way to treat Takasubo is not by a typical doctor, nurses, and all, but by a relaxation process. So the disease of the heart is worse than the disease of the body, is what was said by Imam Ali alayhi salam. And I think he was what he was referring to when he said about the heart, though, was the soul. But in this case, I wanted to put this code in there. And with that, I end my talk. Thank you very much. Assalamu alaikum.
Salam. Thank you very much, Ali. And when you've just said about children, initially we had said that children are not that affected, but we have had at least 3 deaths, 1 11-year-old and 2 teenagers. So pediatrics, although may not be that thing, but they are vectors, and we are at least finding increased incidences in the daycare centers, and then who are bringing them to their families. So we have Dr. Shujaat Ali, he's Assistant Professor, Pediatrics and Emergency Medicine at the Lehigh Valley Health Network, Allentown, Pennsylvania. His primary interest is on prevention through community participation. He, like Dr. Ali Raza Muswi, is also a social activist, and he does talks about current affairs and social issues on social media. And he has got a YouTube channel by the name Current Review Series that he does. And by the way, this conference is also being broadcasted on the YouTube channel as well as Facebook. So again, a big shout out to the media team for Muslim Congress. Dr. Shujaat Ali, it's all yours.
Thank you so much. Assalamu alaikum, everyone. And I really appreciate you guys taking me here on this prestigious event. And also, I wanted to say thanks to all of our previous participants and speakers who have, elaborated beautifully this unprecedented time, in our lives, and as our families are telling. So I would be covering COVID-19 and pediatric mental health dilemma. Now, Dr. Muswi just mentioned, I can touch this on the inflammatory syndrome, but my primary talk, which I prepared today, was the about mental health. Okay. I'm hoping you guys can hear me, right? So
yes,
pediatric so far has done a good job. So limited studies have been out there so far about COVID-19 and physical effects of COVID-19 on pediatric population. And I'm talking about these studies are from AAP, CDC. There has been a recent study done in New York as well. So we don't have that much data, but so far, whatever we have, especially in China and South Korea, there was some studies done about like more than 2,000 kids, and it has been seen, which is, kind of like one of the, I would say, sigh of relief, and I would tell why. So that study has shown that 90% of kids and children, they did not have severe disease, they did not have breathing issues, they did not require oxygen, 4% had mild, and in China and South Korea, there was, 1 or 2 deaths reported, but certainly it is more in here in USA, as our host just mentioned. Also in New York, there were a couple, 2 or 3 deaths, I believe, but those were from the kids who have some underlying diseases mostly. Okay, so that was the the physical side, so luckily we are in good shape. But as you guys mentioned, pediatric population is a special population in a sense that they may not show many, signs of acute disease, but they can spread the disease like a fire, especially viral infection. And that's what's happening here too. So that was the physical part, what's going on with the pediatric population. In terms of mental health, yes, that is a big impact. And our teams are being worried. So I just want to tell that I am not a child psychiatrist, but because I do face this in my primary care setting, and I do treat these kids, and I talk to a lot of families. I have a lot of insight into it. So I was like kind of like a thrill. It was thrilling for me to bring this up to you guys. So there are many dimensions to this COVID-19 and pediatric health, and those are family dynamics, psychosocial dynamics, and also financial stress. It's one of the biggest things, all right, which we are seeing right now. So pediatric, you guys know that it's a special population, and the care and well-being of pediatric population does depend almost all the time on the caregiver. Parents, grandparents, their caregiver. So it's very important that we keep that in mind, that if the caregiver is stressed out, this population is gonna, have that burn there too. So what are the current numbers, which I'm just gonna touch base and I'll move on. So anxiety and depression, you guys know that has been on rise as in adult population, same is in this age group pediatric population. CDC last year published the data that there are 6.3 million children between age 3 to 17 have been diagnosed with anxiety, and they have been diagnosed with depression. Right now, what the major burn is on the kids who have special needs, like ADHD, ADD, ODD, that kind of behavioral issues. There has been a rise in child abuse. There has been a rise in child neglect. I'm sure many of you guys may just have seen an article in New York Times yesterday, I believe, or 2 days ago, from UK, in which they have mentioned so many deaths, and suicidal death rate is increasing because of the abuse at home. So why it is happening? What are the different reasons we need to look into that? So kids, you guys know that they do need a special kind of environment, and especially kids with behavioral issues like ADD, ODD, they do need a well-structured environment. So what was going on before all of this started, in the schools, they have their teachers there, their therapists there, their counselors there. But right now, everything has to be done by parents, right? So parents are acting as a teacher. Parents are also acting, as their therapist, and parents are not trained to do that. So that is a big, issue going on at this point. Also, there is not a personal space, which have been, in the media right now. So just imagine, like, you have like a family of 4 or 5 kids who are just between like 3 to 10 years of age. So how they're gonna, maintain their space. There have been family conflicts, and that is also taking a lot of toll. Resource constraints is also a big thing going on right now. In New York, especially in this pandemic, it was mentioned that many of the kids could not join online school and online classes because they did not have resources. So that is also one of the dilemma here. Not socializing, kids, they learn from their peers, and they transmit their whenever they have a little bit anxiety, and they talk to their peers, and that's how they get they get happy. And right now, kids are just stuck at home with parents, and they do not have those group settings as well. And so parent well-being is a big issue here, which we have to keep in mind, as I said earlier. Now this what I bring that up right now, it is only in the countries who are so-called well-developed countries. We don't know, unfortunately, what's going on with the countries who do not have resources, which is one of my interests. And, we did talk on IMI platform about that. just street children in, like, for example, in Pakistan, in many other parts of the world where we do not have resources. What's going on with those kids, we don't know. Jobs have been, business have been closed, jobs have been cut down, kids who, I don't know how they're getting their food and this or that. So that is also one of the issue here with this population. So what we can do about it, and I would really appreciate if our host can just keep an eye on the time, so that way I am in the time I have been given. So what we can do about it, and I will be more than happy to answer all the questions you guys have any. So what we can do about it, that is also I would say may not be the solution, but at least give us some direction to help this population. So what the experts are saying, that scheduling of family time is very, very important with your kids. Scheduling of family time for physical activities, like, for example, in the evening, you guys can do jogging, can do biking together. That's what I do at home too. I have a 7-year-old who has been crying the heck out of it that when this coronavirus is going to end, right? Just imagine a 7-year-old. So interaction with the kids is very, very important. They do need this more than ever, because in the past they were doing all of this interaction with their peers, with their teachers, and with their other group settings. And right now you are the only one for their source. There are actually a lot of opportunities too in this whole pandemic, that the families who can provide love, who can provide care to their kids. You guys have this opportunity, you to be optimistic and spend that time with your kids. I did that too myself. I was 3 weeks, I was working from home, and I tried my best to spend time, and we are doing that too at this time. So there are some opportunities as well, right? So family schedule is so important for all of us. Very, very important, I would say, point here is that limit exposure to horrific news. Dr. Musvi just, mentioned a little bit, I'm not against any person, but at the same time, keep the kids away from horrible news and the people who are just all the time talking about horrible stuff. Okay, so that kind of stuff. Also very important, because the media use has been under kids are just all the time on media, so we have to watch and we have to see what they're doing on the media. And media safety is so important, online safety. Very important thing is that do not transmit your own stress and anxiety to kids. That is so important, that if you are stressed out, you're certainly, it's so tough. It's easy said than done, but try not to bring your kid, if you have your own mental health issues, to the kids. What are the signs which you guys can look for in this population, and that can help you to navigate? And that would be self-isolation, especially for teenagers. Also, sleep issues, very, very important. I know sleep cycles are all upside down, same as for me, but for you guys too. Eating habits are very important too. Kids may not like what they were doing in the past, right? Also, excessive in little kids, like a 2.5 or 3 year, or 3.5 year, 4 year, maybe there will be excessive crying. So subtle signs. We also have seen what we call as regression in common milestones, like a 3-year-old who has been toilet trained, and right now he or she is regressing. I have seen that too in my practice. And also, if there has been a previous mental health issue, that population really needs to be paid attention. And if you have any teenager at home who has previous issues, believe it or not, that is a high risk. So we need to pay attention to that group as well. And kids with special needs certainly need our help. So at the end, I would be keep ending. And then, as I said, I'm here to answer the question. The most important thing is that seek help. If there is an issue going on for yourself, for your kid, just seek help. That is a way to go through all of this. I would say unprecedented time of our lives here. So I'm hoping. I think I was in the time, right? So I'll end my talk here. Dr. Musi, I'm sorry I did not prepare the inflammatory response, but during the questions I may touch on that, because I was more concerned on the mental health side.
You did great. Thank you.
All right. Thank you, guys.
So I would request Brother Cumber to ask the audience if they have any questions. And
yes, sorry, I thought I was already on. So I was saying that Saint Dr. Ali Musavi is going for another session as a moderator, and he doesn't look to be at the prostate age, but he might need a pee break. So we will not give him a Trump cardiomyopathy with any stress. So, but as you mentioned, there are a lot of people who are sitting at home worried, and you pointed out that many even might have died because they didn't show up in the ER. So if somebody's having a chest pain or are scared of going out to the hospital, what should they do?
Can you hear me?
Yes.
Okay, so basically, you would do exactly what you under normal circumstances, which is reach out to your physician. If you have a if you have an internal medicine doctor and you need to reach them first, you can do that. But if you have a cardiologist, reach out to your cardiologist and talk to them, describe the symptoms. Many of us are able to give advice over the phone and let the patient stay at home most of the time, because based on their symptoms, we may be able to direct them to the office instead of the hospital itself. And for those reasons, basically what would happen is that we would ask them to stay home. Secondly, if the symptoms are getting worse, they should go to the hospital. If they cannot control the pain, or even if they have any concern, they cannot reach the doctor, they should go to the hospital despite the fact that there is a virus problem going on. There are areas of the country where things are worse right now compared to where I am. We started off with the tri-state area got hit the first. So we second after Washington. So we started off in those days being very careful with these patients. Now we have opened up their offices. We have started doing elective catheterizations and procedures. So things are very different now than they were before. So it depends upon the area where you're located and the chance of infection. But every single time you go to the hospital or just go anywhere else, you have to presume that the person you're meeting may have COVID. Just you have to work with that principle. Till we have vaccine, that's how paranoid we have to be.
Okay, thank you. I think I can bring in both you and Dr. Nasir Hussain for the next question, because it has been, I call it WAU, the whatever APA University, where there has been a lot of talk about how to increase the immune function. So should we be taking vitamin C, vitamin D, zinc, baby aspirin? Should we be maybe go to Amazon and get a pulse oximetry? I mean, what's the COVID basket for home care? What has been proven on a scientific basis? And if you could elaborate, because there is one study that has just come out about chloroquine might have a role, although the others didn't. So where are we with chloroquine, for example? So maybe Ali, if you can get a first shot at it, and then if you need to leave, you could leave, and I will continue with the rest of the three of them.
I want to talk about the second part of your question with regards to chloroquine. I mean, the other stuff, I think Dr. Hussain could do a better job than I can on. Chloroquine issue was first initiated, and we were concerned about it. But believe me, whatever our politics are, it's important that we treat the patient. So we all wanted whatever drug that was out there to succeed, whether we disliked certain people who were talking about chloroquine and pushing it, or we liked it. It made no difference. From the scientific data, we wanted to use it, and we were using it. In the initial days, we were using it. I myself had 2 deaths on chloroquine from sustained ventricular tachycardia, which may have occurred on their own, but may have been worsened by means of the chloroquine itself. That's why you need scientific data. And this discussion should be at the level of the physicians. Unfortunately, it was out on the street. It was in the news, it was on WhatsApp, like you said, and Facebook and all that, which was very sad. So instead of that, scientific studies started coming in. When the scientific studies started coming in, one after the other study kept on showing that chloroquine does not work. And at that stage, the FDA and others said we should stop using this drug altogether, especially not with azithromycin, which was the other thing that was there. Okay. Next thing, it was all clear until a couple of days ago. And a couple of days ago, a study came out from the hospital I trained in, and which is Henry Ford Hospital, and I see Dr. Hussain is also from there. And in that study, it was shown that there was a 50% reduction in mortality by those people who use chloroquine. Okay, that was the clicker. And then yesterday, Peter Navarro and the White House person, Peter Navarro, proposed this as a drug that should be used again because of that one-star study, because he claimed that he's sitting on 62 million doses of this drug. And therefore, we don't use the drug just because you have them. Okay, you use the drug, but there's some scientific evidence. So let's talk about this study, because many of you are going to hear about this in the next few days again and again. There were about 267 patients involved in the study. Okay, so that's not a big study, it's a small study. It's another observational study, which means that there are biases that are involved. Physicians actually selected the drugs on who to use. A typical study, which we want to believe, and a study was there, is a randomized placebo-controlled study. This was not that, okay? So 10% of the people were not included in this study. We found a bunch of people were on steroids. Dexamethasone, just by a recent recovery study, was shown to reduce the mortality on this. And there were more patients on steroids, as far as I know. We still don't have all the information from this study. But from what I know, there were a higher number of steroid patients in this study. Please remember, this is an observational study of 267 patients. The Oxford study, which said that the chloroquine does not work, as far as I recall, had about 11,000 patients. The NIH study, which was pulled, had about 450 patients. So this is a small study, and you're going to hear a lot about it in the next few days, but I wanted you to get educated. Now, even if this one study leads to further information that makes us use chloroquine more, that's great. We want to use it. Right now, the scientific data does not allow you to use chloroquine. Not only that, if you use chloroquine prophylactically when you don't have the condition, you could hurt yourself. And right now, you should only use it as part of a trial given by a physician. Thank you.
Yeah, thank you. By the way, we have about 20 minutes, and I want to give chance to all of them. So I know it's sometimes difficult for us. Nasser, 1 minute, yes, no, chloroquine?
For now, I still a no, because this wasn't a treatment or management changing study. Like Ali pointed out, this was an observational study, and there were just two inherent built-in biases that really cannot be separated out.
Good. Yes, no on vitamin C, vitamin D, zinc, baby aspirin.
Yeah, I'll take a shot at that answer. And I think it's a good thing to have vitamin C, zinc, elderberries, and everything else that we see on the social media. Unfortunately, none of them really work for coronavirus. So I would not advocate taking any of those to prevent coronavirus infection. But as maintaining,
it doesn't hurt.
Those might be good supplements.
Good. So I would now go to the Slido. By the way, thank you all who participated. There's a question actually that came out from the talk that you gave as to what is herd immunity. And from what I understand now is there's some new study that's coming up and saying that herd immunity, we thought it would need about 70%, but this new study saying 43% will be okay too. But we are at 6%. So number one, what is herd immunity, and how are we going to reach from 6% to at least 43%, if not 70?
So the concept of herd immunity is simply that if an infectious agent is able to jump from person to person, and it needs a human cell to replicate, if we can block that, then the virus will stop its transmission and will sort of eradicate itself. Herd immunity means that if you have enough people in a given community who cannot get infected because they've developed an immunity either through a vaccine or by getting infected, they will not be able to replicate the virus and propagate it. Now, the figure of 70% comes from previous experience with other viruses. And this may not be true for coronavirus. We might need a higher percent, or we may need a little lower percent. I'll give you an example. So measles, you need a 94% of the community members being immune. So the herd immunity number for measles is around 94%. For influenza, is about 60 to 62%. I don't think we have large enough studies to make a definitive comment about the COVID-19. What is the real percent of herd immunity? And certainly getting from 6 or 10% up to whatever the final number is, 40% or 50 or 60 or 70, it's a journey. And I think that journey is best taken by currently preventing infections. And when the vaccine becomes available, everybody should take the vaccine. I don't think there's any sinister intent in developing or giving the vaccine. We've developed vaccine for so many illnesses, and the concept of vaccine is simply so we can prevent infections in the community and someday eradicate the virus. Smallpox is the only vaccine preventable viral infection that's been truly eradicated from the world. It has never happened with any other viruses, yet all the other vaccines are very effective in preventing infections.
Right. Talking about the vaccine, it takes a good 1.5 to 2 or even sometimes more. So if they are putting this into a 7-month period, would you be comfortable receiving it, and who should be receiving it, and how long you think will it last, and side effects wise?
So generally, the concept about developing vaccines is, many vaccines have been developed. You can develop a vaccine in the lab quite quickly in a few months. I think the bottleneck is when you have to try out the vaccine in the field and prove that the antibodies that were developed in response to the vaccine are protective. And it is those trials that you have to do in the field that really takes a time and are difficult to prove. An effective vaccine, all it has to do is to stimulate antibody production in a body. But are those antibodies protective? Are those protective when a person is exposed to an infection, and how long they will last? These studies take years. And so I think the first vaccines that will come out, they will be released because they're safe to use and they do stimulate antibody production. The proof lies in the pudding. I think when a lot of people take the vaccine, we'll have these epidemiological studies to show that these patients develop protective antibodies, and when they were re-exposed, they didn't get infection. These results will take several months, if not years.
Thank you. Next question is for Dr. Shujat Naqvi, a psychiatrist. Plenty of questions here. One is, how do we address somebody who does not have a mental illness and now is confined at home and having issues with, say, germ phobia and for anxiety, depression, versus somebody who has an underlying mental illness itself? And the second is the rising the rising incidence of domestic violence and elderly abuse, even within our own communities, because of the victim not having access to people whom they trust or the authorities. So if you could address, those
Sure.
2 or 3 questions.
So let me take the germ phobia question first. Look, it's a reality that what the guidelines are is frequent hand washing. Hand washing for at least 20 seconds 20 seconds, if not more, in a thorough hand fashion on a regular basis. Now, when you combine that, before COVID-19, if somebody would come to my office and say that I'm washing my hands 15, 16 times a day, then certainly you take out your diagnostic tree of obsessive compulsive disorder and try to make sure that the patient does not meet the diagnostic criteria for that. Having said that, these days, that issue is now really, it's the need and the requirement. So I think one has to be sensitive to that. The germ phobia question is really very interesting from another point of view. Look, we are trying to avoid germs by wearing gloves, by not shaking hands, by having a 6-foot distance, if not more. And all these questions are playing a part over here. So they cannot be called as phobia. But the phobia word really comes in psychiatric linguistics when the amount of prevention is impairing your lifestyle without the expected norm. The expected norm these days has changed. Washing hands as a physician in a hospital 15, 16 times a day is the new norm. For many of us in frontline jobs is the new norm. So it cannot be pathologized. The best thing would be to speak to your doctor. And in some cases, if you have a therapist or a psychiatrist, speak a little bit more on that. And really, to really tie it up, that if that habit is leading to a persistent fight, flight, fright, and freeze, I repeat again, the 4 Fs, the fight, flight, fright, freeze, then it's something which can be treated. One thing I did not mention in my talk was that, much to our surprise, the psychiatric care has not been limited. Even the psychological care, we have found through the medium of telepsychiatry and through online, it actually has really been static, and if anything is growing, at least in the western part of the country where I practice. So yes, there is access available, there is expertise available, and one should talk about that. The second question about domestic violence, I think, is extremely important. Because first of all, let's be honest, mental health is a stigma. In our community, the issue of domestic violence is not something which comes on the surface. And the issue of domestic violence worldwide, not only in the United States, is being not openly talked about. And one of my colleagues talked about the data coming from the United Kingdom. And when you have got interpersonal unresolved issues and you are on a quarantine, cooped up together, yes, there is a higher incidence of domestic violence. The issue of guilt and shame prevents many of us from seeking help. Now, there are a variety of resources, adult protective services, there are protective services for women, so to speak. So I think as a community, our relatives, people who are physicians who are focused on the lungs and the heart and the infection, they need to keep their eyes and ears open as much as possible. And many times in the past 3 months, I've seen my colleagues from pediatrics, actually from pediatrics as well, because I am a child psychiatrist, who have said, something is not right here within the parents. My colleagues from internal medicine, my colleagues from family practice, who have been the source of referrals in trying to mitigate this stuff. And I think that issue has to be addressed head on. Yes, there is an increase on that. Yes, there are ways of doing that. Yes, there are ways of separating the perpetrator, and et cetera, I think these are important issues. And along with domestic violence, I'm just going to tie it up a little bit. The issue of abuse, physical abuse, is something which is now, there is some indication it is in the children and adolescents. It may be on the rise. Again, issue of all being together. So one has to, in the screening model, people who are pediatricians, people who are up there providing primary care, to have that sensitivity and that probing to decipher those questions and then address it appropriately.
Thank you. Actually, I was going to go to pediatrics, but there are 2 questions that I think are important because it is the famous person anonymous asking us these questions. Because I think there seems to be a distrust among the community about the medical profession. in general. So this is going on in social media. So I think it's important that we address both of these questions from Anonymous. Why are doctors these days getting their education from media? You talk about evidence, but you don't condemn using ventilators, even though they kill 90%. Number two, why are doctors not talking about strengthening the immune system instead of scaring people and advocating practices that weaken health, like staying home? So, Ali, you can get a shot at it, and Nasir can get a shot at it. Whatever Upper University and Surat Kitab is full of this. So Anonymous doesn't want to say who or he or she is, but this is out there in the community. Let's address it.
I'm actually glad that this question was asked, because it's out there, like you said, and we should talk about it. We are asked why we are getting our medical information from the media, but we are not. We are getting it from scientific studies. I want to answer this very unemotionally. I gave an example of chloroquine. And this was, we heard so much din about chloroquine for months, but I gave you evidence about scientific data. I did not talk about what CNN said or what Fox News said, but about scientific data. We can only talk science. And in that, let's talk about the issue of ventilators. This issue of ventilators was started. We were in the very early stages of this whole process. And the patients came in when they are in respiratory distress and when the oxygenation level falls, there's nothing we can do but to intubate a person. There's nothing. We can give what is called a BiPAP, in which we force the oxygen through the mask. What that was doing, and we were doing that, that was doing was pushing the virus out into the air, exposing everybody else out there for this. But we're still doing it though. However, after we started intubating the patients, and we were using a lot of intubators, a lot of patients, we started realizing that yes, this ventilator, which we were used to in, say, heart failure or lung disease, etc., was not behaving the same way with the COVID patients. So we altered our methods. We took a certain amount of hypoxia, that is lower blood oxygen level. We did certain measures. We forced air in a certain way. We did consider those things as they were coming through. This is typical. It happens in medicine all the time. When a new disease comes in, when HIV first came in, as this big, huge disaster, we all reacted as we went along. But because there was no social media, none of the other people found out that our reactions were scientific. They were not based on some WhatsApp news or anything like that. Unfortunately, what has happened is that people have become doctors on Facebook, doctors of WhatsApp. They've gotten their degrees on their social media, and they think that they know a lot. But I would prefer they ask questions, and ask us to scientifically give you data to support this. For example, masks. Masks reduce the oxygen content of your blood. Just because this is being spread by certain individuals who want people not to wear the mask, don't fall for that. By the way, this gives me a chance to tell you all that there is a town hall right after this, and this issue based on the activists and all would be addressed in that also. So if you're interested to continue the discussion, please tune into the town hall. Thank you very much.
Thank you. So I think he addressed it, and I would like to do one pediatric question. How do you know that your child or teen youth is depressed or a victim of bullying? Dr. Shujat Ali, if you're still there. I see his mic muted. If somebody could. Okay. Dr. Shujat Ali is there? No.
Yes, I am there, and you guys are not letting me turn on my video or my mic, but I'm here now.
Perfect.
I think there was on Slido, there was another question too about the face mask, but I'm not sure if I can address that.
Yes, we can do that too. You can do that also.
Sure. So let me, so the question, like, how do we know if a teen or, they're depressed? So the best option is to watch for those warning signs, which I just, elaborated earlier, that, schedule changes, self-isolation, spending just like hours and hours and days on social media, and what they are watching on social media, that is very important. Another question is that if there has been, subtle changes in the behavior of a child. As I said, I have, and then I really appreciate Dr. Naqvi bringing that up, that we have to be very sensitive as a provider, to keep in mind as like a family dynamic. So like I said, I had many parents reaching out to me that their kids are acting just abnormal, a 9-year-old just crying heck out of it just for nothing, looking sad, not participating in activities. And then again, I think the best option would be, if you see those subtle signs, then you reach out to us or your doctor's office, and then we could do a formal, I would say, interview. Now, again, one of the things, the opportunity which actually came up in this pandemic is a telehealth. So do not feel that you cannot, reach out to your office or your health provider. So I would say that, watching for any abnormal signs, number one, and number two, and then reaching out to your physician. That would be the best option.
Good.
All right.
Yeah, go ahead.
So awesome.
Face mask.
So then, there was another question from Slido about how do we talk about face mask to a child. I wish I could have a straight
By the way,
answer.
it's not allowed. I mean, it's only for 10 and above. So the state is not telling. The state is not telling to put it on your child.
Okay. So I mean, it's still like, teenager. So, I think I was glad to see that question. And, I wish I could have a straightforward answer for you guys. Believe it or not, it's a very emotional as a pediatric provider to talk about this thing. We do, all the doctors, they do take pride in wearing their white coats, right? That is one of the symbol of doctors. I personally do not wear that white coat because it scares kids. Okay, so right now we are in a time period where everybody has to. When I go and talk to families, I do my physical exams, I have my mask, and I always bring that up to the parent and child attention that I'm so sorry I'm wearing this, but I have to do this. It's a new norm. Okay, so how you can actually talk to your child about it, about that, is that it's safety, right? So we all work on safety and prevention. We do a lot of stuff in our life which is like subtle, and we don't pay attention to that, and that is from the safety perspective. And this is also safety, although it just came out of nowhere. That's what we are in, but that is the safety for you and for others. And also, I would say, as compared to forcing, explaining helps a lot. I mean, we do a lot of vaccinations, right? Kids are scared out of it, but then, we get it done. Same thing, there are so many other examples. I just want to take one opportunity one more time here. There is like a little bit, like I would say, a discussion going on for many of my friends, and people are telling, oh, this is a God's punishment. And, people are not following, hijab requirement, whatever recommendation for hijab, or, abandoning handshaking. So this is a God punishment. I would say, as a practicing Muslim, alhamdulillah, I would say that is a nonsense. We should not talk about that. This is God's punishment does not come this way, guys. God's punishment is that it is our own action which brings God's punishment. So let's not blame, and let's not, preach our beautiful, I would say, faith in this manner, because it just creates nothing. Thank you.
Thank you. I think it was the deforestation of man that led to the bats coming up. I would have Dr. Naqvi just finish off with the spiritual, since he had an excellent talk on it, with exactly 59 seconds, because then we'll be moving to the appearance of the 12th Imam Myth or Reality session right here in this Zoom with Hujjat al-Islam Haider Shirazi. So you've got exactly 59 seconds, Dr. Naqvi. Take it away. I've done a virtual colonoscopy, but this was a virtual session that was good for gastroenterologists, I can say.
If somebody can turn on my video, if we can turn on my video, then I can join in. I'm not sure you can hear me. You can,
yeah, we can hear you. We can hear you.
So yes, now hold on a second.
I can put a plug in for Code Blue Radio too.
So I will be very brief, as you're asking me, and I will just quote what I did in my talk, which is embrace the dance of uncertainty and have faith in Allah, or have faith in the universe. That's what he said. And my second quote would be, which I did give in my talk, as you're only given 59 seconds, control your mind and let your mind not control you. I think I cannot say anything more than that.
Control your mind. Great. Again, thank all the panelists for an excellent session. Next session in this same breakout session on Zoom, ID 585-342-5863, is the appearance of the 12th Imam, Myth or Reality with Hujjatul Islam Haidar Shirazi, and breakout 4, Family Matters with Sayyid Hadi Yassin, is on 656-374-0873. This is your moderator, Dr. Syed Jafri, otherwise called Khambar Jafri. Code Blue Radio host signing off till we meet in person for 2021, and we'll continue with virtual session. Thank you very much. Take it, moderators Arif and Mohsen, to your next session.
Thank you, Brother Kumber, Dr. Jaffrey, and all the IMI participants. Thank you, all of you. It was a very excellent, informative session. Unfortunately, we only had 90 minutes, and we can see that you had a lot to say, and Kamar Bhai had a lot to ask, but unfortunately, we do have some time restrictions. Really appreciate all of your talks.
Thank you very much. Thank you.
Thank you.
So now I request Brother Zain Beg to come forward and handle your session now. I'm going to make you the co-host, and
Assalamu alaikum. Can everyone hear me?
yes, we are.
Okay, I'll just give it 1 to 2 minutes to let everyone join in. Assalamu alaikum, brothers and sisters. Before beginning the program, I would like to introduce the speaker for this segment. So Maulana Haidar Shirazi serves as the resident scholar at Abrar Islamic Center in Vancouver, Canada. He moved from London, UK, and studied at the Hawza Ilmiya Qum, and has contributed over 1,000 videos on various topics. Alhamdulillah, he has been an invited speaker to a wide range of countries for Islamic lectures. The topic for today's lecture will be on the appearance of the 12th Imam alayhi salam. Is it a myth or reality? And under this topic, there will be many subtopics he will address, such as preparing to welcome the Imam's return, religiosity in the end of time, elements that strengthen and ruin one's faith. And with so many well-wishers of the Imam, why is there only 313? And are they not present yet? And is the reappearance of the Imam a myth or real? And lastly, the effects and benefits of deen in this day and age. Before passing it over to Maulana, please make sure to keep your camera and mic off so the connection remains good throughout the lecture, inshallah. And lastly, I understand there will be lots of questions about this topic. So we will conduct a Q&A on Slido. The link and information will be in the chat as well as the room ID. So please go in and enter your question once the lecture concludes. Without further ado, I'd like to pass on the mic to Hujjatul Islam, Maulana Haidar Shirazi, to address the gathering.
السلام عليكم جميعا ورحمة الله. الحمد لله رب العالمين. الحمد لله من أول الدنيا إلى فنائها ومن الآخرة إلى بقائها. الحمد لله على كل نعمة وأستغفر الله من كل ذنب وأتوب إليه وهو أرحم الراحمين. وصلى الله على سيدنا ونبينا أبي القاسم المصطفى محمد وعلى أهل بيته الأطيبين الأنجبين. اللهم كل وليك الحجة ابن الحسن صلواتك عليه وعلى آبائه في هذه الساعة وفي كل ساعة وليا وحافظا وقائدا وناصرا ودليلا وعينا حتى تسكنه أرضك طوعا وتمتعه فيها طويلا. It is the birthday of Imam Rida alayhi salatu wassalam, the kind Imam, Imam Ra'uf alayhi alaf al-tahiyyati wa-thana. On behalf of every one of you, on behalf of those who have no access to this dunya anymore, I recite these two sentences of the salawat and the ziyarat of Imam qurbatan ila Allah. Allahumma salli ala Ali ibn Musa al-Rida al-Murtada al-Imam al-Taqi al-Naqi وحجتك على من فوق الأرض ومن تحت الثرى الصديق الشهيد صلاة كثيرة تامة زاكية متواصلة متراتبة كأفضل ما صليت على أحد من أوليائك. May Allah Tabaraka wa Ta'ala never ever keep us away from Quran and the Ahlul Bayt alayhim as-salam, even for a moment. May that be here or in the hereafter. The topic that we have for today is the appearance of the 12th Imam. Is it a myth or a reality? And preparing to welcome the Imam alayhi salatu was-salam and deen, religiosity in the end of time, and what are the elements that could strengthen and the elements that could ruin one's faith. And some other topics, inshallah, will be discussed. Now, first of all, this era of intizar, waiting, is the era of hope, hoping for the real human and divine values. So when people talk about Akhir al-Zaman and they say that it's scary, it's not scary, it's end of a term, and it is the starting of a benevolent term. So the return of the Imam is the start of a benevolent era for this entire creation of Allah Tabaraka wa Ta'ala. The effects of believing in the Imam alayhi salatu wassalam, Imam Mahdi alayhi salam, according to the Ahlul Sunnah, they do believe in him. And this faith, it's common among all the Muslim sects and at large in all the other schools of thought and other religions. Everyone is waiting for a Messiah. Now with the Ahlul Sunnah, we do have a difference of opinion, but the fundamental belief in Imam Mahdi alayhi salam, we are all on the same page. Their ulama, they have written many books on this topic. Some of them believe him to be from among the descendants of the Holy Prophet, some don't. Some believe that he is born and is alive. Some say that he will be born in the end of time. There are in them those who believe that he is alive, and in this era of ghaibat, people, they meet him, they have benefited from his presence, and there are in them those who have a similar faith like us, who believe to be alive, and from the descendants of Hazrat Fatima and Amir al-Mu'mineen, Ali alayhim as-salam. From among the Shafi'is of Iran, Egypt, Tunisia, they believe the 12 Imams, they are among the greatest of the fuqaha, the jurists and the supreme jurists. They believe that the Imams after the Prophet sallallahu alaihi wasallam, they have the loftiest of ranks in fiqh, in akhlaq, in adab, and people should refer to them in their religious and ethical affairs. And this is that very first offshoot that separated deen from siyasa, from politics. Some accept the marja'iyat of Amir al-Mu'mineen alayhi salam in religious affairs. because he was the most knowledgeable. And the Prophet ﷺ had chosen him for the leadership and the religious affairs, because he knew a lot, and the Prophet ﷺ, he has appointed him for the religious marja'iyah, and this is not the political leadership. Now, some of the Shafi'is, they have accepted this fact that the Imam from the sons of Ali alayhi salam and Fatima alayha salam are the religious maraja, the religious authority, and the political marja'iyah is upon the people. Now, the belief in Imam Mahdi alayhi salatu wassalam in the Shia culture, according to the Shia belief system, we have a very high belief system. We have a very esteemed opinion regarding the infallible Imams. Shias believe not only are the Imams the Maraja, the political and the religious authority, but in fact, the Imam of every time is by the command of Allah Tabaraka wa Ta'ala, is a sharik, a partner of the Prophet Sallallahu Alaihi Wasallam in all of his ranks, with the exception of Risalat and Nabuwwat. The knowledge of the Imam is divine, it is Ilahi. His might, his qudrat is divine, it is Ilahi. It is God-given. His rule, his hukumat is also not superficial or just political. The rule of the Imam alayhi salam, his hukumat is also divine, like his existence. And it is connected to Allah Tabaraka wa Ta'ala, which connects the creation of Allah to the Almighty Allah. The Almighty, He bestows ilm, knowledge, wisdom to the Imam with immense karamat and abundant special favors. Now, this knowledge is given to the Imam or bestowed upon the Imam without the need of the Imam acquiring it. It is embedded in him, in his childhood, and all those magnificent powers and abilities, they are favored at such a young age that the best of the elderly can never achieve even part of what Allah Tabaraka wa Ta'ala bestows upon the Imams alayhim as-salam. Unlike us or people at large who are obliged to a duty at the age of 15 or 16, Imams, they are duty bound from birth. Their understanding and perception is not like that of other men. Even if he is designated the rank of an Imam in childhood, he knows and is aware of all that he is obligated to. He knows every language. He speaks to everyone in their own native language. And much more than this, Imam has the wilayats on the hearts and souls, has special favors and bestowals on the true and sincere of his devotees. His du'as for his sincere followers, they are granted. And the Imam is aware of the actions of all people. He is aware of the intentions and thoughts. He knows what goes through their hearts, their inspirations, their aspirations. And in fact, in the era of ghaibat, Imam is totally aware of our behaviors, our intentions, and our attitudes. And this is an exclusive Shia belief system. That is, in all mishaps, dead ends, the outlet, the hope in all dead ends is the Imam, alayhi salatu wassalam, wa ruhi wa arwahul alamina liturabi maqdamihi al-fada. And the Imams, they too help. One of the barakat of the imposed war or the sacred defense in all these uprisings was that the youth, they have witnessed numerous helps from ghaib. And this is the most precious bestowal of the Almighty Allah. They witnessed and they are witnessing even today. with their own eyes that the presence of Imam is felt, is seen, is sensed. And this asset has reached us at a very high price, and we should not give it away for nothing. It is the bestowal of all the pure, the blood of all those shuhada that has been shed on this pure path, and that is to get the message to generations to come. And it is upon us that we also work and get this information for generations to come, inshallah. Now, these visitations or the mulaqat or meetings that people had with the Imam and his special inayats should be all compiled and put together for generations to come. Imam's help, seeking help from the Imam, it does not contradict the divine system, the divine and the natural system that Allah Ta'ala has laid. Imam's service providing is in line with the divine system that we believe in the Tawheed, in the Adl, in the Nubuwwat, Imamat and Qiyamat, and this service providing of the Imam does not contradict with this belief system of ours. The Imam is part of the Ilahi MSN service and a takamul and a perfection to the service providing system of Allah, and it is not against or parallel to it. The intention, the irada of the Imam is the intention and the irada of Allah Ta'ala, where it says that qulubuna aw'iyatun limashiyatillah, that our hearts, they are where the intention and the irada of Allah Ta'ala originates from. And it is that vessel wherein the divine irada, the intention of Allah reflects. That what Allah wants is reflected here and nothing else. Now, the belief in Imam Mahdi alayhi salam in personal and in social living, talking about the Imam alayhi salam, arwahul alamina liturabi maqdamih al-fida, which means my soul and the souls of all the dwellers of the universe be sacrificed unto the dust of his feet. Now, this has numerous dimensions, various aspects, historical, social, various dimensions of the Imam alayhi salam. Now, to understand this in easy words, one of the news reporters of the late 1970s is an Egyptian news reporter. You must have heard his name, Muhammad Hassanain Haikal. Now, he says that God, he was blessed. And he says that one day when I was looking at these news channels and he was to report the biggest news of that year, and that is Shah has fled Iran, and Shah, the most powerful, the ruler in that region, he has fled, and Imam Khomeini is to return. And when he hears one of these interviews of Imam Khomeini, says that he, such a great person himself, who could oust the Taghut of his time from his country, a ruler who was the ruler for a descendant from the past 2,000 years, says when this humble man, he talks about Imam Mahdi, he says, Ruhi wa arwahul alamina liturabi maqdamih al-fida. Says that, what does that mean? He himself is great. And he's talking about someone that his soul and the souls of all the inhabitants of this world be sacrificed unto the dust of his feet. That was the turning point that came into the mind of this news reporter. So the belief that we have in Imam Mahdi alayhi salam, it is real, it is not a myth. And all these observances that we have, jasans that are observed, festivals that are celebrated, Eids, decorations, etc., all of them in the remembrance of the Imam alayhi salam, why are they held? Why so much of an importance be given to it? for Ashura, that much of an emphasis, for Arba'een, millions marching to Abu Abdullah al-Hussein, 15th of Sha'ban, that much of an azama. Now, to understand this in simple words, Marhum Ayatullah al-Uzma, Sheikh Murtaza Ansari, amongst the most renowned ulama of the Shia world. Now, the books that were written by this great Alim are even taught today in the advanced level, the Rasail and the Makasib, and the books were written about 200 years ago. This great Alim, and he was the only marja of his time, was standing at the entrance of the sacred shrine of Amir al-Mu'mineen, Ali alayhi salatu wassalam, greeting and welcoming the mourners, lamenting and wailing for Abu Abdullah al-Hussein on the 9th or the 10th of Muharram. Afandi, he is the governor of Iraq from the Ottoman Empire. He was standing with Sheikh Ansari. Afandi inquired, Sheikh, we do admit that Hussein, son of Ali, alayhim as-salam, was martyred, oppressed, and that Yazid, son of Muawiyah, la'natullah alayhima, was a ruthless dictator. And we too sympathize with you on this sad occasion. My question to you, Sheikh Ansari, is, what is meant by all these observances? Groups lamenting, groups with zanjir, with dust and clay wiped on their heads and faces. What is the aim behind all this? Sheikh replied, the secret behind all this is that we, the Shias, have been deceived once. And with these observances, we try to not be bitten again. Astonished with this reply, Afandi says, what do you mean? Shaykh Ansari, rahmatullahi alayh, said, in the event of Ghadir, the Prophet, very loud and clear, he appointed Amir al-Mu'mineen, Ali alayhi salam, as his successor. In the presence of hundreds of thousands of people, and you all denied, saying it wasn't Ghadir. It wasn't important. It was his advice to be friends with him, etc. The problem was with us. We did not observe Eid Ghadir loud and clear, with rallies and processions and slogans. We did not observe it as it should have been, and the outcome is before you. We fear that if Ashura too is not observed as such, you will yet again deny, saying Hussein did not exist, he wasn't martyred, or that Hussein was killed by thugs and thieves, and Yazid was a good, God-weary person. So what is the secret behind this aqidah and the belief in Imam alayhi salatu wassalam? If one's personal life in the community is in the community, we believe that the actions, a'mal that we do, our actions, all of them, they are presented before the Imam alayhi salam in the books that we have. In Hadith, in Akhlaq, Babu Ardil A'mal is a chapter where the actions and the a'mal, they are presented before the Imam alayhi salatu wassalam. Now, the educational effects of this belief is that how frequently is it presented? Some riwayat, they say that it's once in a week, some say twice a week, some say it's twice a day, some say once a day. Quran says, and many of the riwayat, they say that it is a live connection between us and the Imam. Every move of ours is before the Imam alayhi salatu wassalam. He sees our performance, our actions. If they were good and satisfactory, he gets happy. He prays for us. And if it's bad, he is upset. Now, these actions that he looks into and is happy, pleased or unhappy, it is the actions of the Shias. Man az biganegan har digar nanalam ke ba man har che kard an ashina kard. I have no complaint with the strangers. To me, what they did and they did bad is our own people who did bad. And we see that an ayah in Quran also, in Surah Al-Hujurat, says, وَالَّذِينَ يُؤْذُونَ رَسُولَ اللَّهِ لَهُمْ عَذَابٌ أَلِيمٌ. And those who torment the apostle of Allah, those who hurt the apostle of Allah, there is a painful punishment for them. This applies to the Imam alayhi salam as well. So whosoever hurts the Imam in whatever way, in whatever manner, lahum adhabun alim. For them is a painful punishment. One who likes someone would never want to upset him. If we adore the Imam, if we love the Imam, then we should be cautious not to hurt him in any way. And if he is such a great and generous, that is, at times we do commit wrong, and he seeks forgiveness and maghfirah for us from Allah Tabaraka wa Ta'ala. But if someone's practice was wrong, he loses that wilayat of Imam alayhi salam, and we seek refuge in Allah from such a status. Now, the reality of being a true Shia for the Imam alayhi salam, being a Shia under the wilayat of the Imam alayhi salam, it is not just in words and claim. How much of our Shiaism is accepted by the Imam? All of us claim to be the Shias. Are we his true followers, or we just Shias by IDs and by claim? It may well be that many who are not Shias before the Imam, upon him be my soul, and the souls of the universe be sacrificed unto the dust of his feet, they may be way esteemed than many of us. Assalamu alayk, ayyuhal imamur ra'uf. Salam be upon you, the kind Imam. Now people, they came to Marv to visit Imam Riza alayhi salam. The caretaker, he opened the door and they said, who are you? He says, we are the Shias. The group said, we are the Shias. We've come from a faraway place to see our Imam. He comes and gives the message to the Imam, and he comes and says, come later. They come the next day, they come another day, and for 60 consecutive days they came to the Imam. And now they got upset. They came and on the 60th day said to the Khadim that say to the Imam that we love him, we are his followers, we have come from a faraway place, and if we return not seeing the Imam, and then people, they will mock at us. They would say, your claim was that you are his Shias, you are his followers, and he is your Imam. How come he did not see you? This message was given to the Imam. Imam comes and says that your claim was wrong. You said you are the Shias, when your actions are different. They are not compatible to what we do. Your actions are against what we preach. Your words and your statements, they are different. If you say that you are the lovers of the Imam, that's a different claim, but you claim to be the Shias. Now, ways to being a true Shia. Now, all of this is a lesson to myself first. Now, paying attention to the supervision of Imam alayhi salatu wassalam in our actions, and then practicing all the religious instructions, every wajib, every haram to be put away, and indeed some rights we do not observe, like rights of friends, relatives, near and distant, spouse, children. We think we are good in deeds, and we think that the good deeds are only prayers and fasts and du'as. A good Shia is one who does all the good and refrains from all the bad. He takes the entire package, practices on the entire package. Now, the ashab, or the associates of the Imam alayhi salam, I'll quote some ayat from Quran. We get a better picture of what our duty is and how can this support be rendered to the Imam, so that we too be enlisted among the best of servants of the Imam alayhi salam, inshallah. Now, the associates of the Imam. What are their qualities? The Almighty in the glorious Quran says, وَكَأَيٍّ مِّن نَبِيٍّ قَاتَلَ مَعَهُ رِبِّيُّونَ كَثِيرٌ فَمَا وَهَنُوا لِمَا أَصَابَهُم فِي سَبِيلِ اللَّهِ وَمَا ضَعُفُوا وَمَا اسْتَكَانُوا وَاللَّهُ يُحِبُّ الصَّابِرِينَ. Says that how many a prophet there has been with whom a multitude of godly men fought. They did not falter for what befell them in the way of Allah, neither did they weaken, nor did they abase themselves, and Allah loves those who are sabir, who are steadfast, who are patient. Now the following ayah says, وَمَا كَانَ قَوْلَهُمْ إِلَّا أَنْ قَالُوا رَبَّنَا اغْفِرْ لَنَا ذُنُوبَنَا وإسرافنا في أمرنا وثبت أقدامنا وانصرنا على القوم الكافرين. That is, God, their statement was, forgive us and the wrong that we have done, the israf that we have committed in our affairs. وثبت أقدامنا, keep us firm. وانصرنا على القوم الكافرين, and then give us success over the faithless lot. Now in this ayah, the term Ribbiyun was used. Ribbiyun in Quran has been mentioned twice. What does it mean? Ribbiyun, they are those sincere muwahhideen, sincere monotheists, who served and who fought in the service of the Imams and the Prophets alayhimus salam. And the applicable of Ribbiyun in this day and age, we can say they are the Basijis, or they are the Hishn al-Sha'bi, or those from among the people who stand for their rights and in the service, and those who serve sincerely without any gain, without any hope and desire that they would be given something. No, with no hoping of anything worldly. Ribbiyun, sincere, muwahhid. After the Holy Prophet sallallahu alaihi wasallam, and until this day and age that we are living in, there have been numerous uprisings, numerous movements. None of them were complete, perfect. And among all those who stood and who fought and who served, you cannot find anyone as sincere as these Basijis or these Hishn al-Sha'bis, for example. And among the most significant qualities of the Ribbiyun that has been mentioned in this ayah is their high spiritual might, their tolerance, seeking forgiveness, seeking to be firm and upright, seeking victory. ربنا اغفر لنا ذنوبنا وإسرافنا في أمرنا وثبت أقدامنا وانصرنا على القوم الكافرين. I will shed some light on this ayah and the associates, what qualities they need to have. First of all, the ayah says they are very powerful and high, they have very high spirits. Now the battlefields, fighting, being killed, the longer it lasts, the more difficult it becomes. And it has its own negative drawbacks, like being away from family, domestic problems in the family, lack of help, support at home, poverty, devastation caused due to war. All of these are a result, and which results in the weakening of one's iman, one's faith, one's intention. Health also, it deteriorates, it becomes weak. Abilities also, they drop down. And all of this stems from the war, the battles, and the issues that the person results in drifting away and maybe submitting to the enemy. Now Allah, He lauds the mujahideen, the warriors, and those in love of the Prophet. People, they participated in battles in his support. They never showed any weakness. Even if the battles took longer, they never changed, they never switched. And they were firm and they were steadfast. Quran says, فَمَا أُوَانُوا لِمَا أَصَابَهُمْ فِي سَبِيلِ اللَّهِ وَمَا ضَعُفُوا وَمَا اسْتَكَانُوا. They did not falter for what befell upon them in the way of Allah. Neither did they weaken, nor did they abase themselves. Numerous of these great people have been seen, and you have seen, we have seen, and they do exist even today. Now, the second lesson that we learn from this ayah is that these courageous, brave warriors mentioned in this ayah, they are very energetic, unwearyingly tireless people, and they are beloved of Allah Tabaraka wa Ta'ala. Allah says, Wallahu yuhibbu as-sabirin. If only this reward was mentioned in the glorious Quran for the warriors, that was more than sufficient, that being the beloved of Allah Tabaraka wa Ta'ala, and someone loved and adored by Allah, will he have anything short? Does he need anything else? That love of Allah is more than sufficient for him. 3. Forgiveness, steadfastness, being firm and helpful. Now these warriors, these mujahideen, these associates of the Imam, amidst these agonies and mishaps of the battles they witnessed, their dua was, وَمَا كَانَ قَوْلُهُمْ إِلَّا أَنْ قَالُوا رَبَّنَا اغْفِرْ لَنَا ذُنُوبَنَا وَإِسْرَافَنَا. Their dua was that God forgive us and the wrong that we have done, and keep us firm and give us help upon the faithless lot. The fourth is that a loving relationship with Allah Tabaraka wa Ta'ala. There are many ayat and riwayat that talk about and they laud about the Shias of Akhirul Zaman, and they are alert, they are aware, they are basir, insightful. And it also is applicable to the Ribbiyun Kathir, Ribbiyun, the sincere, the monotheists, the Muwahhideen. Quran says, Ya ayyuhalladhina amanu, man yartadda minkum an deenih. Many a times people, they are on track and then they switch and they say it was we who were supporting this deen. If it wasn't for me, then all these favors and topping up of what I have done for that deen, etc. Quran says that if someone switches, if someone deserts the religion, فَسَوْفَ يَأْتِ اللَّهُ بِقَوْمٍ, Allah will soon bring a people whom يُحِبُّهُمْ وَيُحِبُّونَهُ, whom He loves and who love Him. أَذِلَّةٍ عَلَى الْمُؤْمِنِينَ, humble towards the faithful. أَعِزَّةً عَلَى الْكَافِرِينَ, and those who stand firm, steadfast towards the faithless. So if a person deserts that religion, moves away from deen, or says that starts favoring on that deen and then switches away, he does no harm to deen. Allah will replace them with better people. Now the previous ayah, it talks about the sorrow of the Prophet and the mu'mineen due to weak people with a weak iman that resulted in them retrieving at times. And the latter ayah is a glad tiding to the Prophet sallallahu alaihi wasallam that the support and well-being of religion will be through the mu'mineen, who are staunch, who are strong, who are courageous, insightful, who are basir, and that should never make the Prophet sad. 5. Humbleness before the mu'mineen and strong confronting the faithless. Among the other quality of these associates of the Imam is أَذِلَّةٍ عَلَى الْمُؤْمِنِينَ أَعِزَّةٍ عَلَى الْكَافِرِينَ. 6. They do not fear the taunts. There will be a lot of mocking when a person is on this path and wants to be among the servants of the Imam. Says يُجَاهِدُونَ فِي سَبِيلِ اللَّهِ وَلَا يَخَافُونَ لَوْمَةَ لَائِمٍ, waging jihad in the way of Allah, not fearing the blame of any blamer. No matter how much people mock, you will move ahead. And then one of the du'as that we all recite especially in these ziyarat that we recite to Abu Abdullah al-Hussein, is that Ya laytana kunna ma'akum fanafuza fawzan azima. We wish that we were in Karbala. We wish we were martyred. But in action, if we are not prepared to even bear a little pain, a little slap, a little mock, or beaten up, or hurt, or be told off, then how can we be with Hussein alayhi salatu wassalam? So all this, again, a lesson to me first. So where the Ribbiyun was mentioned, they are the sincere, and they are not feeble, they are strong, they are steadfast, and they cannot be compared to anyone. So that Iman is what gives them the might. Now, the seventh lesson that seventh quality that a person to be among the ashab of the Imam, and that is criteria of rendering help to the Imam. And the more this relationship is divine, truthful, strong, and reliable, the aids that one gets from him too, they are massive. The more support you give to the Imam, the more support you get from the Imam. It says, Uzkuruni azkurkum. You remember me, I will remember you. It says, in these turbulences, the strongest of people, they used to say that the job is done. The sincere and the faithful said otherwise, because their desire and their want was قَالُوا رَبَّنَا اغْفِرْ لَنَا ذُنُوبَنَا وَإِسْرَافَنَا. Everyone was after everything else, but here they said that we want to be firm and steadfast on your deen, and God help us. This was the dua of those sincere. Now, when you look into Quran, the shortcomings they may have will be compensated by Allah. That is, if someone sincerely desires to be among the servants of the Imam, and there are shortfalls in him, there are shortcomings in his existence, but his desire is to be with the Imam. Quran says, Ya ayyuhalladhina amanu, in tansurullah yansurkum. You help Allah, He will help you. وَيُثَبِّتْ أَقْدَامَكُمْ. He will keep you firm, steadfast. And in Allah la yukhlifu al-mi'ad, Allah never lies. And what we say, Sadaqallahu al-Aliyyul Azim, after the recitation of Quran, that Allah has spoken the truth. Whatever He says, He does it. When He says, you help, I will help. In Allah la yukhlifu al-mi'ad, that this is a definite command, and He does not turn away from His word. Why is that? ذَلِكَ بِأَنَّ اللَّهَ لَمْ يَكُ مُغَيِّرًا نِعْمَةً أَنْعَمَهَا عَلَى قَوْمٍ حَتَّى يُغَيِّرُوا مَا بِأَنفُسِهِمْ. That He will never bring about a change unless we bring about a change in ourselves. So the change that we bring is that package that Imam has brought forth, we take that package blindly, practice it, all of it, without adding anything to it, removing anything from it. And unlike their predecessors, who were honorable, who were the delight of the Almighty, as their relationship with the Almighty, it deteriorated, that height of fame and honor, it changed to defamation and disgrace. Allah says in the following ayah, says, فَخَلَفَ مِنْ بَعْدِهِمْ خَلْفٌ. There were people who were with the Prophet. There were people with Amirul Mu'mineen. And when they saw that their interests and their benefits are not being provided, they switched, they moved. So this has been happening throughout history, during the time of Abu Abdullah, during the time of Rasulullah, even today it's the same thing. Quran says there's nothing for you to worry. Deen is of Allah. That Imam is divine. Support is divine. People who will help him are there. If someone switches and moves away, فَخَلَفَ مِنْ بَعْدِهِمْ خَلْفٌ. But there were people who were succeeded by an evil nasl, an evil posterity. Says, أَضَاعُوا الصَّلَاةَ وَاتَّبَعُوا الشَّهَوَاتِ. The reason why they were switched and they were apart from the Imam and his movement was that they neglected prayers and they followed shahawat, their temptations and desires. So prayer in our deen, it comes first and foremost. Whenever you see that there is lesser importance being given to salat, means that is that danger zone, that is that gray area. Something has to be done quickly and fixed. It says, أَضَاءُ الصَّلَاةِ وَاتَّبَعُوا الشَّهَوَاتِ فَسَوْفَ يُلْقَوْنَ غَيًّا. And they will soon encounter the reward, and that is for the يُلْقَوْنَ غَيًّا. Now we want to be among the ashab of the Imam. We want to support him and we want to help him. Why is that? One of the reasons why we all want to help the Imam is, and we do recite this in Dua Iftitah and many of these ayat that we have in Quran, is because Imam, he will remove and he will delete all of the tawaghit and the arrogant powers, all of the taghuts from the surface of this world. Now we also claim that wish is there, that desire is there. Now if we are true in our desires, and it has been mentioned repeatedly that if someone wants to be wants to be good to the Imam and he's bad to his own father, then definitely he cannot be good to his Imam as well. Or if someone is in taqleed of a mujtahid today, then tomorrow when Imam comes, switching from this taqleed of this mujtahid to the taqleed of Imam, it's going to be simple and easy. But if someone doesn't follow Imam, is not respectful to his father, will definitely not be respectful to the Imam, will definitely not be obedient to the Imam. Now we say, and the dua is, we want the Imam to return so that all of the taghuts from this dunya, the arrogant powers, they are removed. Now, if someone could not be with Imam Khomeini, who just kicked out and ousted one taghut, then how can he claim to be that he wants to be with the Imam who wants to put away all of these taghuts? So we have to think in everything in those lines. So consequences of following the divine leaders, not obeying the representatives, the nawab of the Imam, the sufferings that we see, it's all because of disobedience. For example, Shaheed Ayatollah Hakim was killed in Najaf, or before that Shaheed Sadr was killed, and so many shuhada worldwide. So all of this mishap, or most of the mishap that people they are seeing, is as a result of disobedience or not following the instructions of their divine leaders. Honor and fame is given to someone who is obedient to the Imam, who follows the footsteps of the Imam. And feeling of safety and security is also in being obedient to the Imam alayhi salatu wassalam. So one of the most dangerous perceptions for the believers is that we have won and Allah has made us victorious, and here on we have nothing to do. Some people fell into these traps of pride and ghurur and fakhr, and this thought also is batil. In fact, He, the Almighty, is the most, and he's so severe in taking an account. What Quran says, "Huwa shadidul mihal." Though he is great in his might, at the same time his wrath is also painful. So we have to worry about our own fate and what our end is going to be. Now, one of the other things that we learn from Quran is that وَإِذَا رَأَيْتَ الَّذِينَ يَخُوضُونَ فِي آيَاتِنَا فَأَعْرِضْ عَنْهُمْ حَتَّى يَخُوضُوا فِي حَدِيثٍ غَيْرِهِ. Says that when you see those people, they are gossiping and mocking the signs of Allah, what do? Do you continue with those chats? Do you stay in that room? Do you sit with those people? You have to draw lines. You have to get away. You cannot be with them. That is the command of Allah Tabaraka wa Ta'ala. So when it comes to the wilayat of the Imam and obedience towards the Imam, it has to be a total submission towards the Imam alayhi salatu wassalam. Now people, one of the other things that we learn, what are our duties in this end of time? A very difficult time it will be. Now, first of all, the term Akhiruz Zaman, it's a very wide terminology that we have. in one of the riwayat that we have from the Holy Prophet sallallahu alaihi wasallam, or for example, it's from Sulaiman alayhi salam. When he was traveling, he comes over Medina, the city, and then he says to his companions, Prophet Sulaiman, this city that you see, this is the city of the Prophet of the end of time, Prophet of the Akhirus Zaman. This is his city. So Akhirus Zaman, it starts from Rasulullah. And Rasulullah, he says in a riwayat that I and Akhirus Zaman and the Day of Judgment, he points out at his two fingers and say it's going to be that close. Now, when we see the riwayat and the belief system that we have regarding Akhirus Zaman and the return of the Imam alayhi salam and the Day of Judgment, that's going to be after the zuhur of the Imam alayhi salam, and may Allah hasten in his return and count us all among the best of his servants and those who are firm and those who seek shahadat in the service of the Imam alayhi salam. Now, what are our duties here in the end of time? A very difficult time, and it is possible that man is a mu'min in the morning and a kafir in the evening. يَصْبَحُ الرَّجُلُ مُؤْمِنًا وَيُمْسِي كَافِرًا. That is what the hadith says. Now, this points out at this issue that people in the end of time, with the faintest fitna and doubts, they will lose their faith. And in this day and age that we are living in, fitnas, they are just erupting from every moment, especially with the social media. Two things that we have happening quite a lot. Everyone has become a physician. Everyone is prescribing prescriptions for the well-being of human beings, and also deen. Everyone has become a Maulana, prescribing all these rulings of deen. So these two have been targeted a lot. Now this, and in this warning to each one of us, is that religion will be attacked a lot, and there will be all these doubts that will be casted and posted. And we have to be extra cautious, extra vigilant, that we are not caught in these traps. Says, what do we do? يا أيها الذين آمنوا اصبروا وصابروا ورابطوا واتقوا الله لعلكم تفلحون. A lot of patience is required. We have to be firm on the path of Allah, and these du'as that we have, for example, Rabbana la tuzigh qulubana, that Allah do not swerve us, our deen, our iman, ba'da iz hadaytana. Now that you've guided us, don't swerve us, don't shift us, keep us firm on your path. Now, one of the other things that we have to look into is that Imam alayhi salatu wassalam is the highest ranking being in this creation, in this entire universe today. And the highest rank of the Imam is due to the qurb and the nearness of his to the existence of Allah tabaraka wa ta'ala. We do find in du'as that la farqa baynaka wa baynaha illa annahum ibaduka wa khalquk. Says that there is no separation, difference between you, that is the Almighty Allah, and them, that is the Imams. What is the difference? That you are their Lord and they are your servants, and they are your creation. And all their affairs and tasks, they are taken care by you. Their origin, their return is you, Allah tabaraka wa ta'ala. This is that highest rank that the Ahlul Bayt, they have arrived, being an abd, a servant of Allah tabaraka wa ta'ala. And people, they perform this ghulub and talk so loud about Amir al-Mu'mineen and take him to the rank of, God forbid, uluhiyyat and lordship. They don't see that Imam, it was the sacred month of Ramadan, he was fasting. Fasting for who? He was in a masjid, worshipping who? He was in sajda, before who? And he was killed in the way of who? And then how can someone who is such sincere, so humble before the existence of God, Now, Imam alayhi salatu wassalam, he is a reflection of the immense mercy of Allah tabaraka wa ta'ala. The merciful God, due to his mercy, he places the best of his creations in turbulences, in waves of sorrow and distress, grief and mishap, to enable them to grow. Now, in this era that we are living in, numerous and enormous pains, agonies, afflictions, griefs, sorrows, mishaps are seen that have saddened the pure heart of the Imam alayhi salam. The souls of the world be sacrificed unto the dust of his feet. Imam, he is Ra'uf, kind, the kindest man on earth. He has seen so much of pain. Now, one of the beliefs that we have is that Imam is ma'asum, infallible. He never forgets anything. Now, when there is a tragedy in our homes, when someone who among the loved ones he passes away, after a certain time, we see that gradually we forget and the sorrow and the pain is gone. This is not for the Imam alayhi salam, because he cannot forget. Being an Imam, he has to remember everything. And then so much of pain, so much of distress, so much of agony. And then when we see these aqaid that we have and what we believe in, and when he says that لَأَنْدُبَنَّكَ صَبَاحًا وَمَسَاءً, that upon you, my grandfather Hussein, I cry upon you morning and night, twice a day, and then I shed tears of blood. Now, the way to get to the height of love and ma'rifah and that insight, that basirat, is that now we have various sciences, fiqh, usul, aqaid, akhlaq, tafsir, philosophy in our field, and then in sciences, so many thousands and hundreds of fields are there. Now, when the term regarding aql and ilm is inquired, Imam as-Sadiq says, "Ma ubida bihir Rahman wa tasaba bihil janan or hussila bihil janan." Says aql, that intellect, is that what makes you worship the merciful God, and with which you can get to the heaven, you can acquire the heaven. Any science, any ilm, any field which submits us, which brings us closer to Allah Tabarak wa Ta'ala is ilm. It can be anything. And if I, by studying and by research, I get closer to Allah, that ilm, it becomes a means of qurb to Allah Jalla wa Ala. Now, this ilm and that love or that aql, how can it step up and how can we work to get on top? Because when we talk about the people who will be in the end of time among the 313 who are among the ashab of Imam, what kind of a people are they? Are they some special people, no special creation of Allah. It's just like you and me, but those who have been sincere, those who have been obedient to Allah Jalla wa Ala in all walks of life, they have observed all of the do's and then refrained from everything that was forbidden upon them. So step by step, we have to work to get to the top. Like, for example, the love that we have towards our parents, our ustad, the mujtahid, the neighbors, children, grands, offspring, etc. Ilm also is like that. Ma'rifat is also like that. So all of these, they are ma'arif, and step by step, they have to get to the top. Now, this love also that we have towards Allah, towards the awliya, and towards everything else, that has to be divine. I love my parents because Allah has instructed me so. I worship because Allah has instructed me so. In kuntum tuhibbuna Allah fattabi'uni, that if your claim is that you love, because the command of love is from Him and He has asked me to be obedient to Him, then Allah says, then that reciprocal love from me also will be sought. Now, one of the other things that we learn from the divine book is that قُلْ إِنْ كَانَ آبَاؤُكُمْ وَأَبْنَاؤُكُمْ وَإِخْوَانُكُمْ وَأَزْوَاجُكُمْ, says if your fathers, your sons, your brethren, your spouses, وَعَشِيرَتُكُمْ وَأَمْوَالٌ اقْتَرَفْتُمُوهَا وَتِجَارَةٌ تَخْشَوْنَ كَسَادَهَا وَمَسَاكِنَ تَرْضَوْنَهَا, says, and your friends and the possessions that you have and all that you have acquired through businesses and the dwellings that you are fond of, if all these loves and attachments that we have, ahabba ilaykum min Allah wa rasulih, says if all of them or any one of them is dearer to you than Allah and His apostle, and dearer to you than jihad in fi sabilillah, waging jihad in the way of Allah, and hatta ya'ti Allah bi amrih, until He waits and issues His verdicts. Wallahu la yahdi al-qawm al-fasiqeen. Allah, He will not guide the fasiqeen or the transgressing lot. So that love has to be only and only exclusively for Allah tabarak wa ta'ala. If anyone else is a sharik in it, then we will be among the fasiqeen. So that love has to be in line with the love of Allah tabarak wa ta'ala. So sincerity in the presence of Imam, ikhlas is also required. If I want to serve him, if I want to be with him, if I'm with that same noble cause of his, says if man, he can live and choose a path himself, he can invest in a way that he benefits every moment and he ascends on this pyramid of love and ma'rifah and basirat towards Allah tabarak wa ta'ala. And all the guides were sent to bring mankind closer to this path. Knowing his reality itself, it is a blessing that was blessed to us by the Ahlul Bayt alayhim salam. Now that we know that loss is in everything that is not divine. Anything which is not divine, which is not ilahi, means it is a loss, and I will be a loser. So we have to be extra vigilant, as mentioned in the Holy Quran, Innal insana lafi khusr, that mankind, he is at loss. Illa alladhina amanu wa amilu salihat, but those who have that iman, wa amilu salihat, those who have done good, wa tawasaw bil haqqi wa tawasaw bis sabr, and they invite people towards haqq, towards right, and they invite people towards patience. Now, when we see these observances that we have, all these different worships, du'as, ziyarats, or Laylatul Qadr, the 15th of Sha'ban, the day of Ashura, etc. Now, regarding the 15th of Sha'ban, says that the Holy Prophet, the riwayat that we have, it says that it is not less than Laylatul Qadr. The Prophet ﷺ, he says that I was having a nap on the night of the 15th of Sha'ban. And Jibreel alayhi salam, he called me. I rose up and I went to Baqi, the cemetery, the Qabristan, the graveyard in Medina. And then Jibreel, he said to me, Ya Rasulullah, do you know what night it is tonight? And then says, tonight is the night in which the ashqiya, that is the wretched, the disgraced, and the wrongdoers, the losers, when they seek Allah tabaraka wa ta'ala on a night like tonight, He would delete them from the ashqiya list and He would register them in the su'ada, the prosperous, the successful list. Tonight, the doors of the skies are open on all servants. Tonight, it is Babu Tawbah, the night of repentance, Babu Ridwan, to seek the contentment of Allah, Babu Ihsan, the door and the gateway to goodness, and the Babu Maghfirah, the gateway towards Maghfirah. So that is Imam alayhi salatu wassalam. So if someone wants to be forgiven, Tawbah is with getting to the Imam, tawassul to the Imam. Wants the contentment and the rida of Allah, that is with the seeking the rida and the contentment of the Imam alayhi salam. He wants to do good, then the first good that can be done is to the Imam alayhi salam. He will get to that Babul Ihsan. He wants forgiveness, then the first, and that is also via the Imam. alayhi salam. So allegiances that we have with the Imam is that we have to strengthen this bond and this connection that we have with the Imam, especially today, and with the awliya. Ask Allah Tabarak wa Ta'ala to enlist us all to be among his most sincere servants. And it is important that someone sincerely desires and he does not avail or does not benefit from his special bestowals. It is not possible at all. Whatever we ask is what we get. And all these ayat that were recited, and you help me, I will help you. You remember me, I will remember you. Now, when you remember the Imam, will he not remember you? It is the problem is with us that we don't we don't hear the Imam's replies. So, but he does get the information. The moment we intend, it is instantly and immediately in the inbox of the Imam alayhi salatu wassalam. He hears, he replies, then everything changes. Now, if you see marhum, when we look into our observances and the attitude, the best has to be given to the Imam alayhi salam from among our income, from among the services. Whatever you do, the best portion and the best share should be given. And marhum Ayatullah Mujtahidi Tehrani, who passed away just 2-3 years ago, he was of the opinion that the homes that we give on our possessions and our belonging, he was of the opinion, he used to say that even you have to pay a homes on your children. If someone has 5 kids, there's one of those kids should be designated for qum, for the hawza, so that he returns and he serves this noble cause of the Imam alayhi salam. So, and not any kid. It says the smartest of those kids should be selected to be sent and to study and return and help this noble cause of the Imam alayhi salam. Respecting the ulama, honoring the signs of the Imam alayhi salam, honoring the ahadith, the books that were written. All these are those things that we have to observe when it comes to helping and rendering our services to the Imam alayhi salatu wassalam. And the first thing that we have to have before the Imam is humbleness, and then obedience to the Imam, the ranks that Imam possesses. And that it was mentioned that everything that Rasulullah has, the Imam also has, with the exception of Risalat and Nubuwwat. And this maqam of tabyin and tafsir of Quran is with the Imam alayhi salam, and the custodianship is with the Imam alayhi salam today. And Allah Tabarak wa Ta'ala count as among the best of his servants and those who seek shahadat in his service. Now, in this end of time that we are living in, that what plays the pivotal role in us being saved from all these doubts, from all these inhirafats, from all these doubts that are being created every day, day in, day out. So elements that strengthen deen and religiosity in the end of time, one of them is tawassul, that we need help. We need tamassuk, seeking the ma'asumin alayhim salam, especially the Imam of age. In Nahj al-Balagha, Amir al-Mu'mineen alayhi salatu wassalam, he says that you tear the wild waves of fitna and advance, go ahead, move ahead. How do you go ahead? It says on the ark of salvation. In these du'as that we have, for example, in dua, in salawat sha'baniyya. Then salawat sha'baniyya, after salawat, we say that al-fulkil jariya, fil lujaj al-ghamira, fil fulkil jariya. Now, Ahlul Bayt, they are the ark, they are the ship. Sometimes the ship is caught in a storm and it just moves circles all around itself. But sometimes amidst those storms and amidst those waves, you see that this ship, this ark, it tears those ferocious waves and it moves ahead. Says Ahlul Bayt are that fulk al-jariya fil lujaj al-ghamira ya'manu man rakibaha. Whosoever gets on board will be safe. If someone stands there like the son of Prophet Nuh, says, wow, such a big ship, that would do him no good. for you or for us to be safe, we have to get on board. It says, يَأْمَنُ مَنْ رَكِبَهَا وَيَغْرَقُ مَنْ تَرَكَهَا الْمُتَقَدِّمُ لَهُمْ مَارِقٌ. Now, once we get on board, what do? Sometimes people, they go ahead of the Imam. That is also not allowed. It says, وَيَغْرِقُ مَنْ تَرَكَهَا الْمُتَقَدِّمُ لَهُمْ مَارِقٌ. Someone goes ahead of the Imam will be ruined. وَالْمُتَأَخِّرُ عَنْهُمْ زَاهِقٌ. If someone lags behind, he's also going to be ruined. So, وَاللَّازِمُ لَهُمْ لَاحِقٌ. We have to be with the Imam. Take the instructions from the Imam. Alayhi salam. Now, in such situations, one has to not rely upon himself. What does he do? He relies upon Allah Tabaraka wa Ta'ala, and he gets help from Allah Jalla wa Ala. For example, one of the best of things that can help us in this Akhir Zaman, in this end of time, is being with Deen, having this tawassul with the Imam alayhi salam. In one of these riwayat that we have from Imam Amir al-Mu'mineen Ali alayhi salam, Imam says, Ayyuhan nas, O people, Deenukum deenukum. Says, first priority be given to your deen. Deenukum deenukum. Tamassaku bih, hold on to that deen. La yazilukum ahadun an. Says, no one should lag behind. Why is that? Imam says, لأن السيئة فيه خير من الحسنة في غيره. That is, the wrong that a person does, and he is religious, he has faith and deen, says that wrong of his is good, is better than someone doing good without deen. Imam says, لأن السيئة فيه تغفر. If someone was faithful and he repents, that wrong will be forgiven. وَالْحَسَنَةُ فِي غَيْرِهِ لَا تُقْبَلُ. And the good a person does without deen, being faithless, he's doing good, says that for that good he will not be rewarded. So the first thing here, that we want to be safe in this end of time, tawassul is required. Bonding with the Imam is required. Getting help from the Imam is required. And with so many well-wishers, why is it that only 313? And are they not complete yet? Here also, when we see the number, the count of 313, they are the initial core members of the cabinet of the Imam alayhi salam. Imam, now in this day and age, for example, in the US, they have how many? I think 18 ministers. Here in Canada, they have 29. In Iran also, they have, I think, 18 ministers. And they are that core group. And likewise in China, I think 29 or 36, something like that. Now this rule of the Imam alayhi salam, that annal arda yarithuha ibadi as-salihun, that as for the land, my righteous servants will inherit this land, a rule which is going to be global and on this planet Earth. So with 16 and 18 ministers, it cannot run. So for such a massive rule, needs a core member of 313 ministers who will be the immediate instruction takers of the Imam alayhi salam for that massive rule. But we also have to wish and desire to be among them. Now, one who wants to serve the Imam and to serve the noble aim of the Imam alayhi salam and wants to be among the best of servants means that he has to be able to remove some of the burden from the shoulders of the Imam. That is, he has to be helpful to the Imam, helping hand. Now, regarding Maliki Ashtar here and the staunch supporters of Amir al-Mu'mineen, that what we see is that they were always, after getting instructions from the Imam, now to do what? What shall I do now? They were always so much occupied that they want to remove that stress or that burden from the shoulders of the Imam alayhi salam. The one who wants to serve the Imam should be among the best of servants, should aim to remove the maximum burden from the Imam alayhi salam. Imam as-Sadiq alayhi salam was inquired, when will Imam rise? He answered, when the count is complete. Now the reporter, he says, and how many in that count? Imam says 10,000. Now 313 is that first core group of his supporters with the Imam. In another quote, Imam Baqir alayhi salam says that the first to swear this bay'at and allegiance upon the pure hands of the Imam alayhi salam is Jibreel alayhi salam, followed by the 313. But the actual movement of the Imam starts when the 10,000 they get together. And in another hadith says when the 15,000 they get together. Other riwayat say when the general public gets together. Now that general public, when we talk about in these riwayat and that large number, and we see this Arba'in walk of Abu Abdullah and Hussein, shows that everything is moving towards that direction. And may Allah make it as such that we all be enlisted among the best of servants and those who seek shahadat in his service. Goft qit'e gum shude az pare parvaz kam ast. And this beautiful poem says that one of those parts is missing in this flight. One of the wing and feathers is missing for us to fly. Yazdah bar shimordim veli baz kam ast. He says we counted 11 times and we still see that one is missing, some are missing. In hame ab na az jariye ughyanus ast. All these waters that you see that are flowing on this planet Earth, all these oceans and rivers, says araq sharm zameen ast ke sarbaz kam ast. Says all this is that sweat of the earth, sweat and shame that the soldiers are very few. So the earth is crying that the supporters are very few. May Allah tabaraka wa ta'ala help us. وَجَعَلَنَا مِنْ أَنصَارِهِ وَأَعْوَانِهِ وَسُبْحَانَ رَبِّكَ رَبِّ الْعِزَّةِ عَمَّا يَصِفُونَ وَسَلَامٌ عَلَى الْمُرْسَلِينَ وَالْحَمْدُ لِلَّهِ رَبِّ الْعَالَمِينَ.
Thank you so much, Malana, for discussing such a relevant and important topic in today's time. For this next segment, we will move on to having a Q&A. Please do not post your questions on either the Zoom or YouTube chat. We will be holding the Q&A on slido.com. I have posted the link both on Zoom and YouTube Live, so please click on that link to post any questions you have. The room ID is also listed in both chats. So just make sure to enter that room ID and you'll be able to post any questions that you have for Malana. And from there, I will read any questions that you guys post. And if you have any questions that you also want to get answered by Malana that has already been posted, you can also like the question. So for the first question, Malana, Sister Fatima has said, did the Imam work to reach Imama, or did Allah bestow it on him only?
Well, the Imamat, it's a designation appointed by Allah Tabarak wa Ta'ala. So Allah appoints the Imam. And then once he has appointed, there is a strong quality control, you could say, or checker that Allah Tabarak wa Ta'ala has placed upon the Imam. But Imams, they are the best of creation. Even the flaws that we see that sometimes were seen among the prophets, which we call as turuk awla, or things that it was better for them not to have done. We do not see any of these flaws in the Imams alayhim salam. Imams, they never, now even when it comes to these du'as, for example, cursing a nation, etc., even these, they do not exist in the lives of the Imams alayhim salam. Appointment is from Allah. It's a divine appointment.
Thank you, Maulana. So for the next question, is the Imam mentioned in the Bible or Torah?
Yes, has been mentioned. And also, if you see Surah Saf from the glorious Quran, there says, Rasulun ya'ti min ba'di ismuhu Ahmad. Regarding the Holy Prophet sallallahu alaihi wasallam, his name has been clearly mentioned, and the names of the Imams also, they have been mentioned.
Okay, for the next question, while it is advisable and better to forgive than take revenge, why do speakers emphasize that the 12th Imam will come to take revenge?
Yeah, well, there are certain things and certain places where a person, that avenge has to be there. Now, it isn't as such that every sin can be forgiven. Certain, something when it comes to personal issues and personal affairs, it's good to forgive. But when it comes on a larger scale, like what Yazid did, here you don't come and say that the sin also that was committed, it wasn't an ordinary sin. It wasn't something between two people and one of them forgiving the other and it could be waved off. No, here it is a massive sin and something that has, he is standing against the existence of God, Ta'ala. So here, Yazid, it wasn't a one-to-one with Imam Hussein as such. No, here, the reason why Imam Hussein also says in his statements, for example, says that I fight because he was changing all the moralities, all the virtues to bad. He was changing the identity of a religion. Now, if you say and see a sin, a person, he drinks, that's something between him and his God. But then you see that there's someone else, instead of drinking, he has a liquor shop, a liquor store. So the sin in the second example is larger. But if there is another person who comes and he's got a manufacturing plant where he makes this liquor and provides to everyone, that is another sin which is on a larger scale. Now, on a fourth level, you could think and assume a person, he wants to come and change the identity of this sin and say that no, drinking, that's fine. So, and he wants to create that as part of a lifestyle and a culture, that what we see in these Arab countries, how they have put this wine and alcohol and made it legal and part of a lifestyle and a culture among the Muslims. So the sin over here in the fourth case, that is the greatest of sins when you see. Now what Yazid did was he was changing the identity of Deen. That what wasn't in Deen was being installed as part of Deen. That was haram, was made halal. Halal was, etc. So, so over here, you don't forgive. Over here, that punishment has to be seen.
Thank you, Maulana. Okay, with just 7 minutes remaining until the end of the program, we'll just take one or two questions and then we will go with concluding remarks. For the next question, Sister Fatima is asking if Imams are at a higher status than prophets, other than Prophet Muhammad sallallahu alaihi wasallam. Just wanted some clarification on that.
Yes. The answer is yes.
Okay, thank you. And the last question is, if the Imam is responsible to take revenge for the killing of Imam Hussein and his family, alayhi salam, how is he meant to do that?
Now when we see these terms that we have, we say Tharallah. So the true avenger of the Imam alayhi salam is Allah tabarak wa ta'ala. Or when the Imam returns, we see the slogans that he has. He says, Ala ya ahl al-alam, in ana al-imam al-qa'im. Ala ya ahl al-alam, ana as-samsam al-muntaqim. I am that avenging sword. Ala ya ahl al-alam, inna jaddi al-Husayn qataluhu atshana. So the slogans that Imam gives when he returns, they're all related to Abu Abdullah al-Husayn alayhi salam. So in this great creation of Allah Tabaraka wa Ta'ala, the greatest tragedy that has taken place here is the tragedy of Karbala. And the greatest sacrifice also that has been given is the sacrifice of Abu Abdullah al-Hussein alayhi salam. Now, for such a tragedy and such a sacrifice, now when you want to avenge, or that revenge is to be taken, that revenge also has to be on that same scale, that massive scale, that huge scale. It has to be seen by and witnessed by the entire creation, or the example that was mentioned regarding the observances that we have on the day of Ashura, and the reply of Sheikh Ansari to Afandi, the governor of Iraq from the Ottoman Empire, that the importance has to be given. Some things have to be observed, great, large. Now, so many people who have wept, all of these, we believe in the day of judgment, and we believe that in Allah Sari'ul Hisab, that He is quick in reckoning and taking in account. So all this pain that was afflicted on this massive investment of Allah, sending so many prophets, 124,000, and then all the hard work of the Holy Prophet sallallahu alaihi wasallam, and if all of that was to be wiped by Yazid, and that investment of Allah is there on the other hand, so the revenge also has to be of that same magnitude when it comes to the revenge from Yazid la'natullahi alayh.
Thank you, Malana. So that concludes the Q&A session for the program. Before passing it on for final remarks, just a quick few announcements. So the town hall will take place at 6:45 Eastern Time on this Zoom session. And all the workshops today will be available on the MC YouTube channel. They are currently being recorded. And lastly, MC has an ongoing COVID-19 relief fund. So please go and contribute at muslimcongress.org. And that's it from my end, and I'll pass it over to you, Malana.
Thank you.
And before Maulana makes some final conclusions, I want to add one thing with what Brother Zain have just said, is that we also are distributing funds for the affectees of COVID-19. So if you know anyone, or someone else know anyone who is in the community, please ask them to visit our website.
ربنا تقبل منا إنك أنت السميع العليم. اللهم إنا نرغب إليك في دولة كريمة تعز بها الإسلام وأهله، وتذل بها النفاق وأهله، وتجعلنا فيها من الدعاة إلى طاعتك والقادة إلى سبيلك، وترزقنا بها كرامة الدنيا والآخرة. Once again, I ask Allah Tabarak wa Ta'ala to help us all, forgive us all, and to count us all among the best of the ashab of Imam al-Asr alayhi salatu wassalam, and all those who have passed away, forgive them, elevate their ranks, and those who have requested for du'as, Allah Tabarak wa Ta'ala grant their du'as, and all those who are ill and ailing, especially hit with this turbulence of COVID-19, Allah grant them all shafa. And thank you all for the organizers of this beautiful session, and may Allah accept from every one of us bi qabulin hasan. And once again, congratulations on the auspicious occasion of the birth of Imam Riza alayhi salatu wassalam. Allahumma salli ala Muhammadin wa ala Muhammad, wa salli ala Ali ibn Musa al-Rida al-Murtada, al-Imam al-Taqi al-Naqi, wa hujjatika ala man fawqa al-ardi wa man tahta al-thara, الصديق الشهيد صلاة كثيرة تامة زاكية متواصلة مترادفة متواترة كأفضل ما صليت على أحد من أوليائك. Thank you all.
Thank you, Maulana. And I would request everyone who wants to now be part of our very exclusive current affairs session. And before that, I wanted to all of you to just listen to this message.
5 cars, imagine 200 cars pass every day from that street. If 5 cars a day, or 2 cars a day have an accident in that intersection, what are you going to say? These streets always have an accident. You're not going to look, well, 200 cars passing, only 2 cars have accidents. So how do you say all cars have accidents? This is how my, everyone can have issue. No. Look at all those people who have wonderful relationship. Look at those who have beautiful bond with their spouse. It's a difference. You can find steps, make the right steps, inshallah, professional steps, and rely on Allah subhanahu wa ta'ala.
The next question is, what are background ways of communication that we should actually learn or hold on to that are better than Western ways?
Soundly?
So I have issue with this divisions divided.
Classes per week, Monday through Friday, starting from July 20th until August 13th. Every week has a unique theme, which consists of different educational and fun-based activities for youth to learn more about God, prophets, Quran, and many other interesting topics. They will be participating in quizzes, competitions, and interactive activities to have more engaging and memorable experiences. Classes for 3 different age groups. You can register for the camp from July 1st till July 15th. Remember, we have a responsibility to guide our youth at every step of the way, and we pray that may Allah bless the success in this matter.
अरे भाई आप फिर से वापस ले रहे हैं स्क्रीन शेयर.
So those who wants to attend the current affairs session, you can stay with the Zoom ID 585-342-5863. No password needed. You can just stay here. And those who wants to join a breakout session with Sayyid Ali Tawfiq, getting out of our comfort zone, please join the Zoom ID 656-374-0873.
अरे भाई अगर आप फेसबुक चला रहे हैं ना आपकी आवाज वो बैकग्राउंड में आ रही है. अरे भाई मैं आपका ये वाला जूम ड्रॉप कर रहा हूँ अली भाई के उस पर जा रही है.
Our next town hall is going to start at 6:45.
to learn more about God, prophets, Quran, and many other interesting topics. They will be participating in quizzes, competitions, Muslim Congress presents Camp Wilaya, an online summer youth camp for boys and girls under the guidance of Hausa studied scholars. This is a 1-month program which has 4 days of classes per week, Monday through Friday, starting from July 20th till August 13th. Every week has a unique theme which consists of different educational and fun-based activities for youth to learn more about God, prophets, Quran, and many other interesting topics. They will be participating in quizzes, competitions, and interactive activities to have more engaging and memorable experiences. There are classes for 3 different age groups. You can register for the camp from July 1st till July 15th. Remember, we have a responsibility to guide our youth at every step of the way, and we pray that may Allah bless the success in this path.
While we're waiting, I just wanted to inform all of you, all of our participants, that Muslim Congress is working immensely with the community for the relief of the COVID-19. I just shared with you the website. You can go to www.muslimcongress.org. And if anybody that you know need any assistance, have them fill out this registration form. It takes 2 minutes to register, and we can definitely assist them. At the same time, if you are willing to support this effort, please come back and donate on our website. I request Dr. Muswi to start the session. It looks like that we have all our guest speakers available online. How are you, Larry? How are you, Miriam?
We don't see them, Bhai. Hello, everybody.
Dr. Muswi, you can take charge now.
Okay. Bismillah ar-Rahman ar-Rahim. I want to thank all of you for being here with us at this time. It's a holiday, I know, but it's very kind of you all to be here. We have an amazing panel that we have with us, and who's going to be talking about various subjects as such. And we'll have a Q&A. I just want to do some housekeeping first. And that is basically, I just wanted to say that unlike a physical meeting, I don't have to show you where the restrooms are located, etc. But other than that, there's a Q&A session that is going on in which you all can participate by going into the Zoom side of it and giving and putting in your questionnaire as such. Okay, so with that, I'd having some trouble sharing the screen. We just did another session without any hassle whatsoever, and now with this, do you see my screen?
Yes, you're good.
Okay, okay, excellent. So, so let me start by introducing our esteemed panel. Colonel Lawrence Wilkerson is a retired U.S. Army colonel with 31 years of service. He was the former chief of staff to the U.S. Secretary of State Colin Powell from 2002 and 2005. And if you recall, during that period of time was the famous speech of Secretary Powell to the UN, which Colonel helped prepare. And I will let him speak about that, how he feels about that issue himself. He's a professor of the government for the past 16 years to the College of William and Mary. And he gave the commentary on Why We Fight, which won the Grand Jury Prize for Best Documentary in the 2005 Sundance Film Festival. And for those who do not know Colonel, you are in for a treat. I just want to warn you, you're going to hear some stark truth from this man. Medea Benjamin is known to a lot of people. She's a co-founder of Code Pink and the Global Exchange. New York Newsday called her the most committed and effective fighter for human rights. Anybody who knows her knows that she's all over the place. I do not know how she keeps up with it, but she's in New York one day, she's in Iran one day, she's in Venezuela the other day. So she's all over the place. And you can see her dancing with Teague in Miami one day. So she's all over the place. She was with many other women. She was nominated for the Nobel Peace Prize also, but she has won a lot of prizes as herself. She's the author of 10 books, including Drone Warfare, Saudi Kingdom of the Unjust, and about Iran. That was the last book as such. Manar Mohavish started her career as an independent multimedia journalist, mainly because she didn't think that the mainstream media was going to be the right way of conveying the information. Because what she wanted to do was responsible journalism, which concentrated on civil liberties, social justice. She's the founder and CEO of Mint Press News. If you have followed Mint Press News, it has broken some very important stories, and it has become the global network that it is today, thanks to her. She's the host, producer of Mintcast podcast, and also behind the video series, The Headliners. The Mintcast podcast, if you have not heard that, please download it and become, subscribe to it. It's a very interesting podcast. She was the first woman to wear hijab while anchoring news in American media. And she's faced a lot of backlash over the years. And for her courage, I can only applaud her. So with that in introduction, you can understand that we have a very highly educated and informative panel. And if any screw up is going to occur, that'll be due to the moderator, because it won't be them. Let me start off by asking my first question to the Colonel. International Criminal Court, Chief Prosecutor Fattah Bensouda was investigating the potential war crimes of United States and Taliban in Afghanistan. Secretary Pompeo called it a kangaroo court, called them, the investigators, corrupt without giving any evidence of why he said that. He imposed sanction not only on them, but their families, preventing them completely from coming to the United States, where they had to come interview to do this investigation. US states that we are not a signatory to the ICC, but you just need one country, and Afghanistan is. But remember, US supported the ICC in Darfur and Congo, in Syria. US also says that we can do our own investigations, but can it? If that was the case, remember Abu Ghraib in Iraq? And if CBS News had not come up with those pictures, those graphic pictures, we may not heard the details about what happened over there. I'm briefly going to touch this because they are graphic pictures, and just to show you that for a second, and then move on. If somebody gets convicted, you have a President Trump who can pardon that person. Now look at what Fox News then says. Trump rules in favor of military personnel, not a convicted criminal was pardoned by President Trump. So this is what we face. My question is, how can the United States, how can the United States, despite all the wars it is involved in globally, and with the enormous power that it wields, ever be held accountable for any potential war crimes? All yours, Colonel. You need to unmute. Guys, can you please unmute the Colonel? Small technical difficulties that we start off that way, but hopefully it'll get corrected as we go along. Can we unmute the Colonel's speaker, please? Okay, sir, go ahead, please. Sorry about that.
Let me take you back to Paris about 18 months ago when I happened to be there, looking with the French and the Germans at some way to hold the United States accountable for its acts of torture. And we happened to be briefed by the young investigator, not a prosecutor, but investigator, because they were in the first stage at that time, they being the ICC, on the case against the Taliban, Afghanistan's government, and the United States. And it was a pretty powerful case, even in this particular stage where rules of evidence don't really weigh in. They're just trying to find out if there's a reason to go to the second stage. Well, they did go to the second stage, and now, as I understand it, they're at the stage where they think they have enough of a case to actually pursue it. Why won't they pursue it? And this is a direct answer to your question. The US will never be held responsible so long as it has the power of the gun, as Mao Zedong said. International law comes out of the barrel of a gun. The United States has the biggest gun. This is a despicable position, though, that Mike Pompeo, the Secretary of State, has taken, because instead of trying to finesse it a little bit, instead of trying to be supportive of the court, instead of trying to do the kinds of things that normal diplomats would do in a case like this, he's taken a defiant stance, I assume backed up by the president, and the sanctions we have put on members of the ICC are just unbelievable. I've seen John Bolton do this from the State Department with the articles that we went around the world getting to protect our troops on bilateral basis with each of the countries. This is far more heinous and despicable than that. All I can say is the United States is looking for a way to be the worst reputation national entity on the face of the earth, and it is succeeding.
Thank you very much, Colonel. Medea, can I ask you to unmute you? Go, we got it. Okay. That is for Sudha, by the way. Medea, since we are on this war path itself, let's just stay with the U.S. military. U.S. military budget is $740 billion, which is same as the next combined 10 countries. Saudi Arabia and India come next after that. 15% of the federal spending and almost half the discretionary spending goes to the military. The largest office building in the world, which is 6.5 million square feet, and the biggest employer in the whole world with 3 million people, is the Pentagon itself. Washington Post had said that the money that we're spending over there, if we use it for we could use it for universal health care, health insurance to 30 million, or there is still money left over for in infrastructure, which is crumbling all over the country as we know it. The Iraq war was 2 trillion. The war on terror was 6 trillion. This information is there from Brown University. There's a huge movement now to defund the police. That is not give zero money to the police, but to take a portion of that. That's what defunding really means. So take a portion of that and redirect it to the social programs. Trump threatened to use the military. General Mattis came out with a scathing rebuke of that. 10 generals, including surprisingly General Miley himself, said no to that. Do you think the recent events have created an opportunity to finally reduce the military budget? Should we be asking to defund the military?
Absolutely. There is no doubt that our military budget is way out of control, especially as you compare it to more than 10 other countries combined, the top 10 countries, and compared to the needs we have in this country for all kinds of things. But it has been taboo, unfortunately, to talk about significant decreases in the military budget by officials that want to get elected or keep their seats. And that is because there is such a strong lobby, like General Eisenhower warned us against, the military-industrial congressional complex that includes the weapons manufacturers. It includes other countries that want us to continue.
And this
It includes even unions where
Maria, can you please unmute yourself?
Maria, your thing got muted. There you go. Sorry, we missed the last portion. If you don't mind repeating that.
There's 2 openings right now. One is with coronavirus. There is a lot of questioning among people about what does national security mean. Many folks had been saying the climate crisis is a national security issue and we should be putting money into that. And now they're saying healthcare is a national crisis, and dealing with this pandemic and being ready for any other one to come is an issue of national security, and we should be putting money into that. And so there is a questioning of what is national security and how do we allocate our resources in a logical way. And then there is another opening with the call for defunding the police, something that used to be seen as very much on the margins, but now is being debated on the national scale. And I think this is making people revision what it means to keep their security safe, their communities safe. So this kind of opening does give us a chance to ask the same question on the international level and to say, isn't this a time when we look at our priorities as a nation and also look at how we conceive our relationships with the world, just as we're saying that police armed to the teeth aren't making our communities safer. I think that we can say a military armed to the teeth is not keeping our world safer either. And right now we have Barbara Lee and AOC and some other very brave members of Congress who had put forth a marker, not that we're going to get it very quickly, but saying that we could cut our military by $350 billion, which is over 40%, and still be safe, and I would argue safer in the world. And on a more modest level, there is now amendments put forth by Bernie Sanders and others to say, cut the military by 10%. And while many of us might think that's not enough, it is a starter. We won't get it this year, but maybe we'll get it next year or the following year by building up a movement and doing just what you're saying, piggyback on this discussion about defunding the police and say that it's time to defund the military.
Thank you very much. Colonel, do you want to add anything to that?
I would say there are quite a few plans out there right now that would make anywhere from 10 billion a year to, startlingly enough, 100 billion a year over a 10-year period. That latter would be, of course, $1 trillion in total reductions in the defense budget that in effect would make the military better, more ready, more capable, more focused on the things it should be focused on than hurt it. So we could take $1 trillion over the next decade out of this just polluted defense budget and actually help the armed forces, not hurt them.
Thank you very much. Minar, if I can go to you. Israeli annexation. Netanyahu and Trump are either getting the blame or the credit depending on which side you're on. But let's take a stroll down the memory lane. The 1993 and the 1995 Accord, the Oslo Accord, had divided Palestine into 3 areas in which 80% of the control was given to Israel, 60 plus the 20 of the combined portion. And what did they do with this? Over a period of time, the settlers came in and they kept on increasing. This is 2018. Now there are about 750,000 of them over there as they settle down. And this is what the checkpoints do to the Palestinians who live there. And the checkpoints are all over the place. And this is what a checkpoint looks like. Imagine this at the time of COVID-19 with somebody coughing and sneezing in that group. But that's how they have to go from place A to place B to earn their living. The countries we say that this is wrong is everybody except for one nation, which said not necessarily illegal. But President Trump changed that to a no. He said that that's okay. So the stage was set by Arab leaders like MBS and MBZ moving closer to this country and giving it what it desired the most, legitimacy. West Bank, Palestinian Authority has been accused of corruption, lack of new ideas, and that many Palestinians themselves are disenchanted with that. Gaza, Hamas has easily been branded as Iran-sponsored terrorists. The biggest enabler of this state, this apartheid state, has been the United States itself. Christian right and the Zionist lobbies make the policies which make us do what we do over a period of time. So it set the stage for the deal of the century by the person who is the best expert in the country because he has read 14 books on Palestine. So this is how Trump and Jared Kushner proposed the plan. This was the blue, is that their map. Netanyahu said, okay, Palestine, you're not coming to the table, so I'll take that and more. The green swath of land is Jericho, and it's completely surrounded over there. My question to you is, it seems so unjust. The future appears terribly bleak. Can anything really be done to prevent or oppose is Israeli annexation of the Palestine land? Thank you.
Well, I think that there's been a mass mobilization within the Palestinian territories. Just in the last couple of weeks, we've seen hundreds of thousands of Palestinians raise their fists, raise their flags, and get on the streets and demand that the annexation project end and call it for what it is. It's an expansion of apartheid. It's land theft, and it's Israel's attempt to target more Palestinian agricultural land, water, and resources. Many wars in the Middle East and military adventurism can be defined actually as wars for resources. And if we look at the Jordan Valley annexation project, it's where Palestinians have access to the most fertile agricultural land and water resources, clean water resources. If we look at Gaza, for an example, Israel has completely contaminated all of the Palestinian water supply in Gaza. And so very soon that could be what could happen to Palestinians living in this Jordan Valley region. But I'm seeing some attempts on the US Congress, even those who would appear to be, pro-Israel, including Alexandria Cortez. She's not necessarily pro-Israel, but she's been, pretty neutral on the subject. But she just drafted a letter and received over 190 members of Congress signing this letter, including Bernie Sanders, which basically called on threatening or proposing that Israel not be provided with any military aid if it moves forward with this annexation. The only problem with this is that she stated in the letter, this would create an apartheid reality on the ground. Well, unless you've lived under a rock for the past 60, 70 years, since the state of Israel was created, it basically, the United States and the British, the British, they propped up an apartheid colonial ethnocentric regime on the land of Palestine. And so this is not going to create the groundwork for apartheid. It's only going to expand it and make life for Palestinians much more miserable. And so we have to look at this conflict and this annexation project for what it truly, truly is, which is, modern day colonialism, expansion of apartheid, land theft, and grabbing of resources. And I just did this really fantastic podcast with guest Dr. Ramzi Baroud. He's an academic and he specializes in Palestine and its history. And also with Miko Peled, he's an Israeli peace activist. And Robert Inkelish, he's a reporter and activist who just completed a documentary. He produced a documentary called The Steal of the Century. And all of these individuals had been to this region, the West Bank, Jordan Valley. And in fact, what they can report about this is that this has already been turned into a military zone from a long time ago. And so what this plan is only doing is going to be bringing in more Israeli settlers, over 100,000, which we all know that Trump's son-in-law, Jared Kushner, is going to be profiting off of. It's going to push more, it's going to segment Palestinians even more, making it much more easy for Israel to control Palestinians. And it's going to allow Israel to encircle the entire region of this area, just like it does in Gaza. And it's going to control all of the borders of the people living there. There's no airport that exists in this region. And so Palestinians are not going to have a way out. Imports, exports are going to be completely controlled by Israel. Agriculture is going to be under 100% control by Israel. And so is the water resources. And so just back to your question, I wanted to lay the framework of how this is already apartheid. This is already occupation. It's already a grave humanitarian crisis. And this annexation is only going to take this one step further into a humanitarian crisis that I'm afraid is going to turn the West Bank into the next Gaza, which has been dubbed the largest open air prison and ghetto in the world. And so that's what I fear that's going to happen. And there is one very, very strong element here that if we were to look across the United States, over 28 states right now are trying to make it illegal to boycott Israel. boycott, sanctions, and divestment is the ultimate, the most strong, and the most powerful form of activism, nonviolent activism that anybody can take to dismantle the apartheid regime, to put pressure on Israel. There's a reason why 28 states are trying to make it illegal for American citizens to boycott Israel. And under this legislation, they're targeting student groups on campuses because they have been, the strongest people, these students who are like 19, 20, 21 years old, undergrad students who are putting pressure and organizing these campaigns for universities to divest from Israel. And so Israel sees this as a very, very big threat to them. In fact, Benjamin Netanyahu 2 years ago tweeted out, I don't remember what the exact tweet was, but he also did an interview about this, that BDS is hurting Israel. And that's why Israel is targeting the BDS movement. They're, they're preventing anyone who speaks out in support of BDS from entering the state of Israel. Even members of Code Pink, I believe, were turned back from entering Israel because they were outspoken in supporting the boycott, divestment, and sanctions movement. And so we have to really, really, really take a stance and kind of do some soul searching as citizens, as humans on this earth, and to say the only way to dismantle any war machine is to really support a boycott, divestment, and sanctions movement, just like the South African apartheid regime was dismantled, not because one day, Miko said this in the podcast a couple of days ago. He said, people didn't, the apartheid regime didn't decide to one day end its apartheid regime. Didn't all of a sudden decide, wow, we've been really horrific, we're just gonna end this. It took an international, nonviolent, peaceful movement to support sanctions and boycott against South African apartheid. And that's what it's gonna take for the apartheid regime of Israel to also be dismantled.
Thank you very much. Medea, COVID-19, this is a question that is near and dear to me as a physician and also as an activist, and I hope you can help us with this. US has the largest number of cases and the deaths around the world, and it's climbing. We are breaking records every day. It seems like a genocide because of denial, gross mismanagement, and lack of leadership. There are conspiracy theories that this virus is a hoax. The risks are exaggerated. The mortality is not real. The social measures are not right. The masks are wrong. We should avoid them. The oxygen and all these other issues that come with that. The ever-Trumpers and with the Fox News, talk radio, Rush Limbaughs of the world, and the social media have done a wonderful job in spreading these conspiracy theories. And I get it. I understand that. That is one way for them to counter the mismanagement that has taken place. But what has surprised me is the activists who we have worked with, people who we know, they have suddenly turned on this and have joined in this whole movement and are spreading the conspiracies themselves. They are, I suppose, used, I want to give them the benefit of doubt. I suppose they're used to opposing authority. The part that is confusing over here is who's the authority. The authority over here when it comes to a medical problem is healthcare people, and they never have a problem with the White House or the government. Here they are split. So in a split like this, some of the activists have gone with what the White House has been saying as such over a period of time. So my question to you is, if the resistance was so easily infiltrated this time, it will happen again. What can be done to prevent this phenomenon? Thank you.
Well, Alia, I'm not even sure I agree with this question because I see it very differently. I see that the people who are part of the circles of activism that I work with take coronavirus very seriously. When you go to the protests here in Washington, you see people all wearing masks. It's hard to social distance, but people are trying to do that. There's a lot of precautions that people take. Folks who are older are encouraged not to come out. People who have pre-existing conditions are encouraged not to come out. So I'm not seeing what you're seeing. I'm seeing that the activist community understands how dangerous coronavirus is, are absolutely disgusted with the lack of leadership in this country, understand that these statistics, where in some states the rates of infection and death are actually going up instead of going down, and compare them to other countries around the world. For example, I am part of a new campaign that is trying to lift up an example of a very small country, Cuba, that has not only flattened the curve and is getting to the point of being able to say they have conquered coronavirus domestically, but is sending out dozens of medical missions around the world, from Italy to Angola, to help stop the spread of this pandemic. And our campaign is to lift up their example by calling for them to be nominated for the Nobel Peace Prize. And anybody who's watching this that wants to be part of that can go to the website Cuba Nobel, as in NobelPeacePrize.org. So I'm not sure I'm getting at your question, Ali, but I do see that people who are actively trying to change this country, whether it's to get a decent healthcare system through a Medicare for all kind of system, people who are rising up against the systemic racism in this country, people who are trying to deal with the climate crisis, or those of us in the anti-war movement, we are quite clear that we have to follow the science in this and work towards ending this pandemic here in the United States and around the globe as part of our activism.
That's very nice to hear. But I just wanted to say that just a short while ago, about an hour and a half ago, we had a medical conference, and in which one of the questions that came on Slido was just that, about the fact that why are these doctors going along with the media and trying to scare us, trying to do all this? And we are seeing certain individuals who have worked with us in various events, like activism sort of events, but they are working in a different direction. But you may be absolutely right. The real activists who understand the objective are definitely getting it, and they're staying the path. And the pseudo ones who we thought were with us are really not getting it. So
well, people are certainly confused, and also people do want to get back to a normal life. They want to get out. And so I think a lot of it is psychological, to say that I don't know anybody perhaps that has gotten this. I want to get on with my life. I need to make a living, whatever the reasons are, and perhaps they convince themselves. But I would say that people really in the activist community, no matter the issue that they are focused on, understand this and look around the world and see that the places where they are dealing with the pandemic in a way that is making their community safe have been doing it through things like social distancing and using masks and other precautions.
Excellent, thank you. Colonel, Iran and the war on terror. Iran has been called many times by all the people around us as the number one state sponsor of terror. Al-Qaeda and ISIS, we know, are the mortal enemies of Iran, which is a fact. And we also know that their ideological origin through Wahhabism, etc., is to Saudi Arabia, UAE, and some of these other places over there. But they are our friends. Impeachment, during the impeachment, the midst of the impeachment, Trump needed a wag the dog moment, and he assassinated General Soleimani and the Iraqi general Abu Mahdi al-Mohandes. They brought us to the brink of war, which the Iraqi war would have looked like child's play. Pence, Pompeo, Esper, Fox News all called Soleimani another Osama. There are many people in America who really think that to be true. You had a front row seat to the war on terror, and you have inside information on this. So I wanted to know from you, what role did Iran, and specifically General Soleimani play in Afghanistan against Al-Qaeda and in Iraq against ISIS? Secondly, what type of precedent has the US set after assassinating not just a general of a country, but a member of a sovereign government who, according to the Iraqi prime minister at that time, was on a peace mission? Thank you.
Well, you probably know that at the time I went on American television and I said this was one of the dumbest, most incredibly stupid strategic moves the United States had made since the actual invasion of Iraq in 2003. Since that time, I've had an opportunity to look at it a lot more deeply. One Iraqi friend of mine from Iraq expressed it this way: you took out the man who is doing the best job of defeating the Islamic State, ISIS. That's a pretty stark way of putting it. But I think it was an accurate way of putting it, especially with respect to Iraq and ultimately with respect to Iran, for whom ISIS is also an arch enemy. So it not only was a strategic error in the timing and the way it was done and the precedent it set, which your second question illustrates. This is an incredible precedent for the leading, supposedly humanitarian and legal and otherwise reputational power in the world, the United States of America. Sometimes I wonder how I can say that. Our reputation is in such tatters these days, but you just don't do this sort of thing. You don't set a precedent of killing a member of another state's government in such a public fashion. If you're going to do it, as one of my Israeli friends said, why didn't you do it in secret and shut your mouth about it? This is just another example of how bad this team is, Trump, Pompeo, Esper, the whole group. But it's also an example, as began after 9/11, of how rogue the United States has become as a state in the world. And as one of my Cuban friends said, you're the biggest state and the most powerful state in the world, financially, economically, militarily. So when you go rogue, it really hurts a lot of people. It arguably hurts the entire world. So I simply cannot wait to get rid of Donald Trump, fully knowing that there is an apparatus in this country, the national security state, that is ready to take Joe Biden or whomever might replace Donald Trump by the hand and lead him down the same primrose path, just like it did Barack Obama. So this isn't necessarily one man, but this man has put the ugliest face on it that we've ever had. And we need to get rid of him. And then we need to change this country. We need to get this country back towards the aspirational republic that those of us who thought we were doing positive things have been trying to work it towards for their entire lives, their entire careers. We have left that aspirational public. We are a predatory capitalist state, the preeminent one in the world, and we are a national security state whose raison d'etre, reason for existence, is to make war on the rest of the world. This is not a place we want to be in.
After 9/11, I was just wondering if you felt that Iran should have been included in the axis of evil speech that George Bush gave. It created a great line, but were they helping us or hurting us at that time?
That was a speechwriter's line, just like the line in Ronald Reagan's speech about the evil empire was a speechwriter's line. Tony Dolan wrote that. One of George W. Bush's speechwriters, I thought it was Michael Gerson, but I've been told subsequently it was someone else, wrote that, and the president spoke it. Presidents speak lines often that they don't know what those lines' repercussions are going to be afterwards. It was inaccurate. It was inaccurate because here's one for you. Two of the best helpmates that we had immediately post 9/11. The one for intelligence that was simply irreplaceable in terms of trying to thwart any future attack. The other for the help it gave us in Afghanistan were, in that order, respectively, Syria and Iran. Those two states helped us as much as anyone else. Iran on the ground in Afghanistan and Syria with intelligence. We just don't do things well anymore. We do not have diplomats. We do not have people who use other elements of national power, like diplomacy, like economics, like finance, like information, like intelligence. All we use is the military. And we have had presidents since George H.W. Bush, count them on your hand, Bill Clinton, Barack Obama, George Bush, who were so inexperienced, they didn't have a clue what they were doing while they were president, and people ran circles all around them and created what I just described, this predatory capitalist state on the one hand and the national security state on the other. And look what we have now. We have massive corporations that are so wealthy they're obscene, like ExxonMobil and Lockheed Martin, that occupy positions in both of those states. Lockheed Martin is the preeminent corporate predatory capitalist selling arms to the world, and ExxonMobil is the preeminent corporate predatory capitalist selling fossil fuel to the 42nd country in the world in terms of fossil fuel use. Yes, DOD. It's right there beside Portugal in terms of fossil fuel use. These special interests are making the decisions in America today. Not the American people, not the Congress, not the White House even. These special interests are making the decisions.
Okay. You guys still see my screen share? I thought I dropped it. Okay. Yemen, Manar. The Saudi appointed President Mansour Hadi was never really legitimate. Whoever knows the history of what happened at that time, he was elected for a few years and he kept on going. And he's just a puppet who has been installed over there. The north and Sana'a is controlled by Ansarullah, the Houthis. The south, Aden, Saudi Arabia, UAE, US, UK coalition. But despite years of intense bombing, the balance of power has shifted to the Houthis, right? The Sunnis in the north who are cooperating with the Saudis have joined hands with the Zaydis and the Houthis. The UAE and the STC who fought with the Saudis then fought against the Saudis and have taken over Aden. So under normal conditions, under normal definitions, this battle should have been won by the Houthis or be defined as being won by the Houthis. But MBS's ego can keep this bombing going on forever, despite their waning petrodollars. Will the poor Yemeni people ever have peace? And if so, what will it look like? Will it be a divided Yemen? Please.
Well, I hope that Yemen doesn't get divided, because that's a colonial dream, is to fragment countries so that they can have better control over them. That's what we saw in the colonial area in Africa, and that's what happened under Western, Israeli, and Saudi, weapons and arms and humanitarian crisis that we saw in Sudan, when Sudan got split up into two countries because the West was after its oil and resources and its strategic area in Africa. And so I hope that Yemen does not get split up, but it looks like it may move in that direction, considering that the north is occupied by this what's being dubbed as the world's worst humanitarian crisis, where 23 million people are facing famine right now and could die at any given moment. The death toll in Yemen has reached over 100,000, if not more. Cholera, dengue fever, and other diseases that, we haven't even seen in over 100 years have now made a comeback, and it's all man-made. And now temperatures in Yemen during the summer rise to 129 degrees, and Saudi Arabia is blocking fuel from entering the country. We just did a report at Mint Press that there was about 500,000 gallons of fuel sitting at the coast of Yemen that have been stuck there for months, and Saudi Arabia is blocking them from entering Yemen. And so this is preventing people from turning on their air conditioning for those who have access to this technology, and from agriculture and from factories and companies from even just surviving in Yemen and flourishing. And so this is the world's worst humanitarian crisis, and we have that happening on the north, and then on the south. At the south, the United States is playing, this war on terror. They're propping up military sites and torture sites where they're committing grave, humanitarian or human rights violations, excuse me, at these torture sites in southern Yemen, occupying southern Yemen, by the way, with the United Arab Emirates. And so it's a multifaceted conflict that we're seeing. And so really the only route for peace is for the United States, for Saudi Arabia, and for all of these Arab Gulf countries and the United States, and even all that make up the US Saudi-led coalition, which includes the United Arab Emirates and Egypt and others, and Israel assisting Saudi Arabia with its intelligence on the ground, and the United States also assisting Saudi Arabia with its, fueling its jets in the air right before it bombs civilians. We need to get all of these military powers out of Yemen, so that, what a crazy idea that Yemen can decide its own fate. Let the Yemeni people decide who can rule over them and have them hold democratically held elections without any influence coming from outside forces. And so just like I just discussed with the Israel issue, just like with the Saudi Arabia issue, we have one common denominator, which is these massive arms sales in the military industrial complex being fueled by these humanitarian crises. Just like Colonel Wilkerson just described, we have these weapons manufacturers funding all of these think tanks who are basically writing out policy and influencing media narratives to justify these wars, whether it's in Palestine or in Yemen. And so we have to end the arms sales to both Saudi Arabia and Israel, but then also we have to think about what we are doing right here in the United States. We are basically the enabler. Saudi Arabia is basically a proxy state of the United States. Israel is a proxy state of the United States. Like, both issues are so similar because they're both, whether it's Palestine and Gaza or the West Bank and this annexation deal, or what's happening in Yemen. And by the way, I believe Yemen is probably in a far worse situation because there's a media blackout happening with Yemen. Not as many people know what's happening with Yemen. With Palestinian resistance and mobilization and activism is like hip and cool now, right? Like, people are waving the Palestinian flag on college campuses like it's like a normal thing. Whereas Yemen, people are not talking about the 23 million people who are facing starvation. And for those who are talking about it, it's like we're shouting out at a wall, it's like that number has numbed everybody. Like, people cannot even fathom 23 million people that are about to starve or who are starving and that could die at any moment. And so we really have to look at, sanctions and boycotts and the end to these arms sales. And then not to mention Saudi Arabia is sitting in a key human rights position at the United Nations, where it's controlling what kind of humanitarian aid enters Yemen, where it controls what the UN can and cannot say about what's happening in Yemen. And so, like, the people that are creating all of this havoc and this chaos around the world, just like Larry Wilkerson described, are the ones who are ruling over us. And so we have to flip it all around. And I think Yemenis also have to look at this divide and conquer that's being placed over them by the people on the ground who are dividing them versus, Yazidi, Shia, Sunni, whatever it may be. We actually, in the beginning of the conflict, we actually covered how Saudi Arabia was dropping leaflets, little pamphlets on Yemenis. And these pamphlets were literally just propaganda against Zaydis and Shia people. And it was to prop up these, Sunni militant men into fighting jihad. And so we have to look at this from all different facets. And I wish and I hope that the Yemeni people and all people that are living under the thumb of militarism and occupation and Western colonialism will really look within themselves and realize that they are being used as a pawn in this greater military industrial complex for profits for these weapons manufacturers. And they will find the power within themselves to say that, hey, we have the power, we have the strength, we have the courage to stand up and rise, because really at the end of the day, it's only the Palestinians that can set themselves free. Of course, we need help, from the world, but it's really up to the Yemenis too to stand up against the sectarianism, the militarism, and just unite on all fronts to resist this military occupation.
Larry, do you want to add anything to that?
All I would say is she's absolutely correct. This is a tragedy. We just did a tabletop exercise at the U.S. Institute of Peace, looking at the Red Sea and looking at Djibouti, Eritrea, Ethiopia, Sudan, and looking on the other side at Yemen. And one of the most dangerous waterways in the world for people actually dying every day by the dozens is crossing that sea out of the war in Yemen or going looking for jobs out of no job areas in Eritrea, Ethiopia, Sudan, and so forth. And sitting in the middle of it now is Djibouti with the Chinese, the Japanese, the French, the US, the Italians, the Turks, everybody there. It's a cockpit of danger and a cockpit of interest, significant interest right now. More important than the Strait of Hormuz, more important than the Persian Gulf. And Yemen sits there being contested because of that importance. This is crazy. This is insane, as Manar has just pointed out. We're destroying these people, and we're destroying them for a Saudi pipeline to the south, and we're destroying them for their strategic position and so forth. The same reasons we've always tried to destroy Yemen since World War II anyway. And it needs to stop. It needs to stop. People need to sit down, take notice of what's happening, and stop these things. We had legislation in the House and the Senate. It passed. It passed under the War Powers Resolution. It demanded the president get the United States out of supporting Saudi Arabia in Yemen. And if we were out, they would have to get out. It didn't pass. Trump vetoed it. It passed. Trump vetoed it. And there were not enough votes to override that veto. This is insane. The Congress voted to stop this war, stop the U.S. participation in it, and Trump vetoed it. Insane.
And can I just add one more thing to the Wars Power Act? I think it was very good that Bernie Sanders, and again, I'm like that cynical person who thinks like we are not going far enough. It addressed the war in Yemen, but I really wish it would address the southern occupation of Yemen as well. And that's a really, really key part, because I feel like that's like the hidden war. That's the hidden part of the war that there's not a lot of coverage are. Luckily we've been covering it because, Mint Press has been trying to break this like media blackout on what's happening in Yemen. We have a correspondent there. We have a producer there who are Yemeni, people there trying to amplify what's happening there. But I hope that it's a multifaceted conflict that all aspects need to be addressed.
Medea, Colonel spoke about all the legislation that is going on. I know you have worked very hard in this regard. Do you want to add something on this issue?
Well, in addition to legislation, we talked about things that people can do on a more grassroots basis. And when Menard talked about Palestine and Israel, you brought up the boycott, divestment, and sanctions. We have a relatively new campaign, a number of different organizations that are finding ways to boycott Saudi Arabia. And when you look at where all those petrodollars have gone, so many of them are right here in this country. Think tanks in DC, universities, Ivy League schools in this country, businesses. I remember when I first discovered that Uber had a couple of $1 billion of Saudi money, I thought, oh gosh, I'm gonna start using Lyft. And then I realized that Lyft had billions of dollars of Saudi money in it as well. So we have to look at these different ways that the Saudis are have invested in our own economic system and use our power to try to expose that. Getting universities to reject Saudi money, getting think tanks to say they won't take it anymore, getting the dozens of PR firms that are taking Saudi money to be embarrassed and stop renewing those contracts. And then there's the fact that the Saudis are hosting the G20 meeting this year. This, for anybody watching this that doesn't know, the G20 is the yearly gathering when the most wealthy countries around the world come together to talk about problems that are affecting people all over the globe. It is just disgusting that Saudi Arabia is allowed to be the host, but it gives us an opportunity, because in addition to government representatives going to the meeting, whether it happens virtually or in person this year, we don't know, but they also have invited academics, they invite women's groups, they invite business leaders. And so there is a very robust campaign now to try to get people to refuse to go and participate in this G20 as long as the Saudis are the host. So you can go to codepink.org and look at some of the ways you can participate in this campaign to boycott Saudi Arabia.
Thank you very much. So this ends this portion of the of our conference in which I was asking the questions. The rest of it is going to be the audience who have asked questions in the last couple of days on Slido. And those who have Slido can check this out also. And I'm going through it. And if any of you prefer to ask a specific question that you like, I'll be glad to do that. There was one from Gary G to Colonel. With trillions of dollars in profit involved, can we imagine the military-industrial complex will ever allow United States to not enter or start new wars?
That's a question that my fellow military veterans who are concerned about this, as I am, ask ourselves every day. As a matter of fact, we had a conference this morning on that very subject. We looked at the NDAA as it currently exists, and you would not imagine the pork we identified in that NDAA. If John McCain were still alive, he'd die. There is so much pork, so much unnecessary material, if you will, in that National Defense Authorization Act. And look who presided over it. Adam Smith, the Democrat, Jim Inhofe, the Republican. And it is full of things that even the military doesn't want or need. This is how they operate. The only way we're ever going to take this on, we agreed this today. We call it patriotic dissent amongst us veterans. The only way we're going to stop this is to mount a full-fledged campaign to identify to the American people what the cost, the opportunity cost of this largesse to DOD are. And it's not just the fact that the money's not being spent on things that should be spent on, like infrastructure, like healthcare, like education, and so forth. It's also the fact that it's creating this instrument in the world that wants to make war with everybody. 800 bases across the face of the globe. The rest of the world combined, including China, Russia, and India, have less than 75. We have 800 at a cost of about $75 billion a year just to maintain the bases. The American people need to get mad. They need to get angry. They need to ask their representatives in the Congress where this money's going and why. And if they don't get satisfactory answers, they need to throw them out and get new people. And they need to keep doing that until we get some change.
Thank you. Manar, what was it like covering the protests in Minneapolis? And while we're at that, do you think that the Black Lives Matter has opened up an opportunity for people who are pro-BDS to join up with that and many other movements of that kind? Oh. You good?
I'm sorry, can you ask that one more time?
Sure. I'm sorry about that. The question here was, what was it like covering the protest in Minneapolis? We know that you were reporting on Minneapolis Press and on social media in great detail about what was happening. You were going on the ground and reporting for there. And how was that? And my question, in addition to that, was: does this give us an opportunity for joining and coalescing of various movements in which there is oppression that is going on, like, BDS?
Well, it was pretty incredible being on the ground. I'm used to being an editor, working in the backgrounds. I haven't really been reporting on the ground for a while. But when George Floyd was basically suffocated and killed by the Minneapolis PD police officer, Derek Chauvin, it happened right here in our neighborhood in Minneapolis. And so, just like a 10-minute drive for me. So I had to go on the ground and see for myself what was happening. And it was incredible to see the community, the Minneapolis community coming together for such a cause, for Black Lives Matter, for against police brutality and income inequality. And the reason I say income inequality is because for the past 3 months that for 3 months prior to George Floyd being killed, we were all quarantined. And so during this time, there were some very massive pent up frustrations and angers to the entire system. So including, unemployment issues, economic issues. People were extremely, extremely frustrated, especially in this, South Minneapolis district where George Floyd was killed, and he was obviously killed over a $20 bill. So it was very significant. This killing triggered a mass movement. And just going down there and interviewing people and hearing their grievances, it was really a big eye opener that, this is not just about police brutality. This is about an entire system of oppression. And again, it goes all the way back to everything that we're discussing here today, which is the military industrial complex, the militarism, the 1%, this entire system that we have in place, the structural racism, injustices that are happening in this country, the exploitation of we the people, the infringements on our civil liberties, and the extraction of our wealth under the guise of COVID-19, where billionaires like Jeff Bezos and Bill Gates and Warren Buffett and so many, Michael Bloomberg, their profits have like soared, times a million, not a million literally, but so much during the pandemic. And it was, this doesn't go back to your conversation about the pandemic. The pandemic is real, but it was also used by the 1% to extract as much wealth and accumulate so much wealth while everybody was afraid and scared. And so we saw this very mass movement against this entire system that really finds its roots back into militarism, where we have a media who works very hard to distract us, to create fear, and to dehumanize people of color, whether it's here at home or brown people abroad, whoever it may be. And so just seeing all of these people come together was very incredible. It was very inspiring. And something that was really interesting too was that the community, despite all these economic hardships, was coming together to feed each other, to help each other pay for things. Moms were out there getting free diapers and wipes for their kids, single moms. And, the pantries were all open for people to get food because the city of Minneapolis has failed us. The state of Minnesota has failed these people, these communities. And so has the entire country. And if you look at like what's happening in DC, for example, DC is like the capital of empire, right? Yet it is the heart of gentrification in this country. It's the heart of income inequality in this country, where and so all of these movements that we're seeing, these mass protests, were just the killing of George Floyd was just a trigger for this bigger movement to just express these frustrations over this overall system of oppression and systematic racism and injustice. I don't know if that answered your question, but I feel like I kind of went on a tangent about like everything that I saw and witnessed.
We wanted to know your experience, and you did tell us that. That's the most important thing. We don't see the way you saw it, so we wanted to know that.
Ali, can I add? Please. Because I'm sure Manar, you know this well, because part of the question was, is this an opening to connect struggles? And
yes, okay, yeah.
Struggles around Palestine, from the time of Ferguson when Michael Brown was killed, the Palestinians were on Twitter saying, here's how you deal with tear gas, and send their solidarity. And so many of the Black Lives activists, the key leaders, have actually been to Palestine and make those connections directly. And in fact, when you look at the platform of the Movement for Black Lives, they got in trouble with a lot of their more liberal friends because there's a whole section there about Palestine where they called what was happening a genocide. And so those connections are very much there. And I think a lot of the leaders of the Black Lives movement recognize not only Palestine, but struggles around the world, that their liberation is tied to these other struggles.
Absolutely. It all goes back to militarism and these entities that rule over us to profit and exploit. And Palestine was mentioned a lot during the protests. I saw people compare Israeli police training of the Minneapolis police forces. I believe it was in 2012. I don't know if Derek Chauvin was at this conference, but there was about 100 Minneapolis police officers that attended this conference in Israel, where they learned the brutality that they're using today, and racial profiling and technology, surveillance technology for police. These are all rooted, again, from, not that they wouldn't exist anyways, since these are part of our oppressive system here and unjust system here in the United States, since police brutality has existed for so many years, especially during the Jim Crow era. But a lot of these new advances and these new techniques where, officers are kneeling on the necks of, people that they're trying to arrest. How many images have we seen of Palestinians on the ground with Israeli soldiers kneeling on their neck and Israeli police kneeling on the neck of not even just adults, but children, hundreds of children. And so a lot of these tactics are absolutely being identified as coming back from the apartheid state of Israel, which is the ultimate police state, with checkpoints and racial profiling and apartheid policies.
And a great campaign called Deadly Exchange to try to stop local police departments from being trained by Israelis. And so anybody interested in that can look up Deadly Exchange. And I know Larry is involved as well on the campaign to stop the 1033 program, which is to stop Pentagon, quote, surplus from going to these police departments.
That's great, because MS had asked that question and both of you have really answered that. That was going to be something I was going to ask. But while staying on the same topic, this is a quick question for Larry. Sean asked, kneeling while the national anthem is played, is that an insult to the troops or to the flag?
We had a big discussion about that the last 72 hours or so too amongst my veterans group. And the consensus is that patriotic dissent is an absolute requirement right now if we are to move this country back on a track to the aspirational republic that our founders created. However marred and imperfect that creation was, we feel like the aspirational republic, and what do I mean by that? Look at the Bill of Rights and you know what I mean by that, is more important than anything else right now. And so anything that is patriotic dissent is okay. And if I were there, I'd do the same thing.
Wow, that's a pretty impressive answer. Medea, Anonymous asks, what was it like during the Venezuela embassy situation? But before you answer the question, do you mind giving us a little background on what is going on in Venezuela? People do not know too much about it. Why are Pompeo and Trump so much after Maduro and all that?
Good luck.
Yeah, right. Well, to try to sum it up quickly, the United States doesn't like when other countries try to forge their own path. And especially in Latin America, where even under the Trump administration, they openly talk about the Monroe Doctrine, which was a doctrine saying that the Latin America was the US backyard. And so since the time that Chavez came to power in 2002, the United States has tried to have regime change in Venezuela and have imposed these extremely dramatic, brutal sanctions that are leading to the death of many, many people in Venezuela. And so when the United States, as part of this regime change campaign, took a very unknown person who was the head of the National Assembly in Venezuela and worked with him to declare himself president, and then has gone to say that this parallel institution, which is totally fictitious, this guy Juan Guaido doesn't hold any power inside Venezuela at all, but they wanted to give him the embassy in Washington, D.C. And we said, this has nothing to do with whether you like the Venezuelan government or not. That's not the issue. The issue is one of international law, that the Venezuelan real government is the one represented at the United States. It's Nicolas Maduro, and you can't just give an embassy to a fictitious president. So a number of us were actually living inside the embassy for over a month until the police came and kicked us out, arrested people, and there was a long trial. But the point of all of this is to say that it was a great example of citizens standing up against US intervention in Venezuela or elsewhere around the world and say, we want to be a nation that abides by the rule of law, that respects the sovereignty of other nations. And even though in the end, we lost it and the embassy is now in the hands of this fake President Juan Guaido, who doesn't do anything, but in fact it's closed because he can't run an embassy or provide visas or passports because he has no power in Venezuela. But it was a great example, and it was seen, while it wasn't covered very much in the United States, it was seen by people around the world. We're very happy to see Americans standing up for this idea of non-interventionism.
While you're on that, could you also comment on how the Iranian ships with the oil were sent to Venezuela and how they are being turned around, and now Pompeo is threatening to take over?
Well, with all the US threats and threats directly coming from Donald Trump himself, the tankers that were coming from Iran to Venezuela actually made their way there. And with the US imposing these sanctions on countries like Iran and Venezuela and Cuba and North Korea and more, Syria, there is a growing sense that the United States has gone way beyond the pale, and that there must be a new movement to try to get off the dollar. Because the US sanctions are not only saying US companies can't deal with these countries, but trying to say that companies in the rest of the world can't as well. And so I think in the end, this is part of the decline of the empire because the overreach is so great that many countries, including China, which of course is a major country, not a small one, are now starting to say that we need to find alternatives to the dollar for international finance.
Thank you. Manar, Khan Hussain asks, Kashmir has been the Palestine of India since 1947. Ongoing persecution of Kashmiris by the Indian military. A few months ago, the fascist BJP regime revoked the Article 370. He's made a statement, but I'll convert that into a question. How would you compare that to the Palestinian movement? And despite the fact that we say what is going on in Palestine is not, there is a lot of injustice being done over there, the bigger injustice is really not even covering Kashmir, not even talking about Kashmir. The media doesn't talk about Kashmir. There is not much activism that is going on about Kashmir. So there's a lot of similarities between Palestine and Kashmir. It's the same exact thing that is going on over there, and actually worse, because you don't even find out about it.
Right. And I think that just like Yemen too, Kashmir doesn't get a lot of media attention, but it's absolutely a very similar issue to what's happening in Palestine. Kashmir, and I think it's called Jammu, I believe the other province, but it's an area in India that's home to about 12 million people, and it's basically militarily cut off from the rest of India. And it's the people there are living under full military rule in what has been described as an apartheid regime. And now that Modi is in charge, he's a total fascist. He's been described as, Netanyahu the second, right? And so under his rule, the apartheid policies that are taking place in Kashmir have only accelerated. And I think the biggest tragedy here with Kashmir, just like in these other conflicts that we don't hear of, is that there's a major media blackout. And so there's not even as much attention being brought there, but it's for the mere fact this oppression is taking place for the mere fact that these people are Muslim. And so with this nationalist Hindu movement rising and increasing in power in India, they're using Muslims, the demonization of Muslims and the caricature of Muslims being terrorists and militant, just like, how the media does here and how the Israeli media paints a caricature of Palestinians and other Muslims. That's how the Modi government has been able to increase its persecution of people in Kashmir.
Larry, do you see systemic racism in the military?
Of course. There's always been racism in the military. There's always been racism in the United States, as we're seeing once again. There's racism. I got a lot of criticism for this. I stick by it. There's racism in the Republican Party that is just rampant. There's been racism in the Republican Party ever since Dick Nixon executed his Southern strategy and brought all those disgruntled Solid South Democrats like Strom Thurmond from my state of South Carolina into the Republican Party. Racism is part and parcel of the world's existence, and it is part and parcel of America's existence, and has a special history here, as I hope most people know, though of late I've found Americans to be so damnably ignorant that I wonder sometimes. Racism exists in the U.S. Armed Forces.
Thank you. Medea, if I could ask you to unmute. Mustafa M. asks, have we all forgotten Kashmiris, Uyghurs, Rohingyas? What will make the activists care for them more? I know you are very busy. You have your fingers in so many different places and you're overwhelmed with a lot of different things. But these are people who are really oppressed. What can you suggest can be done for these people from activism point of view as such?
It's tough when we have so many different issues. We've talked about some of them tonight, and there's so many more to talk about. I focus on the issues where my government has the greatest responsibility in terms of making things difficult for people around the world. And the three areas that you talk about, the US is always involved in one way or another, but it's not the central character in those. But in any case, I do try to keep up with these issues. Thank you, Mint Press, for giving us information on these issues. And I think that we have to recognize that Muslims around the world are targeted. And we have here at home the additional problem of Islamophobia that has been used by this Trump administration with things like the Muslim ban that bans people from entire countries because they are, many of them, Muslim countries and not particularly allies of the United States, although it changes. But my point is to say that I think that we have to be particularly sensitive towards oppression of Muslim people around the world, like the Rohingya and like in Kashmir and the Uyghur, because the United States has invaded and occupied Muslim countries, and because there is such a great and growing Islamophobia here in the United States.
Thank you. Manar, Gary G says, President Trump knows that he's losing bad and is causing voter suppression and saying this will be a rigged election. How do we proactively prepare for November?
Well, I think every election in America has been rigged by the corporate mainstream media. We haven't had fair elections in this country for a very, very long time, especially considering third-party candidates are not even invited to the final debate stage. And so we are constantly left with two candidates, one from the Republican Party, one from the Democratic Party, both who are influenced and controlled by lobbyists, by weapons manufacturers, by the pharmaceutical industry, you name it. And so, Trump's statement couldn't be more true. I agree with Trump. The elections are going to be rigged, but they've always been rigged. And considering what's happening right now with COVID, we just had some, local elections taking place in the last couple of months, and they continued, yet people were quarantined. And so I don't even know if those elections should really even count. I mean, most people were in their homes. They weren't even able to vote. And so I think a solution to all of this is we actually have to dismantle the current US election system. It doesn't work. There's too much money in politics. And not to mention the corporate media is also involved in only amplifying the voice of certain candidates that toe their political line. And so we have to look at creating more parties in the United States, not even just a Green Party and a Libertarian Party as alternative parties, but we need to have many, many more. This is a democracy. If we were truly to be living in a democracy, of course, we're not in a democracy anymore. We have been now labeled as an oligarchy ruled by a 1%. But if we were truly to call ourselves a democracy, then we would need to have many, many multifaceted parties that represent the very diverse communities and political ideologies in this country. But that's not happening because there's so much money and influence in our political system right now. And let me say something about Trump. There is something that I do agree with Trump, is that the corporate media is very anti-Trump right now. It's very Democratic Party aligned. And while I absolutely do not like Trump, and I think that he's a very horrible person, the media is also engaging in something that is really interesting, which is anything wrong in this country, it just goes, after Trump. Everything is anti-Trump. And so we've kind of created this political ideology in this country where people are being pulled all the way to the right and people are being pulled all the way to the left on these opposite political aisles. And so it's creating a system where we don't have even our corporate media is not truly representing the current political atmosphere in this country. So absolutely, the elections are rigged.
Well, Medea, if I can expand on the same concept, I understand what Manar is talking about, being an election being rigged, but I'm talking about the physical rigging, which I do not think is going to take place in the sense that right now, if you look at the polls, even in all the states which need to be won by Trump to win this election, including Florida, he is losing by 5 to 8 points, right? So the chances of him, if things remain the same, the chances of him winning this election are small. So, but we know that his supporters may take it to the streets. They'll come out with their guns. They come out, and he may not leave easy, or he may. We don't know that. But the question I think the person wanted to also address is, how do we prepare ourselves for that kind of situation when the election is going to be made as if it was so rigged that I never lost, it was a lie. And if he does lose and Biden becomes the president, he will not be the true president.
In the lead up to the election, I think we have to do a lot of work around the issue of voter suppression, the attempts to limit the vote by mail. We're still going to be in the midst of coronavirus, so we need to be able around the country to vote by mail. The kind of preparation, if Trump doesn't leave office or if there's a contested election, is going to be tough depending on coronavirus as well, because I would normally say we have to be ready to take to the streets in a nonviolent way ourselves. We have to be ready to do Occupy movement in a different way, but in cities throughout the country to demand respect for the will of the voters. If we are still in the midst and potentially even greater of a pandemic during the wintertime, that's going to be difficult to do. So we're in a tough spot right now, but I think just the fact that people are talking about and having these kind of calls, and I've been on a number of them with people saying, oh, how can we be prepared? That people are recognizing that it might be an issue of having to come out onto the streets and to not listen to the Democratic Party. This is not about Joe Biden and the Democratic Party. This is about our rights as Americans and as voters. And if we think that Trump is still in the election, I don't know about you, but I'm not going to wait for the Democratic Party to tell me what to do. I will be out in the streets, and because I live in Washington, D.C., I'll be in front of the White House, not one day, not 2 days, but constantly, and not let it go to the Supreme Court like it did the last time, but have it be the people's response.
Okay. If I can stay with you, MS asked a question. Biden opposes BDS, but has said that the annexation is wrong. With the progressive wing becoming stronger, can his views change? Do you think that the progressive movement and all the activists together can push him a little bit to the left on these type of issues?
Well, my organization, Code Pink, just organized a letter to Biden on this very issue that we got over 100 organizations representing millions and millions of people. And we laid out what is a just and fair policy towards Israel and the Palestinian struggle. And we sent the letter then to Biden's people, and we got a response back right away. And we're having meetings by Zoom call starting next week. I think that we can't be too cynical and say we're never going to move him. We'll never move him unless we try to move him. And I think just as on other issues, we are unhappy with his positions on not supporting Medicare for all, not going with the call for revisioning policing in this country. And at a time when we're talking about defunding the police, he's talking about putting hundreds of millions of dollars more into policing. But we have to push him on these issues. And I think if we push hard enough, he is movable, yes.
Larry, I think
to the extent that we want.
Yes. Larry, if I can combine a couple of the questions that have been asked. One question is, can the system change? Can the change of the system happen from within? The question is that are there enough Larry Wilkersons in the system as such to change it from within? And also, is the US policy controlled by a few? What are the biggest lobbies which are controlling the US policies?
Well, that last one's pretty easy. Things like the Foundation for Defense of Democracy, the AIPAC, the NRA, you name it. The moneyed lobbyists are the ones who have the congressman more or less in their back pockets. People ask me why I say that about Jim Inhofe, for example, from Oklahoma. Just look online at how much money he gets from the fossil fuel industry. And you know why Jim Inhofe brings snowballs into the Senate of the United States and contests the existence of climate change. It's, we've spent billions of dollars in this country on advertising on that stupid instrument called the television. 500 channels, 499 of them are moronic, the other one's inane. We spend billions on advertising, and we say that money in a congressman's pocket doesn't influence him. Give me a break. Please give me a break. It's the same thing as advertising. We have a problem, a significant problem with politics in this country right now. And I don't necessarily disagree with some of the other people's characterizations of it, but politics is the art of the possible, one step at a time. And the first step right now is to keep Donald Trump from deploying the United States military to polling places across the country in November and threatening people who are trying to vote. That's one potential crisis. Ulysses Grant did it in 1876. He did it to help blacks vote and to keep the KKK off their backs. And we might say that that was a good use of the military, but it was unconstitutional. That could happen again, and it can happen in a very dangerous way. Other crises I could describe to you that we've been looking at in the task force that I belong to also. So first thing is we got to have something like an election in November that a great majority of the American people get to participate in. And we hope that the results of that are that Trump goes. That's the first step. We have to take that step. I don't agree with Medea that we can go to the street with our M16s and expect to win. We aren't going to win.
I never said M16s.
Whatever you're going to take. You need to take something powerful.
Non-violent.
Because there are 300 million firearms in this country, and 90% of them are in the hands of Trump's base. You need to take something more powerful than your mouth.
People.
Okay? This is a dangerous situation. We need to get beyond this situation. Coronavirus makes it even worse. We've seen it in Georgia. We've seen it in Minnesota. We've seen it in Michigan. We've seen it all across the country in primary elections. We have got to get through this period. If we don't, forget it. We're not going anywhere else except to a fascist state. We need to get through this.
I'll ask one last question to Manar, and after that, I'll throw the floor to each one of you. If we have not covered anything, if you want to say something, please feel free to say that. Manar, somebody asked, MH asked, what inspired you to go into the media? But at the same time, I want to ask you, how would you inspire the others who are listening over here, the young girls and boys? How do they get into the media? Obviously, getting into the mainstream media is not easy, but so you have provided an alternative medium for them to express themselves. So please talk about that.
So should I answer the first part?
Yes,
or okay, so although I was born and raised here in Minnesota, my family is Palestinian American, and they moved us back to Palestine when I was in the 5th grade. And there I went from living in the, the pristine, beautiful suburbs of Minneapolis to living under a brutal occupying police state. And it was for the first time that I witnessed human rights abuses that we here in America could never begin to imagine. Our water was cut off. I'd go to school with, many times with half of the children not being present because they were prevented from crossing through checkpoints. And, military helicopters were constantly flying overhead. I would witness bulldozers bulldozing Palestinian homes for not having the proper permit, even though those homes would be, standing up to over 100 years in those areas. So I witnessed a lot of human rights abuses. And when my parents had decided that enough was enough, and I'll try to make the story very short because it's a very long story, they had decided to move us back to Minneapolis because we had been Americanized. We weren't ready for this kind of lifestyle. Even though we loved Palestine, we wanted to live there. We moved back to the United States in 2001, just a couple of months before 9/11. And I could not get Palestine off my mind. I had suffered from PTSD because I had witnessed, again, so many human rights violations. I had witnessed Israeli soldiers shooting at police, or Israeli soldiers shooting at small Palestinian children trying to cross through checkpoints, but they couldn't. They would throw rocks. Anyways, and so I would turn to the media when I was 12 years old and almost turning 13 to, keep up to date with what was happening back home in Palestine. And the media was dehumanizing and demonizing Palestinians. Women were oppressed. They were being controlled by these dark brown, aggressive, men. Whenever they'd show women, the women were covered. Whenever they'd show men, they'd, be bearing arms, and they're indoctrinating their children. It was like this total Islamophobia. But I just found it amazing that the media had flipped the narrative on Palestine and Israel. What I had witnessed was apartheid, colonialism, militarism. But what the media was presenting was the opposite, that Palestinians were the oppressors, and Israel, poor Israel, is the only trying to be a democracy in this Middle East, was being oppressed by the Palestinian people. And so that was my first experience witnessing media propaganda. And I had, was almost 13 years old. And so I was mature enough to kind of see how the media was working. And while I couldn't get Palestine off my mind, the kids in my class were so just not in touch with reality and how the rest of the world worked. They were, partying, drugs, drinking, you name it. And, interested in brand names. And so I just felt like an outsider. I felt like an other for a long time. And then a couple of months later, 9/11 happened. And then again, I was sitting in my classroom and I witnessed CNN. I think it was like a couple days after 9/11 happened, and CNN had played this video of Palestinians celebrating Eid after Ramadan, handing out candy, but there was no noise to this video and no sound. And they were saying that these Palestinians were celebrating 9/11. And I was like, there's no way Palestinians were celebrating, 9/11. And a couple of days later, CNN was forced to retract, and they posted a very, very small retraction because activists and people who were following the media had contacted them and said that this video was of Palestinians celebrating Eid. So it was just another example of the media using propaganda to dehumanize Palestinians. And then I sat there again in my classroom for several months watching the media beating the drums of war, and again showing images of women in Afghanistan being controlled by the Taliban, and the men again being aggressive and controlling, and women not having access to education. And I just like, all of these dots were being connected in my mind, that these narratives were being used to promote this militarism and this war, these wars overseas. And so from right there and then, as a 13-year-old, I had decided that I will be the voice for not only Palestinians, but for all people who have suffered under military rule and who have lived under these grave humanitarian, human rights abuses. And I literally, from the age of 13, I continued to pursue and study journalism and keep present, with what was happening around the world. I became a news and political junkie, I guess you could call it. And I went on to pursue journalism. And and part of this journey too was also learning about my own faith, because on this journey, the media was bombarding me, even as a Muslim American, with so much propaganda about what Muslims and Islam is. And so I was also being inundated with this Islamophobia, and that Islam is oppressive towards women. The hijab represents oppression. Women are treated as second-class citizens. The men are very aggressive, they're abusive. All of these things were also, despite me trying to challenge them, were also in the back of my mind. And so through that journey, I decided to wear the hijab when I was 19 years old. And I still continue to pursue journalism, but my own family, people in my network, they laughed at me. They actually mocked me and said, Manar, if you wear hijab, no one's gonna hire you. No one's gonna take you seriously. And I said, because you are telling this to me, it just put a fire under my feet even more. And it motivated me to be even more outspoken. And maybe that's just being a Palestinian woman, I don't know. But anyway, so I went on to pursue journalism despite everybody in my family and network telling me that I would never succeed. And I broke barriers. I became the first American woman to wear the hijab to anchor the media and in the news in the United States. And I worked in corporate media. I was a producer with Care 11, an NBC station here in Minneapolis. And it was there that I realized and recognized that it wasn't the mainstream media that I was striving to work for, because I would just look like everybody else, and I would just be like everybody else, and I would just parrot the same things like everybody else. And so that's when I went on to start my own after college, my own blog, Mint Press, and then I later, within a couple of years, through the support of my own networks, turned it into the global news source it is today. And so what I say for young people who are trying to pursue journalism is, the media industry, if you're trying to pursue journalism in corporate media, it's very difficult, number one, to get into in the first place. But I think it's more important to take an activist approach when you go into the media, because if you're just going to go and work in these news stations and these radio stations and major newspapers, and you're put on a beat, you have to really ask yourself, why are you pursuing journalism? Why are you trying to get on this path? If you are truly there to work as a journalist as defined by the US Constitution, by our First Amendment right, which is to be a voice for the people, which is to hold the government accountable, then you better, I personally say, you can be that advocate within corporate media, but you're gonna have a really, really tough time. And I think that you need to work within independent and alternative media, and also study international relations and public policy, because that's really good to have as a backbone within your educational background. And one last thing I was gonna say is, we as Muslims have been telling ourselves that our voices are not being heard within the media. And that's just pushing us to not be the media. It's pushing us not to amplify our voices. And so we have to get on our own soapbox and believe in the courage and that strength that we have. We have to believe in our own voice to get out there and to speak up. We have to stop being afraid of fitting in and just challenge whatever we need to challenge so that we can stand up for injustice. And even though our parents and our families, my parents didn't want me to be a journalist, they wanted me to be a dentist, a dermatologist, right? A lot of kids grow up in those kinds of families saying, no, we want you to be a lawyer or a doctor. And so we have to, and while those things are good, we have to also ask ourselves, what is it that we want to give back to society in our career path?
That's great. That's a great story. I'm going to ask Colonel, and then Medea to sum up the evening. If we missed anything that you wanted to say, if you don't mind just stating that now.
You want me to start?
Yes, sir.
I think we're at a crucial point right now. Given what we're doing with nuclear weapons, given what Putin is doing with nuclear weapons, we could destroy the world tomorrow morning easily between the two of us, and we could do it by an accident. For example, we could have a hacker in Texas sitting at a computer with his Diet Coke and hack into the nuclear codes and fire off a barrage of nuclear weapons, and the Russians would respond in kind. You think that's impossible? It is absolutely not impossible. Read Bill Perry and Tom Kalina's new book, The Button. Bill Perry was Bill Clinton's Secretary of Defense, the only engineer, I think, in my memory, to ever be Secretary of Defense. He knows what he's talking about. We are extremely, extremely dangerous right now with nuclear weapons, and we're going to spend $1 trillion plus to get some more of them. The second thing we're looking at that threatens the human race and its existence on this planet is climate change. It's coming with a vengeance. I'll probably be dead before you people are underwater, you younger ones, but you're going to be underwater, or you're going to be in a really bad situation because the way the climate is changing on this planet. The planet won't give a damn that it kicks us off or kills us, just like it did with the dinosaurs. The planet will go on for another 4 billion years, but we'll be gone as a species. These two existential crises that are confronting us right now are deadly, deadly serious. More even than the coronavirus or anything else that might come down the pike like that, because it at least leaves some humans alive. These two crises won't leave anything alive. And yet, look at us. We're broken. We're falling apart. The empire is disestablishing itself a little bit more every day. If we don't get our act together, if we don't help the rest of the world get their act together, all these problems we've talked about in the last hour or so are going to be overwhelmed by the reality of the destruction of the human race. These are two huge crises confronting us. And when do you hear the mainstream media talk about them at all, really? Serious stuff.
Thank you very much. I just want to give a plug to Abby Martin's movie on Gaza. Please buy it, rent it or buy it. It's an incredible movie. I think it's about 15, 16 bucks, is available on the in internet. And also Mehdi Hassan has done some excellent podcasts about the defense, the military, etc. Medea, you have the last word.
I think it's been a great conversation, Manar. I loved hearing your story. I hope it's inspiring to young people who are watching this evening. And I take to heart what Larry just said, and I love to listen to Larry wherever he's speaking. Sometimes I just Google Larry video and find anything that he's ever said and want to listen to it. He's so brilliant. And I wanted to leave us maybe on a bit of a more positive note, which is to say that there are some great campaigns like the Poor People's Campaign right now that is taking on exactly these issues that Martin Luther King talked about 50 years ago: poverty, racism, militarism, adding in the climate issue, as Larry has so eloquently just talked about, and saying that all of this necessitates a moral revival and calls on people of faith throughout this country to come together. And there are local groups of the Poor People's Campaign around this country. So anybody who wants to Google them and find a group in your community. I think it's one of the greatest examples of bringing together these issues that have come up tonight and turning them into an inspiring movement that brings all kinds of different people together to say, yes, we have to change who's in the White House, but it's bigger than that. We need a different view of how the society we want to build in the United States is built and how we want to interact with the rest of the world. So I'm delighted to have been part of this. And I think, Ali, you're part of that movement of revisioning. And thank you for taking your work as a doctor and seeing the health of the country and the health of the planet in this much broader perspective.
Thank you very much, Madam India, and that's a great way to end this town hall. I was absolutely humbled when I realized that I would be questioning people of your caliber. The three of you were absolutely amazing. I hope the other people in the audience learned as much as I did, because it was a ton. And also, we are extremely grateful to the audience also for staying with us, asking us these fantastic questions. It was an incredible 1.5 hours. And with that, I want to end the town hall, and I want to introduce to you all Maulana Abbas Elia, who has been in the board of trustees and the founding member of Muslim Congress. He's world renowned. He's the resident alim of Zainabia Center of Seattle. He travels all around the world. He's a skier. He does hang gliding. He's a spiritual guide for so many people around the world. Maulana, the floor is yours. Thank you very much. Good evening. Good night. Salam alaikum. Please go ahead.
Can you hear me? Is my voice?
Yes, we can hear you very clearly. Thank you. Please go ahead.
Bismillah ar-Rahman ar-Rahim. Alhamdulillah Rabbil Alameen. Wassalatu wassalam ala ashrafil anbiya wal mursalin wa khatimin nabiyyin sayyidina wa maulana Abil Qasim Muhammadin al-Mustafa wa ala alihi at-tayyibin at-tahirin al-ma'sumin wa ala ashabihi al-muntakhabin al-muntajabin واللعنة الدائمة على أعدائهم أجمعين. أما بعد، فقد قال الله تبارك وتعالى في كتابه الكريم: يا أيها الإنسان إنك كادح إلى ربك كدحا فملاقيه. It's a pleasure for all of us at Muslim Congress, the Board of Trustees, the Board of Directors, the volunteers, to have all of you respectable guests as our guests in this 16th annual Muslim Congress virtual conference. It won't be as successful as it is without your participation. I'm extremely thankful on behalf of the chairman of Muslim Congress, Hujjatul Islam Sayyid Sartaj Zaidi, and the entire board of trustees and the board of directors. I would like to extend gratitude to each and every person amongst you, especially our valuable panel, Colonel Larry Wilkerson, Medea Benjamin of Code Pink, and Minar Muhawish from Mint Press, for your valuable opinions and analysis. And I would like to thank all the scholars and alims who participated in our conference from different corners of the world. Hujjatul Islam, Sheikh Haider Shirazi, and Hujjatul Islam, Sayyid Ali Zaidi, and Hujjatul Islam, Sayyid Hadi Yasin, and Hujjatul Islam, Sayyid Ali Tawfiq. And I'm also very thankful to the organization of physicians called Imamiya Medics International for their role and their information that they provided to the community, to this broader audience from all over the US. And hopefully we have some participants from Europe as well. So all the medical advices that they gave in their workshop for the entire community. I would specifically like to thank Dr. Ali Musawi from New Jersey for his wonderful participation, role, and hard work and sincerity for the cause. And likewise, I would like to thank Dr. Nasir Hussain, Dr. Shujaat Ali Naqvi, Dr. Shujayat Ali, and likewise, I would like to thank Brother Sayyid Kazim and the various moderators that we had today in this conference, Zahra Beg, Zain Beg, Sister Reem Naqvi, Brother Raza Jafari, and last but not the least, Dr. Qamar Jafari from Texas. Dr. Qamar likewise has been a key to our conferences almost every single year of the Muslim Congress conference held every year. And I would like to request all the audience to, in order to pay respect from our own perspective, please recite a salawat for all of these honorable guests and all these volunteers. Allahumma salli ala Muhammad wa ali Muhammad. Also, another salawat is requested for all the moderators of this conference, please. Allahumma salli ala Muhammad wa ali Muhammad. We cannot thank you enough for your hard work, especially Dr. Musawi. I've been listening to the way you are, mashallah, professionally conducting these town halls. We are extremely thankful, and we pray Allah subhanahu wa ta'ala increases in his tawfiqat for you and your respectable family. The purpose of this conference, as you know, is to establish the values and to establish and to strive to establish a society which is based on the divine values. And this ayat of Holy Quran, just to end my speech on this point, is this ayat of Holy Quran is teaching us that, oh, you, the human, you are striving hard towards your Lord, and you're going to meet him. We all are in the pandemic situation of COVID-19, where we are for the most part, unable to travel in these times. But there's one travel that is still continuing, and that is our spiritual travel towards our Lord. And that spiritual travel requires the tools for its success. And those tools cannot belong to this world of matter, which is temporary. I recall my teacher, Ayatollah Jawadi Amuli Hafadahullah, was saying that everything other than the soul is temporary and an obstacle in the way of closeness to Allah. And all what is found on the planet Earth, all the material things, are going to depart us, the humans, before we depart them, and thus cannot serve as the necessary quote-unquote luggage, zad, that we are supposed to carry with us towards Allah subhanahu wa ta'ala in this constant travel towards him. So material belongings of this world are temporary and are adornment to this world, not to the human being. Whatever becomes part of soul can be the luggage, quote unquote, the zad that we can carry with us. And those are only two things: ma'rifat and iman on Allah subhanahu wa ta'ala, and actions that we do for the sake of Allah to acquire and attain his pleasure. So ma'rifat and taqwa are the real luggage that we are supposed to carry, the real zad that we are supposed to carry based on the Islamic value system. Again, to conclude, I'm very thankful to all of you, especially once again the board of directors who have been working so hard in various fields to make sure this conference takes place successfully all the volunteers that help them and are working hard likewise. On behalf of the chairman and the board of trustees, I would like to thank all of you. And I would like to thank each and every person amongst you, the participants, because without you, the conference would never be the same. At the end, let us recite dua of Imam Sahibul Zaman alayhi salam as we conclude this conference. Bismillahir Rahmanir Rahim. Allahumma kulli waliyyika al-Hujjat ibn al-Hasan salawatuka alayhi wa ala aba'ih fi hadhihi as-sa'ah wa fi kulli sa'ah waliyan wa hafidha wa qa'idan wa nasira wa dalilan wa ayna hatta tuskinahu ardaka taw'a wa tumatti'ahu fiha tawila برحمتك يا أرحم الراحمين. اللهم عرفني نفسك فإنك إن لم تعرفني نفسك لم أعرف نبيك. اللهم عرفني رسولك فإنك إن لم تعرفني رسولك لم أعرف حجتك. اللهم عرفني حجتك فإنك إن لم تعرفني حجتك ضللت عن ديني. Allahumma salli ala Muhammadin wa ali Muhammad. Thank you very much. Inshallah, see you next time in our upcoming next program of Muslim Congress and the next conference, inshallah, in 4th of July next year. Thank you, Imam.
Thank you, Maulana. And just to end it here now, I want to announce a poetry slam that we have planned for tomorrow. The details are going to come in the email and all our social media channels. Wassalamu alaikum wa rahmatullahi wa barakatuh.